introduction and for setting up this very important seminar. So just a few words of introduction from me. So I chair the Faculty of Public Health, Climate and Health Committee. And through the committee and also the Sustainable Development Specialist Interest Group, we run a series of meetings and seminars and conferences. And just by way of introduction, the overall aim of our strategy is to support and empower the workforce, advocacy and advising the faculty on meeting net zero commitments. Now, this conference, as Kat says, is focused on adapting to a warming world. And whatever we do now, whatever commitments we put in place now, the world is still going to warm up. So this is going to be a key part of our work in the coming years. And public health professionals are in many ways best placed here because we're good at working across sectors and organizational boundaries at every level, local, regional, national and international. So there's some objectives also for the seminar conference this morning. So we've got understanding and improving the direct and indirect consequences of climate change, raising awareness of the importance of adaptation to climate change, understanding the latest evidence and policy, and perhaps most importantly, some practical steps encouraging action at every level. So very much, while we've got theory, we're also looking at the practical steps, and the format of today's conference is very much with that in mind. So without further ado, I'm thrilled to welcome our first keynote speaker, which is Baroness Berrang of Cambridge, Professor Dame Julia King. Baroness Berrang was, as a background, is in British engineering and has a long career in engineering, particularly at Rolls-Royce. But I do remember her writing a key report in 2007 on low carbon cars, which must have been well ahead of its days. She's a crossbench member of the House of Lords. She chairs the House of Lords Committee on Science and Technology, and is a member of the UK Committee for Climate Change. And within that committee, she chairs the Adaptation Committee. She's also chair of the Carbon Trust as well. So we very much, Baroness Berrang, welcome you and look forward to giving us an overview of adaptation in the UK. Thank you very much.
Thank you very much indeed. And thank you very much for inviting me to do this. Keep your fingers crossed because I'm now going to share my screen. Ooh, looks like that might have worked. Can people see that?
Yep.
Brilliant. Okay, I shall get going then. So I want to give you a quick overview of adaptation in the UK as we see it from the Adaptation Committee of the Climate Change Committee. And just let me start by reminding people of what we've seen in the UK. Last year in the UK was a year of some very significant weather extremes. This plot is the record of the highest maximum temperature in central England. And of course, last year, we suddenly saw that jump to over 40 degrees centigrade. As you see, a significant jump from the record that had been tracking. And indeed, in a year that wasn't an El Nino year, it was a La Nina year still. So we might have expected that to have a cooling effect. And we saw a very significant jump in the number of excess heat-related deaths, as we had done in previous years, as we've done in previous years where we've had periods of heat waves. We also saw a very significant drought. It's been one of our driest summers. It was one of our driest summers on record. And that led last year to significant numbers of wildfires, record incidents of wildfires. And indeed, we heard last week that the dry conditions in Wales, a place where we tend to think is very wet, dry conditions in Wales have persisted and they've been suffering wildfires last week. And often in places that are a fire service is actually not used to having to deal with fires. They're much more used to buildings, so some experiencing some challenges in dealing with fires on farms and in the countryside. And not only did we have heat waves, drought and wildfires last year, but in January last year, we were still under the influence of a spate of really severe storms. And we had some people in the northeast of England and Scotland who were without electricity for periods of up to a week, around 1 million people. Now that's bad enough now, but by 2050, when almost everything we do will be powered by electricity, our cars, obviously our communications, our heating, our lighting, the pumping of our water, when our lives will be almost completely dependent on electricity, that sort of impact is going to be even more devastating for people than it is today. So it was a year that reminds us that the climate is changing and we need to take action about it. If we look at the average temperature, so that was maximum temperatures on that previous chart. This is average global temperatures, and this is where we are. This was about 2021, I think. This is Met Office data showing the temperature record of the changes relative to the end of the second half of the 19th century. And you can see that since the 1980s, we've just had this sort of inexorable rise in average temperatures. And the thing we all need to take on board is this is now on a different scale. And this is a Met Office projection of what temperatures could be like if we meet net zero in 2050 globally. So if we get to net zero in 2050 globally, we will see average temperatures around 2 degrees by 2050, and they will stabilize. But they only stabilize, of course, if we get to net zero. But if you look from 2020 to 2050, you see the temperature goes on rising, the average temperature goes on rising at about the same rate as it has been since the 1980s. So we've got another 30 years of these continuously rising average temperatures driving the dramatic changes in climate that we've been seeing. And those dramatic changes in climate are getting more severe. And indeed, the IPCC have said we are seeing more severe extremes than our models had been predicting. So there's a lot more of that to come, even if we are on the very best path for decarbonising globally. And if we're not on the best path, then this is the sort of thing we could expect, a temperature rise of perhaps even up to 4 degrees by the end of the century. But there, the temperature just goes on rising past 2050, something that we really don't want to see. So we've got baked into our system already, as was said in the introduction, quite a lot of climate change to come. So the yellow column that's highlighted here says these are the changes that are pretty much baked in, and actually whatever path we're on, this is probably the sort of average of what we'll see. So we've already seen about 1.2 degrees of average temperature rise. We're probably going to see another bit more than half a degree by mid-century, so we're probably going to be up to that close to 2 degrees. We see hot summers now. They're on somewhere between 10 to 25% chance of a heat wave type summer. By the mid-century, they will be typical summers. So the heat wave summers, the enhanced heat related deaths that we've been seeing, those are going to be typical summers, 50% chance that we see one of those every summer. Average summer rainfall is going to decrease. It could decrease by as much as 24% on average. But when it does come, it's more likely to come in short bursts of really intense rainfall. That is sort of tropical rainfall that causes surface water flooding, a real problem in our cities like London, where we've paved over everything. So the rainwater pours into people's basements and also into the underground, so stops some of our transport services. And of course, when it comes in those very short bursts, it's very difficult for dry ground to absorb that rain. So farmland doesn't get much benefit from those very intense short periods of rain. Average winter rainfall will increase. It overall gets wetter, but that average winter rainfall increasing will cause more river flooding and other challenges. And sea level goes on rising. could rise by as much as 37 centimeters from the levels that we have today, and of course giving us more problems on the coast and more problems with coastal flooding. So there's quite a lot of change going to come, and pretty much whatever we do, we're going to see that change. So we really do need to be planning for and expecting that. And we have had the hottest decade on record, but actually between now and 2050, every decade is going to be the hottest decade on record. We've seen record temperatures of 40.3 degrees C last summer. Average temperatures, we think of Northern Europe particularly as being somewhat protected from climate change impacts, but we now are seeing that average temperatures in Europe are rising faster than the global average. The WMO last year said they're rising twice as fast as the global average. And the empirical record for England now shows that down in the southeast corner, we're seeing maximum temperatures rising by something of the order of a degree per decade. That could even increase. So we could certainly be seeing maximum temperatures of 43 degrees, or even closer to 45 degrees by mid-century. These are perfectly conceivable outcomes with the data that we have and the modelling that's being done. So as you've heard, mitigation is essential. We've got to keep emissions down, but because emissions go on increasing until 2050 at best, until we meet net zero, we have to adapt as well. So mitigation drives the hazard. Mitigation reduces the hazard. So it reduces the amount of heating we get, and therefore the amount of flooding, drought, fire, sea level rise. But the actual climate risk people experience depends on how exposed they are to that hazard and how vulnerable they are to that hazard. So whether they live on the coast, for example, whether they're elderly or unwell, actually whether they have high income or a low income, how able they are to adapt. So adaptation is all about how do we reduce people's exposure or reduce their vulnerability. So we can reduce climate impacts by mitigating, we can reduce climate impacts by adapting. And generally we hear a lot more about mitigation and a lot less about adaptation, and yet adaptation is absolutely crucial. So we do have a process in place introduced by the Climate Change Act for dealing with adaptation in the UK, which is that every 5 years we have a climate change risk assessment. And in 2022, the government presented the climate change risk assessment, the most recent one, to Parliament. That climate change risk assessment is produced by the Climate Change Committee, pulling together all of the most recent evidence from the academic literature, from commissioned studies and analysis. We pull that together into a big technical report. And on the basis of that technical report, we give the government our independent advice on what the worst climate risks to the UK are and where they should be taking action. On the basis of that advice, the government publishes its climate change risk assessment, and that's laid in Parliament. I say that was done in 2022. And the year after that, the government then has to produce a national adaptation plan, which says what the government is going to do, what measures are going to be taken over the next 5 years to address the most significant climate risks. So we are currently waiting for the third national adaptation plan, which tends to be called NAP3. We've had 2 previous ones, and that will be presented to Parliament, and we are expecting it in summer this year. That could mean any time, I think, between now and the autumn. But very soon we should have the government's national adaptation plan. And then the Climate Change Committee, every 2 years, we do an assessment of how the UK is progressing in terms of adapting to climate change and how well the government is delivering on the commitments it makes in its plan. Now, this is all coordinated in government by DEFRA, but the National Adaptation Plan will have inputs from the Department of Health on the health-related aspects. So the work that the Climate Change Committee does is, as I said, it pulls together this comprehensive technical report every 5 years, which takes into account the latest climate predictions from the Met Office, all of the latest research from the academic base and from others that, if the insurance industry let us have their research, that kind of thing. We commission a whole range of reports. Last time we commissioned a report on wildfires, one on people's behaviour in response to in terms of responding to climate change. So all of that goes into the technical report. We produce national summaries and fact sheets for the different UK nations and for some different sectors of the economy. And then we also produce this independent advice report to government to advise it on what should be the priorities in the climate change risk assessment it presents to Parliament. So in the last climate change risk assessment, we refer to it as CCRA 3. There were there were 61 risks and opportunities from the changing climate that were identified. I've pulled out here the ones that are particularly relevant to health, and if they're red, they were seen as being areas where more action was needed now. If they're orange, and I hope you can just about tell the difference on the slide, they were areas where we needed to know more, so further investigation was needed. So we have been telling the government now for the last 15 years that we need to be doing more in relation to risks to health and well-being from high temperatures. We know, for example, in 2021 that we saw almost a 50% increase in heat-related deaths during the periods of high temperature in the summer that year. We typically see about 2,000 heat-related deaths, or deaths that are identified as being heat-related in the UK in the summer. In that year, we saw well over 3,000 excess deaths. I think when we see the data for last year, we may see there were even more. Our projections suggest we may get up to numbers like about 7,000 by 2050, and we need to be doing more to our buildings, our homes, in order that people can live more comfortably during these periods of very high temperatures. There are also, of course, some opportunities from the higher temperatures, which is that we should see a lower rate of cold-related deaths in the winter, but that's not a huge impact, unfortunately. It would be great if we were seeing a dramatic reduction, but we don't. We see a small improvement in cold-related deaths in the winter. We see, of course, risks to people and communities from flooding, both from the contaminated water, from the actual danger that they're in from the flood, but also enormous issue about mental health risk, particularly when people's personal belongings are destroyed, their family memories, but also when they're out of their homes for a long period of time. And we see a very, very much more marked impact on people on low incomes, people, for example, who may have homes with no insurance. And the longer people are out of their homes, the more marked the health impacts, and the longer term particularly those mental health impacts are on those people. We see risks to health and social care delivery from the extreme weather. Of course, things like, one of the critical things is that after flooding, people need support from doctors. Large numbers of GP surgeries in this country are in danger of flooding, and we should be looking to try and make sure we make those healthcare locations flood resilient. Clearly, prisons and schools, public buildings where we have a lot of people, some of whom may be vulnerable, people in prison who have very limited ability to move from one environment and to another, are a particular risk from extreme weather. Impacts on air quality due to the changes in the climate. I think this year we're seeing some elevated impacts on hay fever from the very hot, dry weather, and that's something that there's beginning to be more data about how the pollen in the air is going to be affected by the changing climate. So we shall see more evidence coming out on that. Growing risks from vector-borne diseases, so things like the increase we've seen in Lyme disease, we've started to see a number of dengue fever outbreaks in France. So something that could be coming here. Different kinds of mosquitoes that are now becoming, potentially could become acclimatized to the warmer climate in the UK. So new diseases that we've got to be watching out for. Risks to public health from climate change overseas. So people bringing new diseases to the UK, and risks from poor water quality, or indeed loss of water supply, for example, if the electricity fails or if water supply facilities are flooded. So a very wide range of risks that are, have direct impact on health. But of course, one of the other large risks we've seen is we're starting to see significant supply chain risks from climate change, both in the UK and overseas, and that particularly affects the food supply chain. So we may also be seeing, you know, limited access or significantly increased prices of healthy food, which could of course also affect health by indirectly from less healthy eating habits. We gave the government 61 risks and opportunities. We said last year that actually there were 8 that we felt they needed to take really immediate action on. That one of those was the risks to human health from exposure to heat, and we have now seen the change in building regulations for new buildings, so that they will have to take into account the fact that homes need to be able to stay cool in summer. But of course that doesn't cover all of the existing homes and buildings, and we have seen the introduction of the extreme weather warnings, the heat warnings by the Met Office. But of course, things like the risks to the food supply chain are also potentially a significant health impact, and risks from climate change overseas could also be health impacts. But these were just the 8 ones we felt the government needed to take immediate action on for a range of reasons. The 61 that I mentioned before were also part of our report to government. So in terms of those health and care system exposures, I think I've probably talked about these, but we see increased heat-related deaths in hot heat wave periods during the summer. Of course, we have particular issues with vulnerable people. We see a lot of our hospitals overheat, most hospital wards overheat, many care home settings overheat, and of course more and more people are receiving home-based care. So, and many of our homes in the UK will overheat in hot weather. We're seeing, as I've said before, the vector-borne diseases, issues of poor air and water quality. We're going to be seeing more challenges with water supply interruptions and the problems associated with flooding. I think we really do need to be thinking more about how vulnerable our health and social care assets are to things like high temperatures and flooding, particularly given how important they are during these periods of extreme weather. We also need emergency services, indeed all our services need to be very aware of their interdependencies. So climate impacts on local infrastructure like flooding can stop people from accessing particular places. We see impacts on the electricity system, so local transformers were overheating last year during the hot weather. That was cutting off electricity supplies. In some areas that can cut off the mobile phone coverage, so it can mean that communications break down. So local support services need to have a plan B. They need to understand what services they're dependent on. They need to know what they're going to do if those services fail in the event of climate effects. And we really do need to be thinking about the vulnerable, whether that's vulnerable because of poverty or vulnerable because of existing health conditions, because those people are significantly more impacted by climate change than the healthy and the affluent. So it's really important to have that understanding of the community. We did an assessment of how well prepared the UK is, a report to Parliament for the changing climate last summer. Oh, sorry, no, we did it in March this year. We did it in March this year ahead of the National Adaptation Programme, so the government could use it as an input to the National Adaptation Programme. And this is the assessment we provided for health. The inner ring shows whether plans and policies are in place. So in these two areas of protecting the population and the healthcare delivery during extreme weather, we said, well, we're beginning to see plans and policies being put in place. So we have seen the change in building regulations, for example, for homes. We're seeing changes in the way in the design requirements for building hospitals and things for the future. So we're starting to see plans and policies in place. We are not yet seeing the outer ring. We're not yet seeing that that's having any effect to improve our resilience. So we're hoping that that outer ring will start to go orange and then green in future years. But starting to see movement in policies and plans, but not yet enough happening. So we will be looking to the third National Adaptation Programme, to what the Department of Health particularly has put in as its submission, to see whether we think this situation should be improving in the future. So in our work last year, we gave the government 10 principles for good adaptation policy. This was designed for government policy, but it probably applies quite well to work that's being done locally. So the first absolute requirement, which we don't have in the UK, is that we need a vision for what a well-adapted UK would look like. And I think when you're doing anything in adaptation, you've got to start saying, well, what is the objective? What will success look like? What do I want the end point to be? Because it's very hard to measure progress unless you know where you're trying to get to. And that's one of the challenges we have with adaptation policy in the UK. Almost none of it identifies what the end point is meant to be. So secondly, any kind of policy or action needs to have adaptation thought about, needs to have it integrated into it. We need to recognize that 2 degrees of warming is likely to be with us by 2050. That's not a risk, that's a best case, so we have to plan for that. The risk is that by the end of the century, it could be much worse than that. So that's what needs to be on the risk register. We need to avoid what we call lock-in, so taking actions now that we know are going to be wrong in the future. So building in floodplains, for example, locks in a problem. We need to prepare for extremes, and the IPCC is telling us we're seeing more extremes, and they are more extreme than we were expecting. So we need to be prepared for extremes, not just for the average. We need to know who we're dependent on and how well prepared they are. So we need to look at the interdependencies. We need to recognize that not everything changes linearly. And so there will be thresholds where we get sudden changes in response, and where we possibly can, we need to try and understand what those are. We need to be looking at the inequality issues, vulnerability issues. That's extremely important. We need to see where there are opportunities from the warming climate. Sadly, they don't balance out the negatives. And we need to have proper funding and resourcing in place. And we need the metrics to be able to measure whether the actions we're taking are actually making a difference. And there are many areas where we're not collecting the right data at the moment. And this is just a great example of, at a national level, of the importance of working together to bring data together. This is the data sets, national data sets for social vulnerability, simply being brought together with the climate predictions for increasing maximum temperature in the UK, and what the important things you can do by bringing together data sets with climate projections is you can identify those deep brown areas on this map, which show these are the areas that are going to be, you're going to see the greatest vulnerability to very high temperatures. And I think we need to see more and more of this happening, and we're seeing it now happening at the level of towns and cities, where health authorities and and local authorities are working together to bring their data sets together to identify where they may have problems with particular communities, where they need to focus investment and support, for example. So really important things that are now we're starting to see happen. This is just a message that although we don't have very good economic data on adaptation actions and the benefits of them, where we do have that data, the benefit cost ratio looks pretty good. Adaptation actions, many adaptation actions are good investments, and we need more data, but these are investments that have a good payback. So just as a kind of bit of a summary, we have got to plan for continued rapid change to the UK's climate, at least until 2050, or definitely until 2050, hopefully not too much beyond then, but it could go on beyond there. So particularly if you're making long-term investment decisions like building new hospitals, you've got to consider a wide range of potential climate outcomes for the second half of the century. So you may not have to build something that can put up with the second half of the century temperatures now, but you may need to be thinking about how do you build something that is readily and cheaply adaptable as we get more understanding of how the climate is going to change in the second half of the century. So build in something that is readily upgradable at low cost, rather than there's going to be a huge cost of modification. We need to recognize that we're going to be pretty much at 2 degrees by 2050. It could be much worse beyond that, although we obviously hope it's not going to be. We need to combine emergency planning with embedding long-term prevention. It's not one or the other. We need to be doing both. We need to think of very much systems thinking, systems approach, and addressing really critical interdependencies and understanding how well prepared for climate change the services on which we depend are. We need to be looking out for the populations and communities that are most vulnerable, whether that's income-based, whether that's health-based or whatever, and making sure we can focus support on those areas. And clearly, to do that, collaboration and data sharing are absolutely critical to understand the risks and where we need to focus the greatest level of support. So useful resources, our assessment that we published in March of the UK's risk level, how we are doing, is on the climate change website. The third climate change risk assessment technical report is on a website called UK Climate Risk, and that has the chapter 5 of that is about health and communities. And oh, sorry, I've got that the wrong way around. The independent assessment of climate risk was our independent assessment that went with CCRA 3. That's on the climate change risk website. The technical report is on the UK Climate Risk website, and our report in March of where we are in terms of our adaptation preparations is also on the climate change website. So the climate change website, if you put in climate change committee, that website will come up. If you put in UK climate risk, then the climate risk website will come up. So those are good places to look for further information you might find useful. So at that point, I will stop. Thank you very much for listening.
Thank you very much, Baroness Brown. Really, I mean, fascinating and brilliant setting out the context for today. And I mean, in particular, I found it really useful to hear about the Climate Change Committee and its role and how it links with government and advice and the assessments, and also quite struck by how much there is to do still, and how important it is to keep this high on our agenda. My other thoughts were, I thought the 10 principles were really helpful, and I think maybe there's something here we can do with our at local level as well to use those principles, and the role of data I think is absolutely key as well. So are you okay for taking a few questions? We've got a couple.
Very happy
Yeah,
to take
excellent.
some questions.
Thanks very much. So
one of the things I've been really impressed actually is seeing what some some towns and cities have done with data sharing and bringing data together, particularly data about, you know, the locations of care homes, for example, the locations of roads that flood, the thinking about how would you, you know, in an emergency, how would you get to those care homes if the main road that leads to them is flooded? You know, this using the sort of geographical information systems type mapping approaches of bringing our knowledge of potential local climate outcomes into on top of where things are in a city, where particularly key locations are, and where particularly vulnerable communities or groups are, and using that in planning. And I think we're really starting to see that kind of some very positive developments in some areas. So I hope we'll see a lot more of that, and I'm sure you're all very much part of that kind of thinking.
Indeed, we've got some abstract presentations on local work later on in the conference, so we'll be hearing a little bit about that. But I think, as someone has just pointed out in the chat, it would be really good to share and make available if we are aware of good examples of data sharing. Perhaps that's something we could pick up outside the meeting. I've got at least 2 questions. So if I can go first to, I'll go to Anya Gopfer. Anya is our chair of the Sustainable Development SIG, Specialist Interest Group in the faculty that runs a large group of interested colleagues and is a very active group. Her question is around the vision that you set out in your 10 principles. And so I'll just quote saying she's finding it hard to articulate what the goal should be, and wonder if community resilience and therefore ability to deal with crises and shocks would be an important goal to aim for. And is this being discussed as part of adaptation planning nationally?
Absolutely. I think, you know, the resilience is a hugely important part of it, because there is only so much protection you can do. You can protect the people, hopefully, from the kind of average changes, but where we get extreme events, that then may well come into being a kind of resilience issue of how do you recover from those, because we aren't going to be able to afford, or indeed it may not even be technically possible to provide protection from extreme events. And I think, you know, it's a sort of, if you think about flooding, it may well be able to provide people beside a river. We may be able to provide barriers by the river, put in property level flood resilience measures, which will protect people from perhaps a 1 in 20-year flood, or even a 1 in 50-year flood, but there will be 1 in 200-year floods. And there we have to have, we have to know that people are resilient. That's different from being protected. And so those 2 aspects of adaptation are both critical, but and we need to recognize that neither of them is enough on their own. We absolutely need both. And building resilience isn't an excuse for saying, oh, we don't need to protect people where we can.
Yes, that's very helpful. Actually, sort of very much linked to that, someone was asking whether you are aware of towns and places that have got good adaptation plans that we could draw on locally, given that most of our participants are working locally. If that's not available right now, maybe we can follow it up after the conference.
I think,
and look at sharing. Yeah.
If we could follow up with the team at the Climate Change Committee, because we have had some great examples. I have in the back of my mind that Bristol might have been one of those, but I would, and I know that in Kent they've been doing some very good work, but I can't remember the very specific examples just off the top of my head, I'm afraid. So I may be doing some other places a grave disservice.
No, not at all. Let's pick that up after the conference. So that would be really helpful. The second question is very much on our minds as well, about how do we actually make change happen. So, as you rightly say, this is a partnership approach with key partners locally, nationally. Janet Horton is asking, what is your thinking about the best process of an integrated response and reaction, and who and what kind of group is best placed or should be championing the response? And I think this is about local as much as national.
Well, I think local authorities clearly play a key role, and we do talk to local authorities quite a bit, and clearly they want, in general they're very eager to be playing a role in this. One of their challenges, of course, is that they now don't have the funding, and we used to have a situation many years ago where local authorities had their whole range of key performance indicators they had to demonstrate to what's now the department DLUC in order to get their funding, and they used to have climate change measures there, and when that happened they had significant teams working on this, and when those in one of the reducing red tape things, when those measures were removed so they were no longer measured against their performance, of course funding for those teams dwindled, and we've seen much less local authorities having much less ability to make sure they have good and experienced teams in those areas. But certainly I've been working with the Cambridgeshire and Peterborough Combined Authority on their approach to climate change, both decarbonisation and adaptation, and I see a huge amount of willingness, and I do think they are well placed to be coordinating and bringing together the local actors who need to play. But we do need central government to be making sure that there is funding available for this, and I think do some of the target setting, and they provide the high level environment that enables this to happen.
Yeah, thank you. My next question is regarding that you mentioned about the success in changing new building regulations, and the question is, do you have any thoughts on what policy or change in regulations would look like for existing homes, and how would it best be implemented, and how could we ensure compliance? Any thoughts on that?
Well, one of the things that we would like to see is the government integrating adaptation into all its policies. And so, we have to put low carbon heat. We have to replace gas boilers in something like 29 million buildings in the UK. That's going to be relatively disruptive, as it will probably mean improving insulation very significantly. We think at the same time, we should be supporting people to take the measures that will enable them to keep their homes cool. So in some areas, in the centres of big cities like London, that may mean thinking about reversible heat pumps that can operate as air conditioning in the summer. In other areas, that may mean support for fitting blinds and shutters. Taking the example of Portugal or France, where when it's hot, you see all of the houses shuttered, whereas in the UK we tend to see all the windows open.
Yeah.
And also looking at at the same time looking at how we can improve through ventilation for homes and things like that. And also we do know that some of the ultra insulation initiatives have given rise to problems with indoor air quality and damp, so that needs to be very high up on the agenda as we're thinking about heat pump installation. So we'd like to see the support for heat pumps being that much, and insulation being that much broader support for thinking about the adaptation measures as well. Of course, some of this is getting the banks and the lenders to think about green loans and indeed green mortgages, so that those people who can afford to do it for themselves are being encouraged with lower interest loans to do the right things to future-proof their homes, not just on the mitigation side, but on the adaptation side as well. And also in thinking about valuing homes, we're starting to see that homes with better EPC, i.e. better insulated homes, are now being valued more highly on a street of identical homes and are more appealing to buyers. We need to get the message that homes that have already had things like shutters installed or appropriate ventilation systems should also come into that category, to try and encourage people to to make those modifications for themselves where they can afford to do so. And we'd also like to see when, when office buildings are being converted into flats and things like that, there being a requirement to take adaptation measures into account, which there isn't at the moment.
Yeah, no, that's helpful. Thank you. Ellen Schwartz is asking a question about the awareness and profile of the Climate Change Committee, and in particular, has the committee thought about a campaign to raise the awareness of the issues it's raising? And she sort of goes on to say, quite rightly, that maximising community support at all levels is essential in order to implement and maintain. We've got the political backing to move forward on climate change, and this is something that the committee has considered.
We do consider that. We unfortunately, the Climate Change Act doesn't give us that as one of our roles. Communication with the public is not something that's in our role in the Climate Change Act, and so it's not something we are funded to do. So we do put a lot of effort increasingly into trying to make sure our reports are as accessible as possible. Indeed, we produced a young person's report as part of our the CCRA3 materials to try and help families and schools communicate with young people. But we don't have funding for big public campaigns and things. So we have to lobby Parliament. We will not lobby, but we have to make recommendations like that to the government, which we regularly do.
Do you think that's something that could develop in the future? I mean, I recognise the framework in which you're operating, but is it something that may be of possible future development?
If we were funded to do it, I mean, I certainly know there's a real appetite to do more of it. But that's our challenge, that we are funded to do the things that are in the Climate Change Act. And a few years back, when government departments were all being asked to look at how they could reduce their costs by 20 or 50%, we had to defend our funding on the basis that we are required by law to do these things. So at the moment, we're in a slightly it's a slightly difficult position for us. We couldn't spend a significant amount on doing those things. Yeah,
no, thank you. Our next question is from Emma O'Connell. Emma is one of our very active consultants in this area, working with the Specialist Interest Group in particular and the committee. And she's asking, obviously the new National Resilience Framework reflects the need for strategy, strategic and long-term thinking. And working through local resilience fora. And she asked, what do you think are the opportunities and challenges of that approach working through LRFs?
I think we've felt that, I mean, local resilience fora are very important, hugely important. And we felt that in our looking at them in the past, that they have suffered from not the most effective data sharing. Not their fault, that there are lots of constraints on data sharing, and we do need to get much better in government at enabling people to share data sets in ways that don't breach any of the confidentiality issues and things. But we need much more focus on that and much more knowledge of how to do that locally. We felt that local resilience fora needed to be much better informed of what the potential issues they might have to respond to were.
Yeah, and just a question for me, actually, I'm interested to know, do you think, I mean, obviously we're all some of us very engaged and involved in the current COVID inquiry. Do you think there are spin-offs from looking at resilience generally from that inquiry to climate change?
I think it's been a fantastic wake-up call about the need to be prepared for significant events. We can't just assume they won't happen. So I think there will be absolutely a raised awareness of the need to be ready for quite a wide range of potential climate outcomes. So I think in general that there will be a benefit. I'm not sure about the specific benefits, although I do think that we did overcome some of the problems with sharing data and things like that under pressure because we had to. And I think it's very important we don't lose some of those things we realized we could do. And of course, things like being able to, the fact that we have all taken on board being able to communicate virtually and have appointments with doctors virtually and things. All of those things are potentially things that could be very useful in a climate-related emergency situation.
Yeah, absolutely. Thank you very much, Baroness Brown. I think we've come more or less to the end of the questions. There's a very good conversation going on in the chat as well, and sharing what we know already on adaptation. And Anya, who asked a question earlier, who chairs our SIG, has said that we have a new subgroup of the SIG working on adaptation planning as well. So please do email. There's an email in the chat to find out more information about that for those that are listening and interested. So thank you very much again. Thank you. Huge thank you.
If I could say to you, we have a small secretariat team on the adaptation committee. There will be things about what's going on that are really useful, that would be enormously useful to us to know, and which we could do some things to help promulgate examples of good practice in our reports. So we would be delighted to hear from you as well.
Okay, well that's fantastic. Yeah, I think that be a really good partnership for us, and particularly I will link on the with the team at the committee to follow up local examples as well. So that would be really brilliant. Helpful.
Yes. Yeah, thank you very much indeed. Thanks.
Thank you again. Thanks for your time. Much
good luck. Have a good meeting. Thank you.
Thank you very much. Thank you. So let's now move to our next presentation. And I think Andrew and Mike have joined. Andrew Mackenzie, can I just check? Yep. Hi, Andrew. Nice to see you. And I think your colleague Tim is joining as well. So the next presentation then is we're going to now look at, again, something a little bit different. We're going to be looking at the role of physiology in adapting to climate change. And I'm very pleased to introduce Andrew Mackenzie and also his colleague Mike Tipson. Sorry, I said another name earlier. Andrew is the Associate Director of Strategy and External Relations at the Physiological Society, and he's particularly responsible for developing and delivering the Society's strategy, which I'm sure we'll hear more of. The Society is Europe's largest community of physiologists, which I didn't know until recently, and he's going to take us through the physiological need to adapt to climate change. Andrew, over to you.
Thank you, Paul. Should I share my slides?
Please do. Yes, we've got them now. You might just want to go onto full screen. I don't know.
There we go. Is that better now?
That's it. We're there.
Great. Fantastic. Okay. Well, firstly, thank you for inviting Mike and I'll let Mike introduce himself in a moment when I pass on to him. Mike and I are going to do a bit of a double act. I'm going to do a bit of an introduction and then pass over to Mike. I work for the Physiological Society, but it's important to say I'm not actually a physiologist, whereas Mike is a bona fide physiologist, so we'll be able to go into a lot more detail and is really the star of the show. I'm very much the warm-up act. But maybe we just start with why the Physiological Society is interested in climate change and climate adaptation in particular as relevant to this morning's meeting. As we mentioned, the Physiological Society is a learned society, so we've been around for about 150 years. We bring together physiologists in the UK, but also right across the world, to advance the science of physiology and look at the areas of physiological research that are up and coming and really important for the future of the world. And both from a a sense that, like all organizations, we have a responsibility to act when it comes to climate change, and as a discipline, physiology has a responsibility to act. So that's one reason we're particularly interested in climate and health. The other is our members tell us that this is what they're interested in. And as Baroness Berrang went through some of the compelling data a moment ago, if you look at any of the opinion polls or any of the surveys, it's very clear that particularly younger generations, they see climate change as the single biggest issue that we are going to face. So any organization, any scientific discipline, ourselves included, should be making what we can do to try and address the big challenges coming down the track from climate a top priority. And that's why the Physiological Society is focusing on climate and health. So just a quick word on physiology and why it's relevant. So physiology is, for most people on the call will know and be aware, but it's the study of functions and mechanisms of living things. So fundamentally how the body works. And when thinking about climate adaptation, understanding what some of these changes, and some things are on the screen there about rising temperatures, air pollution, extreme events, the impact that these are having on the body, understanding why that is happening, what is happening, that's fundamental to coming up to strategies to try and address it. And what we're seeing is that an appreciation of a consideration of the physiological impact of climate change is increasing. It's now part of the conversation more than it was a few years ago. I think it's fair to say that probably is some way still to go. For example, I'm this week in Dublin at the European Climate Adaptation Conference. And as part of that conference, yes, physiological health impacts is part of it. I think probably it could be more integral. And I think we're definitely moving in the right direction, but I still think there's probably a way to go. And that's why it's great that Mike and I have had an invitation today to come along. And I know it's an important part of what the faculty does, and we've been involved in previous events that you've run. So physiology explains the impact of climate on the very future of our species, and that's why understanding physiology and everything that goes around thinking about the impact on the body is so important. So the Physiological Society really made this a priority not that long ago, which again reflects some of those changes in the prominence of physiology as a science in tackling these issues. But over the last couple of years, we've released several reports. We've worked with organizations like Wellcome Trust, who are putting a lot of money into the research in this area. And one of the things that we try to do is get the balance between providing advice and information rooted in the physiological evidence, but also highlighting there's a lot we don't still know. There's a lot of research gaps out there that are important to fill, particularly as the impact of climate change accelerates and becomes more severe. We've also got another a report and event planned towards the end of the year, looking at particularly heat on vulnerable populations. And so I think that will be of interest to many people on this call. And then my final slide before I hand over to Mike to go into more detail on some of the physiology is just giving a very brief overview of some of the areas where physiology is relevant. As I say, physiology explains what is going on in the body and therefore tells us the impact of some of these climate impacts on the human body, which allows us to think about ways when we're adapting that we can try and keep people healthy and safe. And one of the shifts we're certainly seeing is a move from people having to survive in extreme environments to having to live in extreme environments. And I think that's a shift as the world warms up, that the incidence of extreme events increases, having people to be able to continue to live and all the things that entails from birth through to death and everything in between, that becomes much more important. And the 5 broad areas on the slide here are thinking about thermal physiological principles. So how can we keep people cool without simply ramping up air conditioning systems? Baroness Brown's comments around building regulation, I think it's very pertinent. And I know from my own experience, I live in a new build house, which is fantastic in the winter because it stays really warm. It's awful in the summer because you can't get rid of the heat. And the worst thing to do would obviously be to have all these new build homes starting to have air conditioning systems. So how do we keep people cool? Focusing on protecting vulnerable populations. So we know from a physiological perspective, there are certain populations which are at more risk of health issues due to increased heat. There's an example up there around physiological pathways related to pregnancy and the impact on the fetus. So understanding more what is going on is really important. Getting sustainable, healthy diets that are nutritious and meet our needs, while also recognizing that actually it's going to be potentially quite difficult to grow some of the things we currently do in some parts of the world that we currently do. Thinking about effective countermeasures, so PPE for people working in extreme environments, early warning systems that flag when there are going to be heat waves, and also links in with some of the vulnerable population work around identifying actually there are certain groups we know are going to be more vulnerable, so let's give them the advice that from a physiological perspective is tailored to what they need. And then the final one around city and building design. So really looking to try and bring physiologists together with botanists, with architects, with the planners in local government to get to a place where we are designing cities that from a physiological perspective are rooted in our understanding of what the body needs to be comfortable, but done in a way that doesn't end up contributing to the very issue that we're trying to tackle by turning up the dial on climate change by, for example, as I mentioned at the start, putting a lot more air conditioning in. So that's everything I'm going to cover. I'm now going to hand over to Mike, who, like I said, he's the bona fide physiologist. So he's the one who will be able to go into more detail on the physiology going on here. Mike, I will hand over to you. Let me know when you want to move slides on.
Thank you, Andrew. Can you hear me? Yes, good. Okay, well, thank you, Andrew, for that. And good morning, everybody. And thank you to the faculty for inviting us to speak today. I'm Mike Tipton from the Extreme Environments Laboratory at the University of Portsmouth, where we focus on extreme environments. And I'm particularly going to concentrate on heat today and just tell you a little bit about what we do and how that might feed into the topic of today's conference. So we've already heard from Baroness Brown of the heat casualties, excess deaths in 2022 caused by the heat events. Indeed, on the 19th of July, when we got to 40.3 for the first time in Lincolnshire, there were actually 638 of those deaths occurred on that day. And the at-risk populations are the over 65s, particularly those with comorbidities, children, because their high surface area to mass ratio means they heat up quickly, those sleeping rough, those on various prescription drugs, and those working and having to work in PPE. And again, Baroness Brown mentioned PPE, and there are various groups that have to respond to some of these extreme environmental events by going out and doing things like working hard in warm air environments, wearing PPE. And the work of the applied physiologists has shown us that the time to heat illness in some of these conditions is around about 45 minutes. And that has implications for obviously manpower, for work rest scheduling, for provision of rehydration, et cetera, et cetera. So the determination of the conditions that are safe and acceptable to humans is underpinned by an understanding of physiology and pathophysiology of temperature regulation. I want to give you some more examples of that now. Next slide, please. And that impact on physical work capacity extends to those actually working in hot environments and warming environments. We know that a mild heat stress can decrease physical work capacity by about 10%, and extreme heat stress by up to 78%. And we're starting to look at the impact of that decrease in physical work capacity on occupational productivity and the resulting costs from that reduction in productivity. And so we're starting to see modeling of those impacts as related to climate change on occupational productivity. And I think that's going to be an interesting and important area going forward. Next slide, please. We understand the progression from physiology to pathophysiology as the body temperature increases, going through dehydration, which is an important additional and augmenting problem associated with being in a hot environment, going up to heat exhaustion that we've just touched on, and then finally the acute medical emergency of heat stroke, and what we can do about that and how we have to go about cooling people. Next slide, please, Andrew. This slide shows the cooling power of different interventions that you can use. And those that are based on an understanding of the physiology of temperature regulation, the fact that the deep body temperature predominates when you get hot, so you can put small surface areas of the skin into cold environments, cold water, for example, and you'll still perfuse those areas and deliver heat into those areas, means that we can adopt strategies such as just simply immersing hands into cool water, and by that method lose more heat than we can lose with ice vests, with liquid conditioned garments, and even air conditioned garments. So an understanding of how the body works, the physiology of temperature regulation, allows us to introduce mitigations to increasing core temperature that are not only physiologically sound, allowing the body to deliver heat to the surface of the skin and gently taking it away, but also, of course, the environmental cost associated with these simple interventions is much less than those that require refrigeration and pumping. Next slide, please. And I thought, just to lighten the mood for a moment, just to prove that it works, there's been several Olympic gold medals have been due to people just simply sticking their hands into cold water, and there's some examples of them there. Next slide. So this slide from Ollie Gibson at Brunel summarizes the human acclimatization or acclimation to heat. It normally takes around about 10 to 14 days to occur, preferably with exercise in a representative environment. And you can summarize those adaptations by the fact that you get improved salt balance, greater cardiovascular stability, better thermoregulation, greater cellular tolerance to heat, improved work capacity, and improved thermal comfort. There's a limit to how far they can go, but an understanding of the fact that people can acclimatize to cold, an understanding of the differences between individuals and their ability to adapt to cold, depending on their health status, their fitness status, etc., gives you some wiggle room in terms of the adaptation and strategies that you might introduce in a warming environment. One of the important consequences you can see just on the right of that slide is thermal sensation, thermal comfort, and changes in your perception of the temperature of the environment and changes in your thermal comfort in that environment. Can we go on to the next slide, please? So behavior is driven by your perception of thermal comfort. And whilst the physiological adaptation definitely makes a significant improvement in your ability to tolerate heat, your perception of the environment is going to be the thing that drives you to do something. It's also going to be the perception that links into well-being that's already been mentioned by Baroness Brown. So an understanding of the determinants of human thermal comfort is a prerequisite for the design of acceptable environments. I'm not sure how many people on this particular conference meeting would understand that actually anybody anywhere on the planet who professes to be thermally comfortable is very likely to have a mean skin temperature of 33 degrees Celsius within 0.1 or 0.2 of a degree. And that mean skin temperature is the mean skin temperature you have if you're naked in a 28-degree air environment with a deep body temperature of 37. So what we tend to do as humans is recreate next to our skin the environment in which we evolved, an Eastern African environment. So just knowing that you need to try and be aiming at a mean skin temperature of 33 degrees is one of an objective that one would have in designing an acceptable environment. It's slightly more complicated because different areas of the body have different sensitivities in terms of their input to thermal comfort. For example, the hands and the feet are particularly sensitive to determining overall thermal comfort, as you can see in the graph below, where much of the body is reasonably comfortable, but if the hands and feet are uncomfortably hot or cold, then it leads to an overall conclusion that somebody is uncomfortable. So perhaps the Romans had it right with underfloor heating. Next slide, please. And finally, how you go about achieving an environment that is comfortable and can have a significant impact on greenhouse gas emissions. This is from some work of Professor Ollie J in Australia. And we see that if you increase air movement across the body, you increase the threshold at which air conditioning is switched on. So on the far left of this graph, you see the greenhouse gas emissions of having no air movement across the body. And as you increase the amount of air movement up to a maximum of 1.2 meters per second, you're decreasing greenhouse gas emissions by around about 75% because you're offsetting the point at which people go to air conditioning. Next slide, please, Andrew. So an understanding of how the body works normally and responds to challenge is, I would argue, a prerequisite for the maintenance of health, optimal capability and comfort. And that understanding comes from physiology. And I want to make a clear distinction here between the work of a group such as the Lancet Commission that are looking at health. This is much more to do with the physiology, in this case, of temperature regulation. We could have a physiologist here talking about any of the other areas that Andrew has mentioned, but in this particular context, we're talking about the physiology of temperature regulation and how an understanding of that physiology alters the way you go about protecting people, treating people, and designing indoor and outdoor environments. Thank you for your attention.
Thank you very much, Mike. And Andrew, was there anything else you wanted to say before we move to Q&As? That's all right with you? No? Okay, good. So, no, fantastic. Thank you. And it's really good, first of all, to hear about the society and its work, actually. And I don't think many of us are perhaps that aware, but it was really good to have that context. And also, Mike, the science behind physiology and air and cooling equipment, I think is really really valuable and really helpful. I'm just going to open up to a few Q&As. I'm assuming you're both happy to take questions. I should have asked before, but yeah, great. There is so the first question comes from Gesh Hubner, who says there is a population level evidence of a link between heat waves and suicides. Which physiological pathways may contribute to this link? Quite a big question. I don't know whether you're able to answer that.
Thank you for the question. I mean, the answer is completely speculative, but we know that when you get hot, and indeed when you get cold and when you get hypoxic, the first major organ to be affected is the brain. And with heat, eventually people become semi-conscious and unconscious, but as they're going towards that, they become agitated, they can have personality changes, and you know, they can have alterations in their cognitive function. So it's purely speculation because it's not my area of research, but we do know that as people warm up, they get a change in their cognition. and maybe that contributes to it. I mean, the other, I suppose, it's not very intuitive, but you get an increase in the number of drownings once air temperature gets above 30 degrees Celsius, which, as I say, is somewhat counterintuitive, but that's because people become so desperate to cool off that they start throwing themselves into rivers and lakes, and at this time of year in particular, those water surfaces are very cold and will evoke responses that are hazardous. So these things are linked in many different ways.
Indeed, yeah, very helpful. Thank you. And I've got a question from Emma O'Connell. This, I'll just read it straight, which is: much of the physiological evidence we have is based on healthy young people. Are you aware of work that has been done on vulnerable people, for example, to help us determine a safe threshold for indoor temperatures?
Yeah, it's a good question, and there has been limited work, but I'll come on to that in a moment. But I mean, the first point to make is you're absolutely right, Emma, that quite a lot of the evidence that we have, and therefore the conclusions we reach, are based on a very specific population, often white, 18 to 40-year-old, often men, fairly affluent, and being exposed between the hours of 9 a.m. and 6 p.m. So one of the gaps in the research that Andrew alluded to is to look at more vulnerable populations, and particularly over chronic exposures. You can imagine why there aren't very many experiments that have run for 2 or 3 days with elderly people in the heat, because the ethics and logistics associated with that are fairly daunting. The work that has been done, and there has been some work done on prepubescent children, healthy adults and healthy elderly, show that there's not that much difference between children in terms of their thermoregulatory capabilities and adults. There's some. Their major differences are actually going to be morphological and anatomical. Children are smaller, so they cool more quickly, or they heat up more quickly because of their surface area to mass ratio. The elderly, however, tend to have a delayed response to increasing temperature and a weakened response. So their chance of maintaining their deep body temperature is reduced. So there are definitely differences that come with age. There are various differences that come with different racial groups, but these are relatively under-researched, and it's part of the call that the Physiological Society has put out in terms of its gaps analysis, in terms of research that's required.
Thank you. The next question I've got is from Rebecca Masters. It's a bit of an open question, and I think you might have covered it before, but first of all, we're all, really grateful for a fascinating talk. Can you indicate what key health issues you foresee from increasing temperatures in the UK? And I think probably the question is more specifically to you as physiologists. What do you think are the challenges?
I kind of touched on it in terms of my presentation and in the response to the questions, but I think they'll vary. We've heard there's the difference between an increase in average temperature and the extreme weather events. So the extreme weather events of, in this case, heat waves we're talking about, are likely to become more frequent, more severe, and of longer duration. And they will have, in particular, through the impact that has on hydration levels, the challenged population will be the over 65s, particularly with those with comorbidities. And as I say, their problem isn't the fact that they have a problem from the direct effects of heating. It's the indirect effects of heating, the dehydration, the respiratory and cardiovascular problems associated with that. And I spend a lot of time in heat waves on the media making sure that people look after their elderly relatives. And in fact, 80 to 90% of the deaths that you've heard about on a couple of occasions now that occur in heat waves are in that population. and particularly those that are either with comorbidities or on prescription drugs that impair their temperature regulation system or stimulate their metabolism, depending on their issue. So that's going to be a growing group that we have to keep a close eye on, and there's a whole host of recommendations to how to look after those individuals. The next big group will be people who are forced to work in those environments. So that's people who are going to still have to fight fires, are still going to have to rescue people from floods. The simulations we did in the lab at Portsmouth, the Extreme Environments Lab at Portsmouth, with air temperatures that were only really moderate, but they were taken from real life flooding events. As I say, meant that people just working moderately hard trying to rescue people where they have to wear PPE because of the contaminated water they're in, resulted in core temperatures approaching 41 degrees Celsius, or predicted to, within 45 minutes. So we're going to have to keep a close eye on the cooling, the hydration, and the work rest scheduling of those individuals. I think other than that, it's going to be a large swathe of people who are just going to be pretty uncomfortable and for long periods. And the degree to which that feeds into something like mental health and mental well-being, I don't think we understand, but I'm fairly certain that it's not a reasonable hypothesis to say that it does.
And Paul, if I could just add, I think there's a couple of things spring to mind. One is there's no one size fits all approach. So thinking about local context in terms of obviously things like geography, but physiology is another thing that has to be considered, as Mike has said. And the other point is, it feels like, given the accelerated interest, we're coming to an inflection point where our response could either ingrain some of the inequalities that we have seen and we have lived through, and make the problem worse. You know, an obvious example is how we deal with the planning and the urban environment. If we go down the route of the response to increasing heat waves in the UK, of people who can afford air conditioning getting air conditioning, then obviously that exacerbates inequality and also makes the root cause of the problem worse. So thinking about how we respond as a country in a way that is equitable and actually is designed for the long term, that we're not, and something that Baroness Brown said that struck me, you know, it's very easy to go down a route of short term trying to fix a problem when baking in more problems in the longer term. So we need to make sure that we don't do that.
Can I just add to that finally? Yeah, absolutely. And I'm sure there are people much better qualified than me on this during the course of the day to talk about, you know, urban developments and designs and Mediterranean lifestyles and shutters, which we've already heard about. And I don't disagree with any of that. But of course, the other thing is that, you know, heat climatization, for example, is not something, or heat tolerance or resilience is not something you look at in isolation. It's got to be part of a bigger strategy to make our population healthier and fitter, because a healthy, fitter population does better in the heat. And at the moment, you know, this is why we need to join up these policies with policies on activity in children, physicality, you know, because you know, these two, there are a whole list of you know, predisposing factors to heat related illness, and really fairly high up on that list is a lack of physical fitness.
Absolutely, Mike. Yeah, something I'm sure we would all identify with in us in public health as well. So I just got, I know the questions keep coming in, but we are getting a little bit short of time. But there's one point I wanted just to pick up from an earlier point you said, Mike, about swimming pools, and it's a more general one about public messaging and media, and joining up perhaps more our messages on climate change and the co-benefits of health, co-benefits of interventions to improve health. So is there, and perhaps for Andrew as well, I mean, is a society, does it have an active media plan? Is there something that we can help with? Is there something we can do about raising the profile of, you know, the important messages you've been covering this morning?
Andrew, I mean, yes, I mean, I can talk and then Andrew can come back for the society.
Yeah, sure.
I mean, yeah, we work in all areas. So you'll have seen adverts going out in the last month from the Royal National Lifeboat Institution about float first when you go into the water, and that is all underpinned by physiological research, which we've done at the Extreme Environments Laboratory, and get your breathing under control, etc., etc. So there is messaging going out. From our point of view, it goes out through the specific organization that we're working with. So in that case, it's the RNLI. There's also messaging that goes out through the Physiological Society, and Andrew, I think, has mentioned the Climate Change Hub and the website, where there's lots of information on there. And I know that the Physiological Society have, for example, worked closely with both our university public relations individuals and the RNLI to cement that message. Andrew, do you want to add to that?
Yeah, we have on our Climate Change Hub, we've got some animations we produced, which alongside the reports and the more scientific work. The main route that we try and communicate our messages, though, is by working with other organisations like yourself. We're very conscious that the Physiological Society does not have a high public profile. By definition, we're a learned society. We're a fairly unique group. So we try and work with others that do have more of that public-facing remit to try and really say, well, actually, we need to get the physiological implications and causes at the root of discussions around what the problems are, but crucially, what the solutions should be.
Yeah, absolutely, and maybe we can they can join forces as well with you, with the I mean, in the faculty we have a specialist interest group and a committee with a lot of enthusiastic colleagues willing, I'm sure, to join forces. So maybe that's something we can pick up outside the meeting. But let me say, first of all, a huge thank you. That was a fascinating presentation, and I think it's brought to mind perhaps areas we haven't thought much about, certainly up until now. I'm thinking of, like, for example, the role of fans and air conditioning, which we don't really haven't done very much on. So let me thank you, and I'm sure on behalf of everyone here, we'll give you a virtual clap, and thank you for your time. I should just say that I think, are you happy for us to share the slides? I meant to ask beforehand, but no, good. So we'll share both Baroness Brown's slides and Andrew's slides. Also, just to say, I love some of there's some new material that you put into the chat, which I don't think we're aware of. So we need to put this onto our resources website so that we can share practice as well. So that's something that we can pick up, I'm sure, as the day goes through. And so we finished now, bang on time. We've got a 15-minute break, and then I'm going to hand to Kat, who is going to chair the next session, and then on to Sue, who's going to chair the round table before lunch. So thanks again, everyone. Thanks for your questions, and thanks, Mike and Andrew, as well, for a fascinating presentation. See you in 15 minutes. Quarter to 11. Thank you.
Thank you. Thanks.
Hello, everyone. I think we are back, or we should be back, after a very short comfort break. It's a pity that we are not in person and can't have some tea and biscuits, but I hope you had a chance to get your eyes to rest after looking on screen. And now we are moving on to our next session with Dr. Agostinho Sousa, who is the head of the Extreme Events and Health Protection at the UK Health Security Agency. So I think Agostinho is here with us, and welcome, and the floor is yours. Thank you very much.
Thank you, Kat. And first, I would like to thank the Faculty of Public Health for this invitation. I will just bear with me a second, because first, like, technical aspects needs to be taken care of first. Kat, can you confirm if you can see the slides?
Yes, we can, and it's in presenter mode. Thank you.
Okay, thank you very much. So once again, thank you, Kat, and thank you, the Faculty of Public Health, for inviting me to speak today in this really important conference. Today, I will speak a bit about the adapting to extreme events, but where I will focus most of my time is on the presentation of adverse weather and health plan. That's pretty much the strategy that we have in place in the UK Health Security Agency to start this adaptation, not really start, but improve our adaptation to extreme events in England. And I will speak as the head of extreme events and health protection. But I will also throughout the presentation do some comments more in terms of resilience and how we are responding to these new set of challenges in this country. I will not spend too much time on the context that was already done today. I will just underline that what we do as UKHSA tackles some of the key aspects that requires more focus and attention to adapt to climate change. And some of the things we do as some of the highest benefit to cost ratios as defined in the monetary evaluation of risks and opportunities in the CRA3, mainly improvement of heat alerts and heatwave planning, improvement of early warning systems, and even preparing and developing capacity building events. Also to underline something that was already mentioned today, the impacts from heat already has a considerable economical cost to the UK itself, not only to England, currently estimated around £6 billion per year, but these amounts will probably increase quite considerably by the 2080s. I also adding that the impacts from cold were also increased mainly to the fact that we have a population that is growing older, so we'll probably see an increase in admissions and mortality due to these more adverse and extreme weather events in the near future. So in the first strategy for climate adaptation reporting and the National Adaptation Programme, the time the Public Health England was commissioned to develop an adverse weather and health plan by 2021. However, this was postponed due to the COVID-19 pandemic. So then we committed back in 2021 to develop this plan by 2023. And it was exactly to tackle some of the priorities already mentioned. That was the rising of temperatures and the impact from flooding that may be exacerbated through climate change. However, I also want to flag another important mechanism that currently exists in the UK, that is the National Risk Register, that pretty much defines the priorities in terms of risks from a group of different hazards. And in the National Risk of 2020, we can see that both the impacts of low temperatures and heat waves are already quite high, but also the likelihood was quite certain. It's quite interesting because there was still a medium high likelihood, but what we saw in 2022 really provided the example that these kinds of events, extreme events, mainly on heat, are no longer a possibility or probable. They are now a certainty that these kind of events can happen in the UK. So last summer, we had the first level for heat health alert. The first red news was of the Met Office for Extreme Heat. We never faced temperatures above 40 degrees. And these pretty much, I would say that this is the canary in the mine that pretty much inform all the nation. Climate change is here, extreme heat is here. So something that was a possibility now is something that is a certainty. So this will require lots of work to face an event that we never faced before. And then it's had its own impacts. The summer of 2022 was the one where we observed the highest level of mortality in pretty much in registered history, at least since the implementation of the heatwave plan. And we can see that these kind of events, the extreme heat and adverse heat events, while they were not frequent in the past, we can see that in the last few years, the mortality since 2016 was around an excess mortality of 1,000 deaths. Right now, we are already touching the 3,000 deaths per year. So from the level 4, you can see that by an increase of average temperatures around 30, 34 degrees, we can see directly a correlation with an increase in mortality. However, I also want to underline that it's not only with high increases of temperature that we see mortality, which correlates and matches with the evidence that currently have available, but also more long periods of average temperatures that doesn't see this spike can also lead to high levels of mortality. So while what we consider the level 2 periods didn't have such high levels of mortality, because we pretty much considered the level 4 period quite short, quite high values. The problems are also these more average temperatures of around 30 to 32 degrees that can also lead to high values of mortality during a longer period of time. Something also for reflection, and this is in our heat mortality report that was released on June 1st, is that although it's not statistically significant that we observe that our actions led to a decrease in mortality, we still have a certain degree of confidence that is possible that by taking these actions, the working with the media, the work with the ORCOMs, the broader work of governmental and non-governmental institutions led to a decrease in the impacts from heat. We will need to do a bit more of research in this area, but we have some data that encouraging us to say that by establishing proper measures to incentivize the population to adapt to this kind of events, we may see the lower levels of mortality than the ones that we'll be expecting. So this was pretty much the global overview. And in order to tackle these challenges, we created an adverse weather and health plan. The adverse weather and health plan was published in April 2023, on the 27th of April. So a lot of the reports that came out in the last few months saying that there is the need for better planning, more guidance, we pretty much tackle all of these matters, or at least a great number of them, in the last 2 months. So, as I mentioned before, this was a commitment from UKHSA to meet the requirements of the second National Adaptation Programme and also the UK Health Security Agency remit letter commitment. And this is a plan that I would say that there is no similar plan at global level. It's a really ambitious plan. It's truly a plan that defines goals, objectives of the direction that we want to go in terms, not only response, but really building community resilience to face this kind of adverse weather events. So in the past, you're probably aware, we had a heatwave plan for England and a cold weather plan for England. Those two plans no longer exist. They transit to the adverse weather and health plan, but we didn't do a merge of the two plans, and that's the adverse weather and health plan. We really went not one step forward, several steps forward in order to create a better and improved version of what we want to do. So this, in comparison with the previous plans, this new adverse weather and health plan has a specific strategy, specific goals and objectives, an yearly operational timeline, a monitoring and evaluation framework, the development of a quality management system, a formal annual review process, the definition of the delivery groups, That was a challenge in the past, where we specify who does what and sometimes when, from the national, regional, local levels, even the third sector, even other governmental departments that are working in this area. So this is one of the mapping exercises that I don't believe that any other nation in the world has this as well as defined as we have right now in England. And again, a clearer focus on resilience, because we will not be able to tackle a lot of these challenges without thinking in preventing these problems in the first place. Another difference from the previous plans is that the heatwave plan and the cold weather plan were not really plans at the one sense. They were plans, they were guidance, they were evidence, they were the definition of the weather alert systems all at once. And this was creating some confusion because the plan is not really a plan, it's guidance. So we really define the plan is a plan. And then we divided in other several sections, a group of guidance. The evidence will have its own document that will link directly with the guidance, the plan, and with the weather health alert system that was also implemented on the 1st of June, but more on that later. So these are part of the products of the OP, but there will also be other products released and being worked right now in the Center for Climate and Health Security that I will mention later on, that will support the implementation of this work. But as I mentioned, more on that later. So what is in the adverse weather and health plan? I will not go over the 50 pages of the document in detail. I'll just provide you a general overview of the areas that I believe it's more relevance to this forum. One thing that was mentioned today, it's what we want, what is our goal, what is our strategy, and pretty much we try to define that as much as we could in the plan. The plan has 4 goals. That is not only to prevent mortality and morbidity and reduce the use of healthcare services, but introducing another concept that is to prevent premature mortality, so prevent increasing the years of life lost to adverse weather events. So we are not only focused on the big numbers of mortality, but also how can we avoid that mortality in younger ages. We also define a set of principles on how we are going to implement the plan. When we develop this, we mentioned that we need to develop this with a high level of quality. We need to be certain that what we are doing is having an impact at different levels. So we started developing this plan with a framework of principles of the ISO 9001-2015, that is the quality management systems standard. We define 7 principles that you can see on the screen, and these principles are mentioned throughout the document, and this allows us to create a framework of quality that will improve our products and services in the future. Regarding the objectives, we have 9 objectives in alignment with 9 action areas of the document. So pretty much this is how the plan is going to be implemented. Just to underline, UKHSA is not responsible for implementing everything that is in the plan. This requires joint action and joint collaboration with the delivery groups throughout the government, throughout the society. But we developed the framework exactly on different areas of action that we can intervene to guarantee that what we are doing will have an impact. On the delivery groups, I already mentioned this before, but just to underline that the definition of the different partners on what we are doing, who is responsible, who is accountable, is defined in the Appendix 1 of the OP. Is the part of the plan that is the longest, the most detailed, exactly to be clear on the level of responsibilities that all of us have in adapting to these adverse weather events. As I mentioned before, we also have yearly timeline. So while in the past it was not clear when our sessions were being held or when the reports are going to be published, we're right now quite clear about when the things were going to happen. So you can also see in the slide some of the key events that will be held until the end of March. So this is pretty much a save the dates. So if you are interested in attending any of these events, you will receive more information in the near future. Another key change, as I mentioned, is the monitoring and evaluation framework, something that we developed and that I think is quite an innovation that's worldwide, is the linking between our monitoring indicators with the 2030 Agenda, the Sustainable Development Goals, and with the Sendai framework indicators. We also define the sources of information that we are going to use, when we are going to collect the data, and it's in your plan to release a public real-time monitoring platform where people can follow up on the implementation of our activities and indicators that are being collected and then present that information publicly. Another key area that is a quite huge difference. This was mentioned in the plans in the past that we needed to create a report, but it was not possible to do that publicly. And that is something that we define as a priority, that is to not only to develop a mid-year report, but also an annual report regarding the implementation of the Adverse Weather and Health Plan, and for that plan to be shared publicly. Regarding sustainability, we also mentioned, and this is not only for the public, but also to the government and our partners, that by investing and by supporting the implementation of this plan, we'll probably have a huge return from the investment that we're doing in this area. And by 2025, we'll add a chapter on cost effectiveness of our measures to really demonstrate that the investment that the government and the population are doing in the implementation of this plan is also providing economical returns. So in terms of evidence, this is another document that was produced, that was a merge of two making the case plans for heatwave plan and for the cold weather plan. And we merge these documents together. But again, we didn't stop there. We were even more ambitious about what we want to do with the supporting evidence. This will not be a document updated every 10 years. This is going to be a document updated every year with the best evidence that exists. And now that evidence will link with the development of the plan and with the development of guidance. So we have a specific subteam within the extreme events that pretty much follows a specific methodology in order to have in the document itself the best evidence available to support action in England to face adverse weather. It was also mentioned that we need more guidance and we need more advice, we need more research on what you're seeing on the screen on the populations at risk, addressing health inequalities. You can already find a lot of information on the supporting evidence. There is also something that is also an innovation, that is the recommendations mapping. One thing that we felt within the team is that we are doing the same research over and over and over again. We know that we need to adapt to extreme heat. We know that this is challenging. We know a series of things, and we are entering this cycle of producing the same recommendations over and over again. So what we did with the recommendations is to be clear about what are the recommendations that already exist. I think, and this is the biggest challenge, how do we move the recommendations from recommendations to really be action and to implement those recommendations at different levels, at the national, regional, and local level. So pretty much we didn't establish any priorities. We just presented what already exists, what is already in official policy. This supports then our next plan, that is really identify the recommendations that we can implement with the resources that we have available in order to be clear about research priorities and about what we need to do in the short, medium, and long term to face this challenge. Another product that we released that was also in development for several years was a new weather health alert system. You probably already saw that on the news, and I believe a lot of you are already receiving the alerts in your inbox, and you also see in the dashboard. So we transit from a level-based alert system to an impact-based alert system to be aligned with the NISWAS system of the Met Office. We expanding the duration of the heat health alerts from the 1st of June to 15th of September to now be the 1st of June to the 30th of September, because we also see the temperatures being quite high by the end of September. And this also allows us to be more focused on the impacts and not only on temperature thresholds as it was defined in the past. We still use temperature thresholds as some guidance, but what we are more concerned is about the impacts from heat on health. And now then we can support the cross-governmental response to really ensure that we're effective on what we do. So these alerts are defined in the Appendix 6 of the OP. There is also a weather and health alert system manual that you can also access in gov.uk. These alerts are developed in partnership and implemented in partnership too with the Met Office. So this is one of the best examples, again, at global level on the collaboration between the Public Health Institute and the Meteorological Institute to implement actions and to really inform the government, the public, the health and care sectors about what is required to do when we see periods of high temperatures. The dashboard, as I mentioned, is already available. The link is on the website, but if you search for Weather Health Alert System, it will be easy for you to find the dashboard, and it provides awareness on the current alert status and the regional assessment of impacts. It also sends an email that specifies what are the required actions from the different sectors and what the outline of impacts might be expected, and also provides more information on where to find guidance and action cards. As I mentioned before, there is disalignment of the UKHSA and the Met Office heat health alert systems. This is a work in progress. This is the first year that we are implementing the heat health alert system in collaboration with the extreme heat. However, the most important thing that I want to mention is that this process is always developed in close collaboration with Met Office. We have an excellent relationship with Met Office in really to alert the population when relevant to really decrease the impacts from heat on health. Regarding guidance, I also have some good news on this sphere. This was the largest review of heat guidance in the recent past in extreme events and across the government itself. So we have now a really updated health professionals guidance and a care home and social care staff guidance. We really reviewed those two pieces of guidance in detail. The looking after children and early year settings is a guidance that currently is available, but the new update will be released by the end of June. And we also produce supporting people homeless and sleeping rough this year, and also guidance for organizers of mass gatherings. We also updated all of our bit heat guidance, more on that later, and we also produce action cards. So the problem at this stage is not if the guidance exists, the guidance exists. The biggest challenge in the future is how to ensure that this guidance is really being implemented in the front line. Regarding the bit heat, and just to share that this guidance already exists. We already provide a lot of information based on evidence on what the population should be doing. We have specific guidance for staying safe in hot weather. We also have a checklist on how to keep cool your home. And we also produce reviewed and publish a bit heat poster where we have the essential recommendations to the population available. We don't have guidance only for it. We also have guidance for, sorry, my apologies. We also have a guidance for droughts that is available in gov.uk, where we talk about impacts from dehydration, mental health impacts, pathogenic transmission, and also respiratory problems that may show up during these events. And finally, just a note, we also have guidance on flooding and cold weather. However, this guidance is currently under review. The guidance for cold weather will be republished in September 2023, and the flooding guidance will be reviewed and published in October 2023. We don't only have guidance, we also have communication materials exactly to inform the population on the key strategies that they should implement in case they see temperatures above 25 degrees. So that's an area of our organization that we're also addressing. So regarding past, present, and future, just to flag the creation of the Center for Climate and Health Security within UKHSA, I will not steal Leah's time. Leah's our deputy director and the head of the center will talk about this more in detail, but it's just to underline that there is a huge effort from UKHSA to lead in a lot of these adaptation measures and adaptation to changing climate. And just to say that there is no governmental investment, I usually am very pessimistic, but on this area, I must be optimistic. Our team in the past, the extreme events team, was composed of around 5 people, and this was November, December. And through governmental investment, we right now have 12 people working with the team. And then we have registrars, PhDs, students, fellows. So the government is also doing a quite considerable investment on this area that also should be recognized. If we could have more funding, everyone could have more funding. I think that is out of question. But I can say that there is an investment from the government to tackle this challenge in the future. And just to underline, the plan is not the end of the process. The plan is the beginning of the process. Most of the work that will be done in the future is to implement the plan. I usually say that the easiest part was to make the plan. The hardest part is to ensure that all of us are working together to really make the change that is required to face adverse and extreme events in England. I'm now open for questions, and thank you for your attention.
Thank you very much. Really interesting presentation, and definitely a lot going on. And there are a few questions on the chat. One of them is related to the webinars and how people can register to those webinars that you mentioned.
So I think the easiest way is to register to the weather and health alerting system. There will be an option in the form of you wanting to be contacted about future events of the extreme events team. So if you register in that platform and you put yes, you will receive that information in your inbox. Right now, we have around 39,000 people registering to the weather health alert system, which is quite a huge improvement from the 5,000 that we had in the previous system. So just register to the alert system and you will receive that information.
Someone also asked about the monitoring platform. Is it already up and going, or is it something that's planned?
So we have the indicators, sources of information, and the organizations collecting the information in the one of the appendixes of the plan. The Power BI platform will be developed in the near future, I believe 2024, 2023, but that is defined in the plan. So right now we don't have the monitoring platform, but we already have the framework of indicators, and you can see those in the plan.
Then there is a question, someone asking that you mentioned reducing deaths in children. And they were asking what policies or plans have been put in place to address this.
Okay, so I will divide these into matters. We have the guidance for teachers and children. We're updating that considering what we saw last year in collaboration with the Department for Education. However, I must underline that a lot of the guidance that we're producing needs to be implemented through like different partners. UKHSA doesn't have a remit to tell schools, you must do this. That remit is under the Department for Education. So a lot of the times what the UKHSA is doing in this area, yes, we are producing guidance, but the implementation, for example, of guidance at the local level or in the LRFs, that is a responsibility of the LRF. It's not a responsibility of UKHSA. We do our best to inform and to prepare and to guide those groups. But if you go in the Appendix 1, roles and responsibilities, you will see, for example, the Department for Education as the role of using part of the guidance to really define strategies on how to support teachers and children in school settings. We just produce guidance in order to support action from the different governmental departments.
Great. We have a couple of more questions, but we don't have time to answer them. I don't know if you have a chance to stay a minute and answer them. Otherwise, we'll have to try to do it afterwards, because we are now at the time to move to the next presenter. So thank you very much for your contribution. We look forward to hearing more about these developments. And particularly from a registrar point of view, there are probably lots of registrars interested in learning more about this. And we'll then move to our next session, that is going to be delivered by Mr. John Hammond, who is a Met Office advisor in the civil contingencies. As Agostinho said, UKHSA works very closely with the Met Office. So it's really a privilege for us today to have now John here to present the view of the Met Office. John, are you there? Yes.
Thank you very much indeed. Good morning to you. I hope you can hear me. The IT sometimes can be a bit wobbly here. Very good morning to you. I'm in Suffolk, and I'm, as you just heard there, one of the advisors that are dotted all over the UK. I'm not a climate scientist, but I'm a meteorologist, and of course in the line of work we do, which is with emergency responders and local government, then clearly the climate change themes very much increasingly evident, as we'll touch on in a moment. Now, I've been watching the presentations so far today, so it's been a bit of a checklist on some of the things that I am going to touch on, but I will push through those very quickly. But I'm hopefully going to share my screen now, and you will be able to see the presentation that I'm going to try and share right now. So just bear with me 2 shakes of a stick while I get the IT sorted out. Yeah, let's go for this. Right, hopefully with the backwind and my fingers crossed, you can see the presentation slides now.
Yes. Can you please put in presenter mode? Yeah, that's perfect.
Hopefully I have, yeah.
Thank you, John.
Right, okay, very good morning to you. So like I say, some fascinating topics and areas already covered, of course, so far today. And yeah, like I say, one of the Met Office civil contingencies advisors cover the east of England, but we are spread right across the whole of the UK, and it's great to be here this morning. Thank you for asking us. So as far as the Met Office is concerned, obviously we'll talk about the weather, but also the fact that climate change, as I mentioned, is very much higher up the agenda, and certainly the work we do, than ever before, and understandably so, certainly given some of the topics that we've heard so far today already. And I'm just going to sort of contextualize, if I can. I know this is probably going to be a bit of a refresher, I'm afraid, for many people, but just to sort of look back on where we have been and try and put things into a bit of context. Like I say, I still get asked in the job that I do, people say, well, you know, we've always had changes in, you know, our climate, and there always will be. And I say, but it's when you start to add on that CO2, of course, and you can see here looking at, you know, the ice cores and the way how CO2 has changed over the last, knocking on towards 1 million years or so. You can see, yes, there has been those fluctuations, but you can see right at the end of that graph there as well, we've got, you can see 2020 way above, you know, where we have been for getting on, like I say, for probably at least 1 million years or so thereabouts. So certainly putting that into context, that sort of does hit home with regards to the themes behind why we're seeing climate changing as well. And there've been a bit of fluctuations even over the last sort of few decades, going back to 1990 or so, you can see there have been a few, although the overall trend is clearly on the way up. We can see there, perhaps most recently, the most talked about thing that popped up in certain media outlets was the fact that we had the pandemic, and of course flights and traffic excuse me, this is hay fever, by the way, so forgive me. We had the pandemic, and we did see a bit of a dent in with the amount of CO2 released into the atmosphere. But you know, things really, even then, even though they were lower than the previous year and subsequent year after that, we can still say even then they were still way up compared to where we were over recent decades as well. Just really sort of, again, this is just to contextualize things, I know, but showing you different outputs from various models here across the world as well, including the Met Office Hadley Centre and the Centre for Climate Research as well. We can see there we've got those global temperatures right around about 1.1 Celsius since those pre-industrial levels back way towards the turn of the century. You can see that increase really starting to accelerate once we get towards the 70s and 80s onwards in particular. So we're very much in the territory, and I think this is the thing from my point of view as well, and the work that we do is really sort of trying to illustrate that, you know, we've talked about climate change for many, many years, of course, and the fact that it could and is now changing. And we're now sort of getting into that territory where we will start to see some of those changes show their hand as well. It's not necessarily a prediction. You're starting to see some observations, which again I'll come on to in just a moment. But certainly that resonates with regards to sea level, which again continues to rise again. Since the turn of the century, we can see that increase on the way up, and very much given the emissions scenario, that sort of you know, modest increase in CO2 levels, we're still expected to see those sea levels rise as well. You can see there globally around about more, over 20 centimeters since the turn of the last century, I should say, of course, since 1900 thereabouts. As far as the UK is concerned, just again, putting that into context, I'm afraid, just to sort of reiterate really where we have been and where we're potentially going in a moment. But certainly you can see there our coldest years on record way back towards early sort of 20th century there. I think that's going to be the winter of 62, 63, for those that may remember that or not. But certainly you can see that was one of the coldest. We had a cold winter back in 2010 as well. That sort of really not, yes, it was very cold, but we will get those colder spells, of course. But you can see there the overarching theme very much weighted towards, since the turn of this century, you can see our highest temperatures very much occurring in the last 10, 20 years or so in particular. And of course, last year, a record breaker. We've already touched it. And again, in certainly the work that we do, talking with emergency responders and emergency planners, it really has raised the bar and raised eyebrows with regards to what the climate may well have in store for us over the coming decades. And talking of looking forward, may be aware of this. If not, again, apologies if so, bear with me because this is a bit of a refresher. These are a quick look at the UK climate projections, UKCP 18. Now, this is where we start to drill down on a very, not just a global level, but also a regional one as well, and a local one as well, getting down and really sort of trying to push the bounds of the science. Of course, we're looking down those projections down to a 2.2 kilometre resolution. So very much looking at not just the global, regional and local level, but also the observations for marine and the observations on a probabilistic basis as well. And again, I'm afraid no spoilers here really with regards to what the headlines are. And again, we've had it already this morning, and that is certainly the chances of those warmer, wetter winters, milder temperatures through the course of the winter itself, and hotter, drier summers as well, with the caveat, I suppose, that when we do get rainfall, it does, as we've seen again over recent summers, it does tend to fall in those torrential and often thundery downpours as well. So all sort of tied in with a warmer atmosphere, of course, being able to hold more moisture and produce those higher rainfall totals as well. So interesting times we're at, and again, anecdotally at least, we're getting feedback from customers and our colleagues dotted all over the UK that this is starting to be realised more often as well. Now, sea levels, again, they have, as we saw there, have been rising, and they're going to continue to rise as well. Again, no particular surprises there. Current risks that was touched on there with our colleague there from with regards to the heat health alerts there in particular, and just sort of go through those, because this is, again, in the line of work that we do as meteorologists. We're very much involved with the risk assessments and a number of those in which the Met Office leads on, of course. And we're going to start off by looking at those high temperatures and heat waves. This is now numbered R73, and certainly when it comes to those high temperatures, and indeed, you know, clearly we've heard about the impacts that can be realized on the population, and certainly the more vulnerable in our societies at risk of these higher temperatures. And a quick snapshot of these values, some headline figures here. I won't go through them all because, again, this is really reiterating what you've already heard already. I suspect you already know. One of the stark things really is the number of hot summer days we're expected to see. And again, we're looking forward to very much comparing these to looking at by 2070, these upper figures are possible. And I think one of the issues with climate change has been certainly on a professional basis, has been that a lot of people think of 2070, oh, it's many years away. And yes, it is for a lot of us, but in the grand scheme of things, it really isn't that far. Of course, it's now 2023, of course, and like I say, a changing climate already starting to show its hand in various ways. There's all these different pieces of the climate change puzzle start to fall into place. So some headline figures there. Again, we saw those really high and exceptional temperatures last summer. Again, we'll come on to those in a second, but you can see there when we look at the UKCP outlook for many parts of across the UK there, you can see when we look at this, the representative concentration pathway, that's RCP, these different scenarios. So we're looking at, we're sort of pitching around sort of the middle one of these maps of these different scenarios here. That's the middle scenario, like I say, we're expecting at the moment, given that the emissions that are currently being kicked out into the atmosphere. And you can see there right across all parts of the UK, very much looking at temperatures increasing by another couple of 3 Celsius at least as we go towards certainly the second half of this century. So that's summer mean temperatures as well. That's a mean, don't forget. So an average of the maximum and the minimum as well. And that 40.3 and those other locations that smashed the previous record, of course, those sort of figures very much expected to happen, you know, a few times a year, arguably, by the time we get to these kind of decades here in our between 2060 and 2080, for example. Excuse me a moment. Now you can see there the changes in that likelihood of UK extreme events that I mentioned there, those high temperatures. And certainly the chances of us seeing, you know, 40 Celsius. I never thought in my lifetime I would be talking in emergency responder teleconferences and meetings and saying that temperatures could hit 40 Celsius, but absolutely incredible that we did. And of course, it didn't just beat the previous record by a couple of points of a degree Celsius. It absolutely kicked it into touch. 38.7 the previous high, but 40.3 now the highest temperature recorded at Coningsby in Lincolnshire. And you can see there, hopefully on that graphic there, that we're going to an illustration across the UK there on where the very highest temperatures were recorded. Many areas getting above the previous record there. So many eastern and central and some southern parts of England in particular sort of bearing the brunt of the heat. And of course, again, as alluded to earlier, the number of wildfires. I mean, there's an image there from Dartford, for example, by the M25, I believe that is. And these sort of things are certainly expected to happen more as we go through the coming years. And you can see there, as I bolt on the additional figures there, that we're looking at by, you know, based on the sort of the chances of seeing 40 Celsius, it's gone from being 1 in 100 to 300 year sort of kind of window to happening, you know, every sort of, so well, much more frequently, let's put it that, based on these high emission scenarios, once every sort of few years, for example. So clearly the trend, again, no surprises, I'm afraid. It's not a pretty story, I know. And if you are aware of this, then do bear with me while I go through these slides. So certainly when it comes to those high temperatures, again, clearly looking at not just the wildfires, the droughts, the drain on water resources. Last year, a bit of a taster for that already, I'm afraid, and transport disruption. And of course, we've already heard about some of the figures with regards to excess deaths and indeed health issues as well. Now, one of the other areas we look at, of course, the other end of the scale is flooding, and a few related risks here. And this is very much looking at certainly the intense rainfall, but also that, as I say, when the rainfall has been coming, especially during the summer, it's been in the form of thunderstorms, those torrential downpours, causing surface water flooding, and indeed a lot of frequent lightning as well associated with those. Again, no great surprises here, I'm afraid. Not a pretty story where we're looking at, by the time we get towards 2070, for example. Again, not that far ahead in the grand scheme of things. We're looking at, rainfall across the UK. And again, this is looking at those 2.2 kilometre resolutions with regards that show the predictions, looking at based under a higher emission scenario, granted, certainly the amount of rain that can fall beginning up by around about a third or so across the UK. So a big change in where we've been and where we're going as well. So you can see there is that extreme rainfall that we do see from time to time, and it seems increasingly so as well. That's very much associated with an event that would be normally would happen sort of once every 2 years or so, is going to increase by 25% thereabouts. So clearly, again, warmer atmosphere can hold more moisture, can drop a lot more rain, and in a short space of time as well. And again, we're looking at the difference not just in the summer rainfall, but also winters, when we get those Atlantic systems, those rain-bearing systems coming in from the west. Sea temperatures very evident at the moment, actually, has been what's been deemed by no as marine heat wave at the moment over western parts of the British Isles. Sea temperatures like 4 to 6 Celsius, at least above averages in some places, and that'll have a knock-on effect in helping to feed moisture into the atmosphere, and how the atmosphere reacts and produces those deeper clouds and high rainfall totals, potentially, especially as we go towards the second half of this century as well. So looking at the UK overall with regards to precipitation, overall, although there are going to be downpours that are going to occur, the overall sort of expectation is that rainfall will become less. So yeah, a decrease in the summer months meteorologically. That is the months of June, July and August combined that we look at. And again, we're looking at the higher emissions scenario here as well, that RCP 8.5. And you can see there the difference between summer and winter as well, with the exception perhaps in that lower emissions scenario for parts of Northern Ireland and certainly Northern Britain there as well. You can see rainfall broadly, even in that current scenario we're under at the moment, that mid path, if you like, if we can call it that, rainfall very much on the up across all areas of the United Kingdom as we go through again towards the second half, as we get towards the second half of this century. So those changes that are likely with regards to more greenhouse gases, of course, we're going to see them becoming much more frequent. So the wettest day on record at the moment we had back in October 2020, we're looking at the average rainfall across the entire UK actually was 31.7 millimeters. And that actually beat, on that October day, that actually beat a previous record for an average rainfall across the whole UK that was set back in getting on towards 35, 40 years ago in 1986, when in August, the average rainfall was 30 millimeters. So little things like that, again, not big figures changes, but subtle changes again, these pieces of a climate change jigsaw just being sort of slotted into place, and of course consistent with what you'd expect to see happening in a warming atmosphere as well. And you can see there under the different emissions scenario there, we could see these kind of high UK-wide rainfall amounts becoming as much as 10 times more likely by the end of the 21st century there. So again, has to say, no particular surprises. You can see there the difference under the natural climate there, and compared with 2020 to where we would be potentially in 2100 there as well. Now, of course, the main just touch on these very briefly, but you can see there, yeah, the main types of flooding are going to be surface water flooding, groundwater flooding, that fluvial flooding there, and coastal impacts as well from higher tides arguably, and potentially stronger winds as well that we could see. So combination of elements all falling into place, and certainly surface water, I mean, has already happened this I'll call it this season, because since early May we're sort of seeing rainfall totals in this country that I would have just a few short years ago, a decade or so ago, I would have thought would have been a height of summer type rainfall event, but we're kind of seeing those happening earlier in the season as well. So again, like is always the case, you can't nail down one single event to climate change, but it is very much consistent and again fits that theme that you would expect to see happening with a warmer atmosphere dropping more rain in a short space of time. And just a few snaps there, really, you can see some pretty dreadful scenes we've seen over recent years across the UK with regards to river flooding, banks being burst and flooding numerous areas right across the UK, especially so for some northern and western parts of the British Isles in particular. That's very much different when we look at widespread rainfall, of course, to thunderstorms. And when we're looking at thunderstorms, yeah, it's that time of the year when we could see them. I noticed we've got a couple of yellow warnings out today from the Met Office for different areas of the UK, and you need that moisture, you need that unstable air. That's air that basically, once it gets energized at the surface of the ground, basically keeps lifting way up towards the top of the atmosphere and producing those really deep, those cumulonimbus clouds. And that can trigger not just a high amount of rainfall in a short space of time. You get various different elements associated with those, whether it's large hail, of course, the gusty winds. There's been association that was mentioned earlier about hay fever maybe being high. And this year, there's also thoughts and work going into asthma associated with thunderstorms, because of course when you get winds, those converging winds towards a thunderstorm can bring particulates in to certain areas and can therefore lower the air quality, and maybe some people are susceptible to that. But again, that's very much something being looked at the moment, and once we see these sort of thunderstorms kick off, then clearly, like again we've seen over recent summers, a lot of rainfall, short space of time. You know, that's going to cause, unfortunately, a lot of issues. And you can see there in the top left-hand corner, we have got one of those. I had to include a cloud photo. I've been a meteorologist, I've been rude not to, but that is a cumulonimbus cloud, the sort of clouds that hit right towards the top of where that happens with the tropopause. And those clouds at this time of year getting up towards 30,000-40,000 feet or so, and producing all the lightning, and again ultimately of course the rain as well. And of course the challenge in the job certainly that we do as advisors across the UK is trying to provide details on where these thunderstorms are going to occur. You can see that rainfall radar image there towards the bottom left, and over parts of Wales and Western England, some areas getting an absolute torrential downpour. But if that rain falls over a mainly rural area, then the impacts clearly are going to be fairly less. But as has happened, and you've got instances there, they've got one that you can see, the Queen Elizabeth Olympic Park in London, then yeah, you're going to get a lot of flooding, unfortunately, because with all that concrete, rainwater, like water anywhere, was find its level, I'm afraid, cause all sorts of issues. So that's the challenge for us, nailing down those particular local details as we go forward as well. So essentially, yeah, heavy rainfall, no surprises there, and that could lead to clearly an increased risk of river and groundwater flooding in the winter, and as you saw there, those surface water flooding impacts that we've seen already, certainly this summer, and more so during the course of the last couple of 3 summers in particular as well. Just quickly looking at sea level, again, we touched on this earlier, but confirmation really there that across the UK, when we look at the different emission scenarios, they're all on the way up. It's the mid sort of RCP we're looking at, which is the 8.5, which is the one of the most likely really where we're heading at the moment. The lower end of sea level change goes up anyway. There's already that inertia of warming in the atmosphere that's going to play out essentially. So if you stopped everything CO2 wise today, then things are going to roll on for many decades anyways. You sit wherever and whenever possible, quite frankly. But again, that's already been said before, and it goes really without saying. As far as sea level rise in the future, I mean, clearly looking at with those higher sea levels, a risk of coastal flooding, and being here in East Anglia, I can certainly vouch for coastal erosion, homes having to be demolished as the soft sandy cliffs of East Anglia get bitten away by the quite often choppy waters of the North Sea in the winter time in particular. So that's something again to bear in mind. I just thought I'd put this slide in really sort of just to sort of quantify and sort of mention that yes, Arctic sea ice clearly on the decrease, as we can see here from this image, and we're at one of the lowest levels this year so far as well. But it's worth bearing in mind that when ice that floats on the sea melts, it doesn't actually necessarily raise the sea level itself. That's because of glacial melt, places like Greenland, for example, where you've got those massive glaciers, when they melt, putting fresh water into the sea, that helps to rise, increase the sea level. But also it's that coupled with thermal expansion, the physical warming of the water. Like any substance, the warmer it gets, the more space it occupies. So it physically expands. So it's a combination of that thermal expansion, and glass is like I say, on Greenland in particular, melts. They put the extra water into the seas as well. That helps aid that particular element of sea level rise. So quickly looking on to wildfires, this is again another risk that's relatively new actually as well, I believe, and certainly after last summer kept emergency responders busy right across the whole of the UK. You can see there, they've got a graph there showing the areas across the 4 UK nations for the last sort of 10 years or so, and you can see there that certainly the amount of area burn has very much increased as we've gone through the latter years in particular. Parts of Scotland and Wales in particular are high, and a lot of that is to do with the fact that like we saw even this year when we had the dry weather through May, and still have in many places even this month, we have a lot of winter foliage left over towards the end of the season. It's still not died back enough, but there's enough there to sort of, and you get the dry conditions, the wind, and that can really sort of see those fires, wildfires spread quite quickly because of all that debris that is still there from the winter, end of the winter in particular. And of course, there is unfortunately the man-made element to that as well, where some of those can be started deliberately, of course, which is very, very unfortunate to say the least. But anyway, the season itself, again, sort of reiterating that sort of element of late winter into spring when we see perhaps the most wildfires, and you can see there it is towards those spring months again when you've got that before the spring growth has really started to sort of green things up fully, and you've still got that material left over, like dried bracken, for example. I think Scotland, as a result of that, had one of their biggest wildfires ever recorded last month. And you can see there, you get that peak through the spring. It's down towards this time of the year when you've got, again, more greenery, but again, an uptick really as the crops start to grow. Of course, when we get our cereals, for example, those become more vulnerable to burning. And certainly I know in this part of the world last year, a lot of field fires, fire services, whether it was Cambridgeshire and Peterborough or Suffolk or Norfolk, they were they were flat out for many, well, weeks, if not days, to be honest with you. It was very challenging time. And these, of course, things to bear in mind in the future. And as we go towards those wildfire conditions, clearly you do need the vegetation type and the ground to be dry. The relative humidity, if it's drier as well, that often happens. Certainly this season when we had winds coming in from a northeast or easterly direction, it was fairly dry air, not those milder, moister southwesterlies, for example. So the wind speed as well, and of course the direction, but the lack of rainfall, fundamentally are key elements of that as well. The risk itself as we go forward, of course, as you can see there, as we go through the course of this century, you can see the risk of wildfires, unsurprisingly and unfortunately, on the way up. Increases in severity as well due to climate change. And again, that's that combination, the low humidity, the dry conditions that are certainly more likely, arguably, during the summer as well, where we see those wildfires certainly there for many southern, eastern and some central parts of England, you see, as we go towards the back end of the 21st century. So already showing signs of increase, and that trend very much expected to continue as well. Mentioned, has been several times really today, as mentioned the summer of last year, absolutely record breaking in so many different ways. The fire rescue services in England alone dealt with almost 25,000 wildfires between June and August. Now that's 4 times as many as the same time the year before. So it just gives you an idea how stretched those emergency responders were. And of course, the high temperatures, they had to take into account the fact that they suffered with the kit that they were wearing. Very much a case of trying to keep hydrated, adding to some challenging conditions. So therefore, yep, as we go, excuse me, sorry. As we go forward, you can see there, and unsurprisingly, the impacts on fire and rescue services are going to be that much more heightened. The danger to buildings, and not just in rural areas, but of course in those urban areas, we saw even parts of London, of course, last year. Suburban areas, properties catching fire because of wildfires, and that smoke going into the atmosphere invariably having an impact on air quality and lowering that as well. So, and ultimately, clearly not helping land that's been affected by wildfires as well. Just quickly have a quick look at storms here. This is R72, another risk that we lead on the Met Office. So it's those, this is very much, when we talk storms, it's not thunderstorms, this is storms as in Atlantic storms. So those areas of low pressure that develop over the Atlantic, rattling from the west or southwest, and they bring those really strong winds, and certainly wind and rain warnings will be issued for these as well. So an example there from not long ago, from last year, we had Storm Eunice, 4 fatalities across the country, power outages and so on, and needless to say, major disruption to transport, and we've certainly had a lot of flooding as well associated with that, as well as those businesses and schools closed as well. So again, as we go forward, we're looking at an increased risk of structural damage and all those things that I just mentioned there, power outages and so on, as we arguably see the risk of those heightened storms over the course of the rest of this century as conditions in the atmosphere begin to change. And I just thought I'd round up really by just sort of looking at the UK climate change risks. I won't go through all the numbers, but just give you an idea of where we're looking at today, and then you get the impacts with regards to related deaths, unfortunately, when you look at 2 and 4 Celsius warmings across the UK. And you can see there that certainly some pretty stark figures there. We had those figures of the fatalities, extra deaths last summer because of the high temperatures, and clearly that's not going to get any better. And with regards to 4 Celsius, you can see we're into 5 figures there should that warming reach those kind of levels, which, yeah, anyway. Some sobering figures there. Not a happy story really. And then just to sort of finish off with here, just looking at the global warming generally, the climate change, and how future high impact weather in the UK is basically shaping up. And you can see that little thermometer there on the left hand side. So essentially looking at a greater risk of anything from droughts and crops failing right the way to the high temperatures, of course, and also the fact that we see fewer days where we see snow and temperatures falling below freezing essentially. But ultimately as well, again, that warmer atmosphere, more moisture in the atmosphere, means that those rainfall days, intense prolonged heavy rainfall, very much on the up as well. And even at a 2 Celsius increase, you're looking at an average around about 9 days over a week each year, which in the grand scheme of things doesn't sound an awful lot, but it really is. And just to reiterate, really, things we've seen already, I won't go into these in too much detail. We talked about summer from last year already. So by 2050, the summer that we saw last year, by 2050, those hot summers could happen basically every other year. And again, grand scheme of things, not that far away really. We're looking a couple of decades or so, aren't we really, a couple of 3 decades thereabouts. So quite sobering numbers really. And I just want to finish off with this one really. This is not a prediction, this is an observation. So this for me really sort of hits the nail on the head, and it shows you where we've been. So we use 30 years, and we use that as to guide, as a climate guide essentially. So temperatures are going to be a couple of degrees above average today, whatever, for each time of the year. But we look at them on an annual basis, and we look at that on this 30-year basis as well. And using the 1961 to 1990 average, and then comparing that to the latest ones, 1991 to 2020, you can see there that is the difference in annual temperatures across the UK, and many parts is getting towards a degree above a degree for parts of eastern and some central parts of England already, and rainfall much more scattergun, I suppose you could call it really, because probably underpinned by that sporadic nature of thundery activity and convection, those showers that we see, not exclusively in the summer, but other times of the year as well. But certainly overall, the main theme, that background theme to the rainfall, of course, is that it is on the increase as well. So again, I'll leave you with those maps there. Apologies, thank you for bearing with me if that's something you already knew, but from a meteorologist meteorologist's point of view, that gives you a bit of an insight in kind of things that we deal with at the Met Office in the jobs that we do, and obviously some of the work that we're involved with as well. So thank you for your time, and thank you very much indeed for asking me this morning. I'll try and stop sharing my screen now and bid you a very good day. Thank you.
Thank you very much, John. And in the interest of time, I'm going to allow one question and also one comment from me, which is this really illustrates why we are all here today, why we really need to adapt those scenarios, and the fact that a lot of them are not really forecasts, are actual changes and things that we really need to be prepared for. And from a public health point of view, these are all challenges that we learn that need to lead to a significant impact on the population health. And we have seen the dire figures of what's going on in New York, and it's concerning to think that we may be seeing similar pictures in some parts of England and Wales and Scotland due to the wildfire.
I'd be interested. It's interesting because some people say to me, oh, well, because there's so many different channels of communication, we just know more because we can see more what's going on in that. But when you start to look at the severity and then the frequency and where they're happening and how they're happening, I think, it would be a bit remiss to say that there's not a consistent theme here, unfortunately. But that's where we're at the moment, I'm afraid.
Just the first question is the air temperature normally distributed so that we are using the mean? Is it the good statistic to use to look at the temperature throughout the year, or should we use the median if we are seeing if the distribution is skewed, which seems to be
use the mean because,
skewed.
as I mentioned earlier, we use the mean because because there's so many numbers for a start, but we use it will be the maximum and the average maximum and the average minimum combined to make that mean for the whole year. So it gives us a single figure basically, and it's when we start to look at those longer periods, which is what you need to obviously see a trend, like I just illustrated at the end there. When you start to do that, then you can start to see an overall trend. Taking figures in isolation is fine, and we keep talking about the 40.3, but I mean that is quite an amazing figure anyway, of course. But you need to step back and look at what's happening over a period of time, and to see where these numbers and where that trend is ultimately going.
And another really timely question is, what is the impact of El Nino and El Niña, the opposite, on us, thinking that this is something that affects the water in the Pacific, and we are in the UK, very far from the Pacific. How does it play in our climate projections and the temperature we experience?
It does. Obviously, it's the other side of the world, so the impacts aren't as stark or as noticeable as some other nearer parts of the world. But I mean, even in the here and now, I mentioned the example where we've got very high sea temperatures over many parts of the Atlantic Ocean at the moment. That's going to be interesting. I say that, and that's kind of linked with El Nino as well, because of course they are higher temperatures in the Pacific. That's very much linked with the fact that you start to see that can actually prevent tropical cyclone development over the Atlantic. I mentioned the sea surface temperatures in the Atlantic. Because they are so high, that actually might still provide a trigger to produce them, even though El Nino, which historically has shown can put a bit of a lid on activity because of it's to do with easterly waves coming out of Africa and how they manifest themselves into tropical cyclones. But the connection between El Nino and hurricanes usually means you get less hurricanes, for example, in the Atlantic. However, this year there's this sort of like trade-off. Are we going to see, even some of the models are starting to struggle now, well, sea temperatures are they are so high, all the energy is in the ocean. Does that mean we are still going to see the tropical cyclones despite what's happening way up in the atmosphere because of what's happening? But you're right, just coming back to the question, sorry, the El Nino, it can affect our climate, and more notably in winter months. I mean, La Nina, it can often bring more probably more blocked weather patterns during the course of the early winter and then more mobility later on. From my understanding is El Nino generally can bring more of a what we call a positive North Atlantic oscillation in the winter, and that means more mobility coming in from the Western Atlantic systems in the winter because you've got El Nino. Pretty sure that's the relationship. But the summertime, because of the heating of the sun and everything, clearly is different around the globe. That has a lesser effect on us historically. But of course, we're very much in uncharted territory on what we're looking at weather-wise now. And I often look at the weather situation and the weather forecast, and I'm thinking we've kind of got a different rule book here. You know, where are we going? Because you've very much kept on your toes because things have and are changing.
Thank you very much, John. And without further delay, I'm handing over to Sue, who will be chairing the roundtable with presenters from the 4 nations of the UK to discuss adaptation in each of the country and what are the current developments and what is in the pipeline and what is the challenges, what is in our wish list in different countries, because as John mentioned, the risks may be slightly different in terms of flooding, fires, temperatures, etc. So the floor is yours. Thank you.
Can people hear me?
Yes, we can hear you.
Okay, thanks. So a fascinating morning so far. I've certainly learned a lot, and I think it really demonstrates for us this morning the wider group of people than just health people who are very much interested in adaptation, mainly because it's obviously addressing what's currently happening now. And I think that's a really important message from this morning. But also many of our speakers have also demonstrated how it does affect health and how important it is for inequalities, vulnerable people, and how those need to be considered. So we're moving on in this section as a round table to have a discussion about adaptation across all 4 of the nations. Obviously, we've heard quite a bit about the adverse weather and health plan that UKHSA are busy talking about, that we've heard about already this morning. And but we'll also hear from Northern Ireland, Wales and Scotland. And I think that'll pick up a question that I think was asked earlier on in one of the questions. So I'm going to introduce our 4 speakers. I can't actually see them at the moment, but I'm hoping that they're here. Professor Lee sorry, excuse me. Professor Lee Berrang, who's the head of the UKHSA Centre for Climate and Health Security, Stephen Jones from Northern Ireland, Adaptation Analysis in the Climate Change Committee, Anna Bezic, Head of Climate Ready Leadership in an organisation called SNIFR, which perhaps you could actually explain exactly what it is, but it's Scotland-based and across sectors, as I understand it. And Nerys Edmonds, Principal Health Impact Assessment Development Officer in the Wales Health Impact Assessment Support Unit in Public Health Wales. So again, a variety of people from different backgrounds, all interested in this area. And what I'd like to do is to ask each of you to just give us 5 minutes outline of what's happening in the various countries. And obviously, Lee, what's happening with the new UKHSA centre, and perhaps how that relates also to the other countries. And then we can pick up as a round table some of the issues around the challenges, around how we might be able to address some of the barriers, how we can engage with populations and questions of research, etc. So Shall we start off with Lee? Obviously, as I say, we've already heard about the plan in motion, so, but perhaps you could talk to us about the broader aspects of adaptation and particularly how that fits in with UKHSA. So over to you.
Sure, great. Just let me know, can everyone hear me and see me?
Yeah.
Okay, perfect. So I'm the head of the UKHSA's new Center for Climate and Health Security. So you heard from Ago about some of the work that we're doing on extreme heat and our weather plan. We also have additional teams. So we have teams working in vector-borne disease. So this is really looking at the risk of emerging mosquito species and the potential for new pathogens, potentially even pandemic causing pathogens in different insects, mosquitoes, ticks, to come into the UK. So we have our bug team, so to speak. And then we also have work across a range of areas related to climate assessment, be that feeding into international policy forums related to health, feeding into ministerial queries about the potential impacts of climate change on health. And we are developing a number of new areas of provision. So a knowledge platform, which will pull together and begin to curate evidence on climate and health for different partners, as well as a training hub with initial emphasis on public health and being able to host public health registrars and provide additional training in the climate and health space. So we're really talking about a challenge where we're making decisions that will really be relevant for the next generation. So this is really about our children or our grandchildren, because the science tells us that the vast majority of impacts and burden of adapting to those impacts are likely to occur in the middle to just past the middle of the century. And so really that's the decisions we make today in terms of preparedness will influence really, or will be born by the next generation. And so I think that's quite important. And what we're really talking about is at the scale of public health 2.0, not because it's a step change in what public health looks like, not only that, but also because it's thinking about what public health needs to look like at 2 degrees above mean temperatures, and maybe more so. And so one of the first things I wanted to flag is that when it comes to adapting to climate change, the types of interventions, public health interventions and planning that will work to protect health at 1.5 degrees, even 2 degrees of warming may not work at 3 or 4 degrees. So really we're looking at a fairly uncertain landscape in terms of what the risks are that we will face. So right now we're seeing the equivalent of what 1 degree above 1 degree warming means for health. But really we're pretty much locked in or guaranteed to 1.5 to 2 degrees and much higher. So we have to think very strategically and bravely long-term, because we're trying not to respond to what we see now, but what we know is coming. So some of the things that we're trying to do really is curate and mobilize knowledge. So in some cases, this is England specific. In other cases, we're working closely with several of our partner nations in the 4 nations, for example, on vector mapping. We will be publishing in September the Health Effects of Climate Change report, which provides a scientific synthesis of evidence, and we'll be rolling out a set of guidance and toolkits. I think what's important to flag before I finish up is just how much work in the climate and health space depends on an engagement in other sectors outside of the health and the public health sector. So for example, land use planning, building design, so greening spaces, changing our infrastructure related to heat and ventilation, all are very important to health, but really outside of our remit. And so the soft power that we take within this community and the influence we have through engagement will be as important as what the public health community can do sort of directly within its own remit. This also applies to things like rewilding, nature-based solutions, movements of greening, landscapes will have implications for urban heat, will have implications for mental health, and could have negative implications for vector-borne disease. So really there's an important engagement aspect outside of the public health community with significant relevance, and that many of our adaptation options require partnerships with others. And with that, I will stop for now and pass on to the next panelist.
Okay, thank you very much, Lee. I'm sure we'll come back to some of those points, but that's a really helpful summary. Can I move on to you, Stephen? Stephen from Wales.
Northern Ireland, yeah. Nice to be here. Thank you for having me. I'm currently in Dublin at the European Climate Adaptation Conference, so please excuse any background noise. Feel free to flag that up if it gets too much. Okay, so I just thought I would take you very briefly through a recent report with the Climate Change Committee have done. You've already heard plenty about who the Climate Change Committee are this morning, so I'm just going to touch very briefly on the recent report that came out. One of these reports is happening for every region of the UK this year, and it's using a new kind of series of roadmaps, a framework for how to assess progress. And so one of the 13 different systems that the CCC are using to assess progress is health. And so I've just put up a sense of the map, and each of the outcomes that are in this roadmap have a range of indicators. You know, this isn't exhaustive, but it's a kind of a first attempt to put down an idea of what good looks like in the health system. So the two main outcomes of that are in relation to population health and then the health and social care sector. So that's what I'm going to be touching on today. So you can find all of this online. I won't spend too much time going through this right now, but it essentially follows a kind of a theory of change through from the ideal outcomes that we'd like to see, and then some of the kind of enabling and policy factors that would need to be in existence to reach those outcomes. In terms of Northern Ireland, the situation is reasonably stark. There has been a particular lack of adaptation progress in relation to both population health and the health and social care system. There is some limited disease surveillance. I think that's done in partnership with the UKHSA, and there's also a regional severe weather plan in place, which is obviously quite short-term response work, which is positive, but that kind of long-term adaptation planning is really missing. There was one action on health in the most recent NI climate adaptation programme, and that was in relation to information sharing. And arm's length bodies like the Public Health Agency and the Health and Social Care Trusts have no clear policy direction. That's really the overarching comment there. At the time of writing, environmental issues in the Department of Health have also been put on a formal policy pause. As far as I'm aware, that's still in place. I'm not going to go into all of this. These slides, I think, will be shared, so that's why I put a bit more information in them. But on the population health piece, we look at the delivery, indicators of delivery separately from the existence of policy. So those two things get scored separately. There is a winter mortality index, which has data. There's no equivalent data set for summer or heat related mortality in Northern Ireland, but there is some evidence to show that people are having serious health impacts from heat waves already, according to some data sets and surveys. But some big indicators missing, so around regular monitoring of health effects of increased extremes. So that's heat impacts on outdoor workers, for example, or program monitoring on mental health impacts. Long-term program of monitoring for indoor air quality is missing, things like that. So we rated this as unable to evaluate. Again, I'll kind of come back to that lack of strategy from the Department of Health. It's a slightly different setup, slightly different way of working. The Department of Health really holds all of the control around this, so quite a central role that they could play. And the Public Health Agency and Health and Social Care Trusts have received no clear direction from the department on how to approach climate change. I'm just thinking about time here. I think I'll move on to the health and social care system itself. Again, a lack of indicators on this. So data on overheating in primary care, hospitals, care homes is absent really. And also data on the disruption to health and social care services by heat waves and other extreme events. This is certainly, if it exists, it's not accessible. I'm not sure it's being collated in that way, so that we weren't able to assess that. And then again, come back to, in terms of the policy that exists, there really isn't one at the moment. So clear direction is needed to increase the coordination and capacity between Department of Health and other agencies, such as the Health and Social Care Trusts. There are no regulations for avoiding overheating in new or refurbished healthcare buildings or in homes. The Part O doesn't exist in Northern Ireland either. Reporting of instances of overheating are ad hoc, and there is a hope that, to finish on somewhat of a lighter note, I suppose that the new public body reporting requirement that's come in under the Climate Act may begin to uncover some information around adaptation, but it really is quite a data sparse landscape at the moment. So there's a range of recommendations that were made in that report that the committee decided would be the priorities. Again, that's around having that plan that kind of ties everything together, provides a strategic direction, not just for the people in the Department of Health, but also for the arm's length bodies. The need for kind of longer term funding to think about how we might begin to adapt hospitals, care homes, etc. Regular health and vulnerability assessment would be required. Work with other departments to research overheating occurring in various building types. That's also largely missing. And then also that cross-border element as well, which is so important in Northern Ireland, to work with health partners in the Republic of Ireland and to look at the transboundary coordination around disease surveillance, etc. as well. So I think I'll leave it there. Thank you very much.
Okay, thank you very much, Stephen. And I do apologise. I think I said you were from Wales. Obviously, you were from Northern Ireland.
I take that. I take no offence to that. It's fine. Wales is lovely.
Slipped out wrongly. So let us move on to Wales, if we might. If we move on to Neris.
Hi there. Thank you. Can you hear me okay?
Yeah.
Great. Okay, so I'm going to give you sort of a bit of a national policy overview to start with, and then move a little bit more into some regional update, and then some sort of areas of policy progress and challenges, I suppose. So just to start from the national perspective, we have a Sustainable Development Act in Wales called the Wellbeing of Future Generations Act, and that was passed in 2015. And it really embeds the principle of sustainable development and long-term thinking and prevention across the policy and public sector. So that's a really important context for action, because it means that public bodies all have a duty to promote health, equality and resilience. The Welsh Government declared a climate emergency in 2019 and have now appointed a Minister for Climate Change. So there is a very strong kind of leadership within the Welsh Government around climate change. The current National Adaptation Plan was published in 2019, and it had 5 action areas for health. That, as Stephen's mentioned, all the adaptation plans are having a progress report from the CCC this year, and Welsh Government has also published their own progress report, which acknowledges that not enough is being done to keep pace with the risks from climate change. And a new national adaptation plan is being developed to be published next year. The Health and Social Care Division of Welsh Government now have a climate emergency programme, which has been a big step forward. Initially, that was focusing very much on the net zero targets for the NHS by 2030, but it is now beginning to have a focus on adaptation, and there is an adaptation project board attached to that programme, and that's focusing both on the resilience of health and social care system, but also the wider impacts across for population health and inequalities. So I think that was really important that that programme board is focusing on the resilience of health and social care, but it does have that broader perspective as well, looking at the impacts from the wider system and different sectors. Within Public Health Wales, we were asked to carry out a health impact assessment of climate change in 2019, and that work got very disrupted by the pandemic, by our work in the pandemic, but we are due to publish that next month. And it's really bringing a population health and public health perspective into looking at the kind of potential impacts, well, potential and actual impacts of climate change on both the determinants of health and different population groups in Wales. And we've got that opportunity now to use that evidence base to inform some of the policy development. Public Health Wales has made tackling the public health effects of climate change a priority in its long-term strategy, and that work is now, we've now got a climate change programme board that's working to facilitate work across PHW on both mitigation and adaptation. We have a health and sustainability hub within Public Health Wales as well that's been working to influence on an environmental sustainability agenda for a number of years. Some areas, we do have a public health advice system relating to weather and extreme or unusual weather, and that runs all year round. And we've currently got a lot of attention and work going on about developing our surveillance capacity to monitor the health effects of climate change. Regionally, recently Cardiff University did some analysis of regional policy documents and corporate plans across things like regional growth deals, local authority corporate plans, multi-sector wellbeing plans, and really found that there wasn't adaptation really wasn't being integrated fully into those plans, which is a concern. Our multi-sector regional partnerships have a wellbeing plan for 5 years, and Natural Resources Wales have recommended that that plan includes a local climate risk assessment. So we very much see that as an opportunity to begin that work with local partners of raising their awareness of the health and wellbeing impacts as part of the risks to their local population. In terms of policy, we have now got a Part O in building regulations around overheating, and we've also got an approved a ventilation guidance as well. So the overheating applies to new build residential buildings. That includes care homes, but not hospitals. The ventilation requirement is about improving indoor air quality in both new builds and when changes to buildings are being made. So that's been a step forward in policy. Some of our challenges are that about 60% of our population lives by the coast. So flood and coastal erosion risk management policy is absolutely vital to our future population, well, current and future population health. We've had some recent policy consultations around this, and there's a development control planning guidance being consulted on for the second time. And I think it highlights just how difficult some of these decisions are for governments about how do you balance the need to regenerate and develop communities and bring investment whilst balancing the potential, well, the definite negative impacts of flooding on people and their health. And I think one of our sort of feelings when responding to these consultations is that it really speaks to what Baroness Brown said earlier about what is our vision and outcomes. You know, what is the vision and outcome that we're seeking for the population through adaptation? We very much set this out that it's around well-being and quality of life for communities for the long term. But I think there's a lot of working through with some of these challenging decisions to come about, you know, decisions we make today, are they going to lock in risk for the future, and how do we address that? A couple of other sort of challenges for Wales is that we do have an older population than the rest of the UK. We've got fairly high levels of poverty and long-term illness in our population. So that's something we're very much aware of in terms of the effects of climate change. I think that was it. I just wanted to also just mention our kind of industrial legacy as well in Wales. We have a range of kind of infrastructure, old mines, and also coal spoil tips that are causing concern. There is an inspection regime in place now, but we know that the more extreme rainfall could impact on those. Thank you.
Excellent. Thank you very much indeed. I think it's really useful and really interesting to hear these kind of different aspects from different parts of the country, and just how different places are dealing with it. So can we just move on to Anna Bezic, who's head of Climate Ready Leadership in SNIFR, which, as I understand it, is a kind of multi-sector focus on climate change. Is that correct? Perhaps you can clarify that for us, first of all, in Scotland.
Thanks very much, Sue. Thanks for the welcome. Yeah, so SNIFR is a sustainability charity, and we specialise, many of our projects and programmes focus specifically on climate adaptation and climate resilience. So I've been asked today to provide you with a little bit of context around what's happening on climate adaptation in Scotland. And as part of that, I'll certainly touch upon the kind of collaborative and cross-sector work that we have underway. So I guess some sort of foundational information about our context. Responsibility for acting on climate change has devolved to the Scottish Government. So there is a separate climate change act and legislation in Scotland which requires a statutory adaptation programme, and that links back to the CCC's risk assessment process that Baroness Brown outlined for us at the beginning of the day. So that context is there. I want to highlight maybe 2 or 3 things that I think are maybe, if not unique, then kind of key characteristics of Scotland's approach to adapting to climate change, which I think are a little bit different to the picture across England, Wales and Northern Ireland, because I felt that might be interesting for the audience. First is a focus on locally led climate adaptation. Recognise both at government level that the impacts of climate change will play out differently at different locations in Scotland, and that local partners need to be enabled to respond to those challenges in a way that connects with the local culture, heritage and values that exist there. So there are a number of subnational climate adaptation initiatives in Scotland covering cities, regions and islands, which are locally developed and locally led. The second point I would make is, I think in Scotland, we're moving towards placing a much stronger emphasis on the need for local knowledge and lived experience to inform how we adapt to climate change. We really recognise the value of technical and scientific evidence bases, the role of academia, but we feel that's not enough, that we need to bring in the lived experience of communities, both because we really need the evidence and insights that are held locally, but also because doing that enables us to move towards a more of a transformational approach to climate adaptation that involves the whole of society, rather than thinking we can deal with this through engineering solutions and science, which we can't. Yeah, so I think the third point I would make is around a programme that I'm particularly close to because I manage it through SNIFR. We manage a programme called Adaptation Scotland, which is there to support organisations, businesses and communities across Scotland to increase resilience and adapt to the impacts of climate change. That programme is funded by the Scottish Government, delivered by SNIFR, and through that we work to develop these place-based initiatives that I've mentioned, but also look to develop shared leadership on climate adaptation across Scotland that recognises the importance of senior leadership, including within the health sector, but also about local leadership as well. An example of perhaps some of the work that's happening in that space is work that we're involved with Public Health Scotland, looking at the intersection between health inequalities, climate justice and climate adaptation. How can we ensure that our response to climate adaptation benefits those who are most vulnerable in society and doesn't add additional burden to those groups, is a key question for us. I'll stop there and look forward to the questions and discussion. Thank you.
Brilliant, excellent. So I think that's really helpful. That's given us a kind of very quick and very helpful pen picture of what's happening similarly and differently across the different countries in the UK. I wonder if I can ask you all a further question, which, and some of you mentioned it to some extent, but I just wonder, you picked up the issue about leadership, and I just wonder about what are the challenges of leadership, particularly in relation to adaptation, possibly at a kind of national political level, from the health community, and also at a local level. And I just wonder if all four of you might just say a word or two about that. That would be helpful. Lee, do you want to start?
Sure, thanks. I think one of the great challenges in leadership here is the sort of the scale and the scope of and the mixed jurisdiction of a lot of this work. So health obviously has a clear devolved jurisdiction with a strong local remit, but leadership up to the national and four nations level, whereas provision of climate data is centralized, and there's quite a shared, and I would say complicated relationship between the local and the national level in terms of different responsibilities. I think this is complicated by the fact that I mentioned previously that other sectors, decisions in other sectors are quite critical. So health adaptations might actually need to be implemented by non-health agencies. So I think the complexity of the governance around adaptation is sort of a core barrier. I think in addition to that, on leadership, there are very few people who have both training in climate and health, and understanding climate and the ways that it impacts health and working with climate data is not something that's quite easy to pick up. Whereas a lot of climate scientists might have deep climate science expertise, but those in many cases don't extend to engaging in sort of both the vocabulary and the types of things that resonate with the health community. And so bringing together the climate and health community, and I would propose going so far as saying we really need sort of a new generation of who actually are deeply informed in both the climate and the health side to be able to sort of speak these dual languages, especially when it comes to working with data. I think that would be pretty important.
Okay. Stephen, do you want to? I think we're probably all fairly familiar with some of the national political issues in Northern Ireland, but you may want to outline those, but particularly also in relation to how that impacts on health leadership and local leadership.
Yeah, I mean, I think if you take Lee's point there and place on the Northern Ireland context, then where that lack of strategy is so obvious in terms of the decision making and there's a lack of strategy within the Department of Health, but then there's just that wider kind of political malaise as well, which those two things together obviously just don't lead to, well, they lead to just a lot of challenges. It's an interesting question, this one. I think that lack of policy direction and the kind of issues in the government are important. There's a slightly different context to the governance as well. Local authorities have a different remit in Northern Ireland than they do in Great Britain. There's not really a health remit in local authorities either. So in some ways it's an opportunity because the Department of Health really does have quite centralized control, and so that they can really move if they want to. I think probably also I didn't mention maybe as much on the health context and the kind of social context in Northern Ireland as part of my presentation, but there's quite a significant amount of deprivation in Northern Ireland as well. It's one of the most deprived areas of the UK across multiple indicators, and quite high sort of social isolation, fuel poverty levels very high. Quite significant ill health actually as well around kind of cardiovascular respiratory conditions. I think I went back through it researching for this presentation, and out of a population of 1.9 million people, 465,000 people have a cardiovascular condition. This is really quite significant. So some of that context, I think, obviously provides additional challenge, just to kind of provide a little more context around some of the implementation issues that Northern Ireland faces.
Okay, thank you. And can we move on to Anna?
Sure. I guess to mention two things that haven't been covered. When it comes to leadership on climate action, there can sometimes be a tension between competing priorities, especially when it comes to the need to reduce emissions and the need to adapt to climate change can often be seen as competing priorities still, which is a real shame. So politically, the focus has been on mitigation and reducing emissions, and that absolutely needs to remain the case, but we also need to really raise the profile of climate adaptation. It's practically a more difficult thing for your traditional kind of like hierarchical leaders to engage in, because it's about reducing risks. There are no things to open sometimes. There are no like success milestones to announce when you successfully avoid a risk from actually playing out. So from a comms and engagement perspective, it can be quite challenging at the outset. So that's one dimension of like one of the barriers I think can exist and can be overcome, but can exist. I think the second maybe is more a reflection on local leadership, and it's to do with hope and the need to think about actually what does climate ready look like? What are the outcomes and the positive vision of a climate ready future that we're working towards? How can we be open and honest about the challenges that different places face? Like Neris mentioned, all of those communities in Wales on the coast. How can we begin to really face up to some of these challenges in a way that's empowering and involves people and looks at actually what a positive climate ready future looks like. And I think that can be, that kind of framing we have found can really engage people and move people from a place of fear about this issue and a reluctance to address it towards thinking about it. And the role of cultural and creative practice is an important aspect of that, we think, in the years ahead.
Okay, and Neris, can you give us some picture of whether there's particular challenges about leadership on the various aspects I outlined in Wales?
I think I'll probably kind of comment more generally about leadership. I think I agree with a lot of what's been said already. I think what I'd add to what Anna was just saying is having that humility. I think, you know, there's a lot we don't know, and even when we've got, you know, sometimes what Anna said earlier about listening to communities and valuing their knowledge and the local knowledge, because I think sometimes we're more comfortable, some leaders are more comfortable being in the expert position. I think this is a situation where obviously technical expertise is really important, but ultimately we're heading into the unknown. We don't have a blueprint really for everything that's going to come, and I think we need leaders that are prepared to have that humble, open conversation and engage both their organisations but the communities who are going to be affected in finding the solutions, and also creating a vision, a positive vision, like Anna was saying, about what is, I like your term, Anna, climate ready. You know, how do we create a healthy and well community in the context of climate change? So I think actually we need leaders who can really step into that and also recognise that this is a difficult arena, can be difficult to be talking and thinking about every day. I attended some really useful training about last year or so about having difficult conversations about climate breakdown, and I think that's a skill. We need reflective practice on that. Going into something slightly different, I also think accountability and governance, as Leah was saying, is really important, and particularly where there's difficult decisions to be made for communities, I think it's got to be really clear who is accountable and what is the process for those decisions, and how are communities engaged and enabled to be an equal partner or engaged in those decision making, and having transparency over the kind of information on which those decisions are being made. So yeah, I think those are the two elements of leadership that I'd highlight.
Thank you. And just picking up on that, and also on what Anna was saying previously about you know, building on the lived experience and having that in. I wonder whether each of you might also, I mean, you've talked about it a little bit, but how can we better engage with the population to have that conversation, if you like, and to get that ownership from the population or the local community or whatever it is, particularly on adaptation. You know, the first talk this morning from Baroness Brown, I mean, she very clearly said, you know, unfortunately, public communication wasn't in her remit. We heard from one of the other inputs that they really worked on any public messaging through partners. And so I just wonder, you know, what are we doing in the different countries to actually try to engage the population, or is that very much left to the local level? And is there a better way of doing it that could overcome some of these barriers about not moving this agenda forward perhaps as quickly as we might need to? Neris, do you want to start on?
Yeah, that's great. Thank you. I think we've got some really encouraging things happening in Wales on this. So the Welsh Government is, I can't remember if they have published it or they're going to now, but they are publishing a strategy around public engagement in climate change. So I think that's very encouraging. We've seen some really positive work in Wales over quite a number of years now around climate assemblies and that have engaged all sectors of the community in discussing what their experience is already of climate change, what their concerns are, what they think needs to happen. There's been some really good work done regionally by Alan Netherwood and David Thomas on local adaptation planning and engaging local communities again in a process with various organisations to discuss, okay, what are we already seeing in our community? What do we need to plan for? Also, some of my colleagues in Public Health Wales have done a public survey so that we understand more about what the public's concerns are. We've also had work on using storytelling methods to engage people who might not traditionally sort of get involved in policy to hear their voice about their concerns, and that included young people. And then the last example I'll mention is that obviously in our own team we support people with using health impact assessment, and that can be a methodology that is participatory and engages a community in exploring how it might be a flood policy, it could be more generally the health impacts of climate change, but actually offers a process to engage people in identifying what they think the most important impacts are and what they think should happen. So I think there's actually quite a lot of different methods we can use to engage the public on this that kind of gives them the opportunity to have a voice in plans for the future.
Okay, thank you. Please, all four of you, do feel free to kind of come in and talk to each other. You don't need to just talk to me in the audience. So please do, you know, feel like if you want to ask each other specific points, do. I mean, on that health impact assessment, is that always at a national level, or is that, you know, national Wales level, or can it be at a local level and so on?
Yes, it's been applied locally, both to a flood defence work and also with a particular community affected by changes to the coastline, and it was used very much to get the community's views on what they felt the community needed to protect their health and well-being. So yes, it can be used at any scale. It could be project specific, it can be place specific, or it can be national.
I mean, I think if there are any links to any examples of any of those things you were just talking about, those would be really helpful for us to share with the people who are participating today, if that's possible.
I will. I'll pop them in the chat later.
Great.
Yeah.
Thank you very much. And Anna, do you want to elaborate a bit more on some of your kind of population engagement side of things? You
I would love, yeah, I would love to see. That's a brilliant question. So first, I'd like to talk about power. And I've learned through working with colleagues at Public Health Scotland a lot about the root causes of health inequalities and income, power and wealth being kind of fundamental to those. And that's really taken me on a journey of just actually what does it really look like to involve people in decisions about that will affect them about local climate risks, and the collaborative approaches that are being developed in Scotland across cities, islands and regions. We want to find ways of genuinely involving a broad cross-sector of society in those. I don't agree that this should be a local authority led initiative. I think local authorities should be a part of it, but it needs cross-sector collaboration and it needs the involvement of the third sector and diverse voices if it's really to drive a kind of a much more progressive change process. So I think that is a hard thing to achieve, but I believe it's something we need to really move away from thinking we need to communicate with the public, tell the public stuff and they'll then know what to do. I think that implies to me a kind of hierarchy that's unhelpful around who holds the knowledge and who knows what to do, because actually we need multiple sources of knowledge to inform what we do. So that's my first, I guess, very passionate thought on the topic. More practically around what are some of the tools and resources that are being used, I wanted to flag, I guess, two categories. One is about integrating discussions about climate justice and climate adaptation into just community regeneration and development that's happening anyway, because we know this is not an issue that is going to be a priority for for lots of communities who have got many other challenges. So we have something called a place standard through a climate lens, which was developed by Public Health Scotland, Architecture and Design Scotland and SG, which now has a whole kind of set of resources that help to include climate change as part of local placemaking, which is addressing many issues. The second point is about how are we practically trying to find different ways to gather local knowledge and lived experience. Participatory mapping processes have been really important for us. I shared a link to some of our work in the islands, which have used that quite extensively to map out through in-person workshops. We're just trying a new digital platform across the Highland at the moment to collect these stories, and then we'll be able to analyze those hopefully as part of like the more formal evidence processes that go into climate risk assessments. But I'll get off my bandwagon. I'm sure others have got lots of views as well. Thanks for the question though. Great discussion.
Very interesting to hear your bandwagon. Don't feel no getting off it. And are those applicable and informative about adaptation as well as mitigation, because a lot of the general stuff has been done on mitigation, I think.
Yeah, so the place standard through a climate lens tool is designed to address both equally, like in a holistic way. We think, that it's unhelpful to separate the two. It doesn't mean anything to anyone that's not a specialist in climate change. The stuff that's happening, like the participatory mapping, focuses more on local climate impacts because those are rooted in informing risk assessments. So making sure that the risk assessments that inform adaptation action in the Highlands and Islands, it uses the best available science, but draws on the local stories to enrich that and help create that sense of ownership and local input to the decision making.
Okay, thank you. And can I move on to Stephen and just hear? Sorry?
Can I just ask a question, please?
Yeah, sure.
I was just going to.
Can we just finish this topic? Is it related specifically to this discussion?
It is related to what they are saying. So my question is, to what extent are the overall conditions that we are going through and they've been going through kind of preventing people from engaging with the need to adapt? because of the cost of living crisis, because of the issues with deprivation, the huge inequalities. To what extent do people feel that they actually have the power to influence the course of action, that they have a voice and they have the availability, the space to really think about these questions when they are really facing such challenges in terms of basic survival.
Okay, does anybody want to pick that up specifically?
If I'll just come in briefly, if that's okay. I think the surveys that we've done with the public in Wales has shown that climate change is still is a major concern for our population, although one of their top concerns is about how it could impact on the cost of heating and cost of food. So there's definitely a relationship in people's minds that, you know, I think the other thing is when we were engaging stakeholders for our work on the health impact assessment, one of the people that we interviewed, you know, said to us, you know, a lot of people are more concerned about putting food on the table than flood risk planning. You know, what's at the forefront of their mind is actually how I'm going to afford tea, you know. So I think it's a good point to raise, you know, is that you know, people's so I think we know there is a high level of concern about climate change in the population, and they are concerned about the health risks, but there are very immediate concerns as well linked to the cost of living crisis.
And there may be, of course, something that we ought to be demonstrating the connections between these two, because obviously some of the energy costs could perhaps be reduced if, you know, there was better insulation, or, you know, solar panels, or so on and so forth. So obviously there is a connect between these two, but it's quite hard sometimes to make those connections when people, as you say, are just worrying about, can I get tea on the table for my kids?
Can I jump in here?
Yeah, please do.
I guess just to provide the alternative perspective. Some of the research results that I've seen have shown that despite competing priorities, even sort of coming out of COVID, interest in and concern about climate change is becoming more and more robust. So it's not sort of dropping down every time there's another challenge in society. It's actually remaining high. So people are interested in climate change as well as other things. Now, people's ability to take action on that it may be compromised, but I think people are interested, and often that's because what resonates is not climate, but weather. So people are experiencing the heat, people are experiencing the floods, and so those things sometimes, I think, with communications with those that aren't working in this space, it's actually what resonates with people on the ground, and in many cases that's what they experience. We don't experience climate. That's something that we only see in the data and long-term observations. What we do experience is weather and the impacts that has on our kids in schools, the impacts that has on us when we're going to the office, etc. And so I do think that there are ways in which people are interested in engaging, and in fact, challenges such as cost of living crisis, which was related to fuel poverty, which is related to the war in Ukraine, has actually created conditions to make alternative energy sources more viable, more economically viable. So there actually are some positive sort of mechanisms that are occurring, and I don't see that people are less interested. So to me, the engagement actually is growing. It's the probably that remains a problem, and that's why I guess to throw in what I think is a key priority is to move really from paralysis, a sort of doom and gloom paralysis approach, to more pragmatic. So really professionalizing. This is business as usual. Adaptation needs to be business as usual. It needs to be We'll know we've succeeded when it's boring. When we don't need advocacy because it simply is business as usual, that that we're just responding to risks as we do any other kind of risk. And so I think really that's where we want to go. We want to make climate change and health boring. I don't think it will be leading up into the middle of the century because we're just facing increasing risks. But in a sense, we want to integrate this as to be mainstreamed, and that's where I think there's a real tension between advocacy, which of course plays an important role in any civil society and sort of movement on new issues, and sort of mainstreaming and professionalizing the work that we do. And major transitions in societies usually happen through sort of a messy movement of multiple things happening at once. And I do see we are moving forward, but the incentives that some people will have will be different from others. And there's going to be lots of shades of green, so to speak, in this space.
So Lee, is engaging the population a kind of key remit of your Centre for Climate Change, or is this really not in your
yeah, absolutely. I mean, the population of the UK and the health of the UK is our ultimate client, so to speak. It's a large population, so we can't engage at the level, we can't engage equally with all regions and all people. That would be unreasonable. We are mere mortals, but having a sense of what people think, how that influences their behaviors, what types of messaging might be appropriate, what people want to know and what people need to know, and how we can provide that within our remit or in collaboration with partners is absolutely fundamental. And so that might be working with our behavioral sciences unit to sort of track changes or track understanding of where those behavioral levers are. That might be really understanding how perspectives and behaviors differ in London versus in the north of England, and how things like equity and geographic variation play a role in how people experience both risks, vulnerabilities, and adaptation. So I think we wouldn't be doing our job if we didn't care every single day and constantly about the population and looking for ways to really be connected with some of those trends, even if it's at a slightly different scale and resolution, I think, than some of our other partners.
Thank you. That's really helpful. And how much of your information, I'm still sticking with Lee here, can actually, does that only cover the England, or are you able to cover the UK and some of that?
Sorry, did you say England versus the UK? Is that what you just said?
I'm just asking whether some of what you've just described actually covers the whole of the UK, or does it really only cover England?
Yeah, it's sort of great and very complicated question. So the UK, like Canada, where I come from, has a complex devolved government. And so in some cases, our remit is for England. In other cases, we might have a limited remit for the UK, and maybe even in the case of some of our vector-borne disease work, it includes UK overseas territories. In many cases, what we do is simply work with foreign nations partners to see the extent to which we can align the work that we're doing. So there might be activities we're involved in that might partner with Wales, Northern Ireland, but Scotland may be doing something different. So in general, it tends to be on an activity by activity and case by case basis, depending on how the foreign nations want to work together and on what. So there isn't one answer to whether we're England or the UK. It really depends upon the specific area, partnerships, engagement. Again, partnerships are what matters.
Yeah. Okay.
Something like vector-borne disease is an area where we have tended to cover. We will sort of share some of those projects and partner on some of those projects. Whereas in other places, the 4 nations are doing to get together and be communicating and trying to learn from each other.
Excellent. Okay, thank you. And Stephen, did you want to come in on any of this about public engagement?
I think probably not too much more, just to say that, you know, there's public engagement done well takes time and takes capacity, and you know, I think we've heard a lot of really great information, Agustino, and all the information that's been developed there for the people that are already having conversations with the public around health, and thinking about how we can kind of link that into existing conversations that are already ongoing with practitioners, with community resilience, community planning, partnerships, etc. Some of that is capacity for their own bandwidth. I think to sort of so I think that's a bit of a challenge. It's not necessarily a lack of information in some ways, at least in the first instance, to kind of get going and to start moving in some of these things. But the bandwidth piece, I think, is quite important. The Met Office have done some good work at starting to this kind of climate services piece as well. There's some quite good work done for Belfast and Bristol as well, I think, like a heat service, and so that started to break down even a kind of sub-city level into different electoral wards about kind of some of the key indicators that would drive vulnerability in relation to heat, and that means that then an elected representative is able to directly see, you know, even if it's just a picture of the future and not quite the exact way that things will pan out, they're able to begin to get a sense of the conditions in their own electoral ward, for example. So I think information that's done thoughtfully in that respect as well can be quite useful, and I think probably start to see more of that over the coming years, you know, if the resource is dedicated to it. So yeah.
Okay, thanks very much. And just for us to kind of wrap up this session, I wonder if I could ask all of you if you had one message for what the Faculty of Public Health should be doing on adaptation, other than running this conference today, which we're obviously doing. What might that be? What would be the most important thing for the Faculty of Public Health to think about in terms of, or to action in terms of adaptation in climate change? Stephen, do you want to go first? Only because you're sitting in.
Well, I maybe refer you to my earlier point to some extent. I think the data gaps, I mean, just if I'm here to kind of represent Northern Ireland, particularly the data gaps in Northern Ireland are huge. So a general plea, really, if there is research going on that is kind of happening in Great Britain, if that could be thought through, or you know, that Northern Ireland could be included in some of that. It isn't always the case, and I think it's the prayer for it. So I think some of those key kind of health effects of extreme weather, and just getting the existing baselines in place would actually go a long way. So that would be maybe my plea.
Okay, thank you. Lee, do you have a message for the faculty as to what we should be doing?
Yes, just to clarify for those many out there, it's Leah.
Oh, sorry.
No, no problem. Just don't want to perpetuate that. Call me Lee if you need to. I would say, I guess, craft an optimistic vision for what future public health can look like. Sort of create a vision for hope. What would a good future look like? What would doing it right and succeeding be? And how can we get there? So really moving from, like I said, paralysis to pragmatism and hope, I think is really important for empowering people to think this isn't just kind of running away from a tsunami, but running towards something that can be both environmentally positive, but there are huge health benefits that we can gain from some of the changes and transformations we're talking about. So to try and sort of constantly focus on that positive and be really visualizing and articulating what that optimistic future state might look like.
Okay, thank you. Thank you very much, Leah. Neris.
Thanks. Oh, I agree with both of those. Really, really good. I think what I would say is make it a priority. You know, everybody in public health needs to make this a priority. Whatever the nature of your focus at the moment is in public health, you know, it could be promoting physical activity, it could be reducing poverty, it could be, you know, improving, you know, trying to reduce emergency admissions in older people. Climate change will have an impact on that, and I really think everybody needs to embed it in their work and understand how climate change is going to affect all of our other public health priorities. But the other thing is, we know from a survey with staff in PHW, but also in our partners, that actually a lack of priority to climate adaptation was the biggest barrier our respondents to that survey said was affecting their ability to work on it. So I think we need leaders to make it a priority.
Thank you very much. And last but not least, Anna.
Yeah, thanks, Sue. I think it's brilliant to have this conference today, and really encouraging to see the public health community leading and opening this conversation up. But let's take it beyond those who are here today to the public health professionals at large. Actually, how can we help this be taken outside of the remit of the climate change lead to actually something that is, you know, public health consultants covering many different domains are confident and literate in this topic. And I think that would greatly enrich all of our work to adapt climate change, because they would bring solutions, options forward that we don't currently know about because not enough people are aware of this issue. So this is a great start today, but I think in terms of professional development, training, opportunities for people to really contribute, just further increasing that would be really good.
Thank you to all of us. I mean, I think that's been a really helpful session. Certainly for me, it's given me a really good pen picture of what's happening in the different countries, which is really helpful. And I hope that's been helpful to others listening, because it's often quite difficult to pick up what's going on elsewhere. I think the messages that have come over to me are very much about how important this is to work intersectorally, and we need to do that more. I liked very much the idea of having an adaptation lens on things, and we've heard also really interesting suggestions and practical examples of what's going on in terms of the engagement with the public, both broadly as a sort of national level, but also more locally, and any examples that people want to put in the chat of what's going on some of those sort of things, particularly on adaptation, but obviously more broadly. And I would encourage people to, we do have an offer for people to put in local case studies that don't have to be published research. They can be local case studies that we have as resources on the faculty website under the SDSIG resources, and it would be really useful if people continued and encouraged others to put in those examples, because they are really helpful for other people being able to pick up and go, oh, they've already done this there, let's see how we can do it here. So thank you to all four of you this morning. Really useful input on this already very interesting adaptation conference, and thank you for your generous contributions. Thank you. I think
thank you, Sue.
Thank you.
Yeah, just thank you very much, and Sue, for sharing an excellent session. And I agree with that. I was particularly taking notes with the very final part about some key messages for the faculty as well. So without further ado, we're going to go into lunch, and we'll start on time at 1:30, and we will kick off. Kat is showing this afternoon, and then we have some abstract presentations. So look forward to seeing you. Don't go away, and have a good lunch, and have a look at the chat. There's some great links in the chat if you haven't had a chance. Thank you very much. See you at 1:30. Hi, afternoon, everyone, and welcome to this afternoon's session. I was expecting Kat to start the meeting, and she's not around at the moment unless she is. If not, let's make a start anyway, because I think it's important to keep to time. And so we've got a very exciting couple of presentations coming up. Can I just check, Roger? I think I saw you there. You're live. Yeah, great.
Yes, I'm here.
Okay. Yeah, thanks. Sorry about the delay, Roger. Let me introduce you. So Professor Roger Gupta, who is a Professor of Sustainable Architecture and Climate Change at the Oxford Brookes University. Kat, I just see you started. Do you want to carry on? I'm very happy to let Roger, let's get you started, and then we can come back, and Kat, you can come in after that. So Roger, over to you. Thank you for joining us.
Okay, thank you, Paul, and thank you, Kat, for inviting me. I'm just going to share my screen. If I can check, can you all see my screen? I'll make a
slide. It's come through all right. And okay. Yep, perfect.
Brilliant. Just going to close this. Yeah. Okay. Right. Okay. So yes, thank you for inviting me. And what I'm going to talk about is essentially the perspective from the building side. As a professor of architecture, I've been kind of researching into building overheating for about 20 years now. And it is an issue which is very current. It's also going to get worse as we kind of head into a warming climate, and has lots of health implications, obviously. Our work has, straddled across domestic, non-domestic sectors, and I'm going to draw upon, some of our projects as well. So I'm going to kind of cover a little bit about us. What do we mean by, overheating in buildings, which is a key effect of, climate change, and a key priority for climate adaptation. And then our research on overheating, I'll pick up the homes and care settings. We also do offices and other settings as well. And then talk a bit about those resilience measures for tackling overheating, because it is a problem, but how do we tackle it then? And just end with some final thoughts and maybe some knowledge gaps that might be interesting to kind of discuss there. So I run the Low Carbon Building Research Group and Oxford Institute for Sustainable Development at Oxford Brookes University. We do a lot of research on energy and buildings, but one of our key areas is looking at climate change adaptation of buildings and neighborhoods. So I started doing that, quite some years back with an EPSRC project called SNAC, which was looking at suburban neighborhood adaptation for a changing climate. And then we kind of, got deeper into building overheating and adapting, real buildings as well for a changing climate. Broadly, our kind of research themes fall into these kind of aims. So we try to understand deeply the factors that contribute to overheating. And these could be physical factors, those building factors, human factors, also institutional governance, factors that affect our overheating issue. And this could be in homes, this could be care settings, it could be offices. And more recently, I've started to look into captive environments, by which I mean prisons. We also then look at strategies, mostly passive, that can avoid summertime overheating, both currently and in the future, and then develop policy recommendations. So we worked through our Climate Care project with UK Health Security Agency. We've also worked with a Care Quality Commission, and it's been a kind of an interesting experience for us in understanding those kind of policy implications of our research. And I'm going to draw some of those in the presentation. But first of all, what is overheating and why does it matter and why now? I think the key thing to remember is summertime overheating in buildings and even in temperate climates such as UK is becoming widespread and increasing. There's a lot of research now that has kind of revealed the extent, severity, and causes of summertime overheating in different types of buildings. So it's not just homes or care settings, it's schools, offices, other settings as well. We also have seen very recently the mandatory regulations on tackling overheating using the Part O that has come about from building regulations. That's the first time it's been brought in to really have an assessment about the risk of overheating in new buildings. For existing buildings, there is still a lot to do. As Committee on Climate Change said in their last climate change risk assessment, that there remains little incentive to retrofit adaptation measures to reduce overheating across the UK. What is interesting is in building energy models, such as the one that's widely used for energy assessment, Standard Assessment Procedure or SAP, it does not estimate cooling loads yet. So, it's very difficult to justify why, overheating related measures need to be looked into. Overheating in homes is a bigger issue as well, because we spend 90% of our time inside buildings. A lot of us have home working as well. So we do get affected more when it's very hot. And it's going to only get worse with the warming climate. There was an ARUP report recently prepared for Committee on Climate Change, which confirmed that 9 out of 10 UK homes will overheat at 2-degree warming. And smaller houses and flats are more are at greatest risk of overheating. And that's the report that they produced here. And previous to this report, there was a report by Bayes, which said that by end of this century, about 75 to 85% of cooling energy consumption might happen in the domestic stock. So that's again a big driver. And you may have seen recently that there was an article in Guardian which said that because of the demand for air conditioning in homes and buildings, coal-fired power plants have had to come in the last few weeks. So again, it has lots of other implications for our energy system also. From a health point of view, overheating affects, of course, mortality and morbidity, with the elderly and vulnerable particularly affected. So it disproportionately affects those who are already vulnerable and probably are spending a lot of their time inside buildings and need to really be kept safe. There is no consensus on what is overheating, because it's very subjective also. But although there's beginning to be more consensus on what the threshold for overheating is, but there's no universally agreed definition. Specifically, overheating really refers to at what temperature a space or someone in that space gets overheated. We have both static and dynamic thresholds that have been used to determine overheating potential in a space. Interestingly, they have been derived from thermal comfort and not health that much. So, there is kind of a lot of work to be done there. I'm not going to kind of go through details of each overheating standard, but this is more to give you an idea of, the kind of standards that are there. SIPSI, the building service engineers, regard 26 degrees in bedrooms and 28 degrees in school, offices, and living rooms as the threshold. And if 1% of annual occupied hours are greater than those thresholds, then the space is deemed to be overheated. There are some dynamic criteria, because most of UK buildings tend to be free running or naturally ventilated. So temperatures inside are dependent on outdoor temperatures. So you calculate a indoor threshold based on the running mean outdoor temperature. And then if your observed temperatures are over that threshold, then the space is said to be overheated, looking at these 3 criteria on the right hand side. The standard assessment procedure that I referred to uses a crude figure of 23.5 degrees. Passive house planning package regards 25 degrees as that threshold, and they look at 10% occupied hours over that temperature. Housing Health and Safety Rating System, which is an important instrument to inspect buildings for overheating risk, really looks at outdoor temperatures. So they are looking at external temperatures when they go over 25 degrees, then they're kind of looking at the risk of overheating. In homes, there's more consensus now on what overheating is and means. And the focus really has been so that sleep is not disrupted. So it looks at living rooms and bedrooms in different ways. Because we cannot adapt that much in bedrooms, it regards that as a static threshold and presume that if over 1% of annual occupied hours are above 26 degrees, then the space is overheated. For living rooms, it's more adaptive. And essentially, it's saying it depends on outdoor temperature. And if 3% of occupied hours between the non-heating season, which runs from May to September, exceeds the threshold, which is determined by the outdoor temperature, the space is deemed to be overheated. So it kind of gives more flexibility in terms of regarding adaptation. And these thresholds tend to be used for design of buildings. And within that, what we've been trying to do is research on identifying the scale of the problem and how we can tackle that problem. And I'll focus first on existing and new build homes, and then I'll go into care settings. So this project, which I mentioned, SNAC, we ran models using GIS tools to really look at the risk of building overheating across neighborhoods, both now and in 2030s and 50s. Under various emission scenarios. So we looked at Oxford. This is from Oxford, and we also had Stockport and Bristol. as 3 different cities, and we were trying to find that, which kind of homes overheat, what location, and clearly Southeast was, really a location where overheating would happen sooner. East-west facing homes experience more overheating, those on exposed streets. Darker pavement and external wall and roof surfaces increased solar energy absorption. So again, that was also contributing to overheating. Built form, smaller floor area, which is why, smaller flats and homes tend to overheat more. Location of glazing, so presence of roof lights or room in the roof can actually accentuate this risk. And of course, lightweight structures can also do that. So it was more of, physically driven kind of study, looking at those physical characteristics that can affect the risk of overheating. We've also been monitoring buildings for a long time now, and we were looking at this series of homes which were new build, retrofitted with some improvements, and also existing with no retrofits. And what we found was that overheating durations in flats, they are 2 to 4 times more than other dwellings. So flats tend to overheat more because there's less exposed surface area to lose heat. Mid-terrace houses have a higher degree of overheating. End terraces had the lowest because they're more exposed sides, so could lose heat quicker. New builds have a tendency to overheat more, especially we found in living rooms, but bedrooms also overheat. And interestingly, we found insulated dwellings experience overheating twice as frequently as those without. So what we are not trying to say is don't insulate buildings. We're just trying to say there is a correlation, probably not a causal relationship here, probably a correlation. And you can see here that, essentially homes that had some levels of insulation had higher occurrence of overheating because probably insulation was done without adequate ventilation. And that is probably what led to that risk. We've also been looking at, low energy buildings. These are some flats in Surrey, and most of these flats we found overheated, whether they were static or dynamic criteria. And this was not just a Southeast England problem. When we looked at York, for example, again, new homes in Derwentthorpe development in York, and again, most of the dwellings overheated there as well. So the point really is that this is a widespread and prevalent issue that is happening now in homes. But then also we have vulnerable settings, and I want to kind of stress this here because vulnerable settings are disproportionately exposed to the risk of overheating, and also house older people who might have underlying health concerns. So if we look at the care sector, which has already, of course, received a lot of attention during COVID, we have found that, of course, heat-related mortality during heat waves has been highest among occupants of care homes, whether they're residential or nursing. And this is despite the presence of care staff that could, act to protect vulnerable residents. The climate change risk assessment has also identified summertime overheating in care settings as a key risk and a priority for research, both for the health and social care system. And one of the other issues is that care homes have been designed to keep people warm, which is fine, but we also have to keep them cool in the summer. So because they've been designed, built, and operated with the aim of keeping residents comfortably warm, and that's the culture, we see very high temperatures in these settings, some of which are pretty detrimental to health. And I'm going to give you some of that evidence now. So most of this work is empirical. So we were trying some models as well to look at what's going to happen in a future climate. And we started this work in 2015. This was funded through Joseph Rowntree Foundation. And we looked at case studies. There were 2 case studies for care homes, which, have single bedrooms with access to on-site care services. And there were another 2 which were extra care. So they're slightly more independent. And they were located all across England, as you can see, different parts of the country. And they had different kinds of constructions. They were quite archetypes in their approach. And what we found across all of them, and this was a relatively cool summer in 2015, that most of them were actually experiencing temperatures above 26 degrees. And that was the threshold given by UKHSA and Care Quality Commission as the threshold that one space needs to be kept below this 26 degrees. And as you can see here, most of the spaces we monitored were above. Short heat wave that happened in 2015, you can see here in July, actually meant that temperatures stayed warmer even after the heat wave. And when we applied those static and adaptive criteria, as you can see, the pink ones show most of the spaces across the case studies, whether they were bedrooms or communal areas or offices, were overheated. When we looked at what was the effect of a warming climate, so we modeled this just to look at were the models also showing a similar current risk, and interestingly they weren't. The models were under predicting overheating, so only a few spaces were found to be slightly overheated, and even just at some elevated temperatures currently, which increased slightly by 2030, then by 2050 increased a bit more, but and by 2080, of course, it increased. But when we compared that with measured data of 2015, most of the models were under predicting overheating. And that's also a concern that how we can improve our own models to be able to accurately predict the current risk of overheating as well, so we can adapt these settings. We then went on to another project. We kind of built these 4 case studies and worked with NERC and UCL and LSHTM to focus on care homes in London. And we kind of brought in lots of different methods. We expanded our monitoring. We did a thermal comfort survey, which hadn't been done in care homes. We took interviews with care staff. We modeled for future overheating risk, and also started to look at the health outcomes of overheating with working with LSHTM. And we kind of looked at these 5 case studies across different parts of London. And they were again different construction, different built forms, and some were privately owned as well. And interestingly, similar findings emerged. So this was again done in about 2018-19, and you can see again the temperatures are much above 26 and 28 degrees, even touching 35 degrees in some cases. Warmest locations were now bedrooms, where temperatures were higher at night time, affecting sleep. There was a lot of concern because there was no cross ventilation. All the ventilation strategies had to be looked at, because some of them had closed the trickle vents over windows, to get some background ventilation. And we were measuring very high CO2 levels as well inside, which is a good kind of indicator of ventilation rates. We then also had undertaken thermal comfort surveys, both with residents and staff. And as I said, in hybrid settings as these, some interesting results emerged. So the indoor temperatures at which staff considered warm and hot were very different to those of residents. So staff were feeling hot around 29 degrees, where residents were not feeling hot until 32. That was probably because residents were much more passive than staff and really needed some external kind of stimulant to help them adapt for overheating. We've now extended that project much wider nationwide. We now have nearly 50 care homes being monitored across England. And we are trying to now build that care home stock model to really look at this longitudinal data we've been monitoring for 2 or 3 summers in some cases, and look at the impact of the heat exposure on health of residents as well. And what we are finding, this is from last year. So these are really interesting results, because there was this heat wave record-breaking heat wave in July, and we were looking at temperatures before, during, and after. And you can see that indoor temperatures, have stayed considerably high during the heat wave, but even stay like that after the heat wave. And they were going up to 30 to 35 degrees at the height of the heat wave, and took several days to return back. They were still around 25 to 30. And these are all the different care homes that we were monitoring. And essentially, you can see this is the before heat wave, this is during, and this is after. And you can see some very high temperatures are being observed here, reaching even up to 35. And then they stay above 25 even after the heat wave, because they're not able to lose heat that quickly. And this is irrespective of build form, location, and who's occupying them. So there's some very interesting kind of findings. And overheating assessment, whichever criteria you use, you can see it's all red. So they were all, considerably above 26 degrees most of the time. The comfort surveys, again, the previous one was a very small sample of 200 surveys. These are 2,000 now. And similar results emerged, where compared to residents, staff voted, on the warm, hot end of feelings. They were less likely to find temperatures bearable, and they were more likely to prefer to be cooler. So essentially, residents were insensitive to heat as compared to staff. And because of their health conditions and their age, something needed to be done to really prepare them for, for overheating. And that might be, challenging ingrained practices of having warm food or having frequent showers, and, going out in the shade. And it meant changing quite a lot of things. Remember, air conditioning is really not an option in care homes, because many residents feel it's a draft producing machine. They're not used to those devices. So as much as possible, we have to look at passive measures, which is what I'm going to talk about in terms of all these problems. How do you kind of tackle the risk of overheating? And again, this is more from a building side. And what we have done is we think these measures can mitigate overheating at neighborhood level, building level, and also even lifestyle and behavioral. Passive design, I would say passive first, because that's more effective. So whether it's cross ventilation or even single-sided, and how we can enhance it. Obviously, there is an issue that in some cases that you can't open more than 100 mm. Presence of thermal mass. External shading is very important. I'm doing a project now with other partners trying to design shading for homes, and how different facades such as south, west, and east facing can have external shading. Shallow plans, light colored surfaces to reflect heat. Corridors are adequately ventilated, and then planting and water features and at the neighborhood scale, and how that can help to reduce urban heat. But then we also need to empower occupants to manage overheating. So, we need to kind of provide accessible, usable ventilation and shading system and advise on how to use them. Different types of openings to offer flexibility. We need to provide manuals on staying cool in summer as much as staying warm in winter. And shaded balconies, other communal spaces where, vulnerable occupants, for example, can escape from heat. Temperature monitoring should help, and we need to use that kind of advanced systems that we have for monitoring temperatures, because they could be used as a way of providing a heat alert within homes. We currently have heat alert with outdoor temperatures. Maybe we need a similar one for indoor temperatures as well. And then finally, even tracking overheating. So models are useful because obviously we can have lots of models to predict overheating, but we also feel measurements and inspections can be used to identify that risk of overheating. I want to end by a few kind of thoughts to kind of trigger some discussion. What we believe is that regulations and supporting guidance are needed to ensure that retrofits that are happening in the building stock also improve heat resilience, because we are on a national retrofit program for net zero, but there is very little happening in terms of climate resilience. So what we don't want to do is solve one problem and create another, because energy retrofits, if not done properly without adequate ventilation, can make the risk of overheating worse sometimes. There is very limited evidence on measured impact of adaptive retrofit measures. There are very few case studies which have kind of tackled overheating in the built environment. We don't know the number of buildings with new or retrofitted which are adapted to overheating, so there's lack of evidence base. Indoor temperature monitoring can be low cost. We know cost of sensors have come down. There are IoT-based sensors available, but we also need to have an agreed protocol for monitoring and interpreting those measurements to really determine consistently whether or not the space is overheated. And maybe some health measurements can also be taken. We were trying to, for instance, do core body temperatures in care settings to relate that with the room temperature to see what the relationship was. Designers have an important role to play here. We need to be designing buildings for future climate and also increase daytime occupancy that might happen because of home working or other reasons. And we need to be looking at buildings that they are going to be there for the next 60 to 150 years. And then also we need evidence on the implementation and successes, failures of heat wave plans. We've been looking at that for care settings. I'm sure it needs to be done for other kinds of settings as well, whether they are being implemented, they are understood, and what's the effect of those. I think I'm going to stop here. I'm probably running out of time as well, and I'll stop sharing as well so I can take some questions. Thank you.
Thank you very much, Rajat, and really interesting to consider how we can change the buildings where we live in order to be sustainably cooler. And I think that's the key challenge. So there are a few questions that we would be really grateful if you could answer. Do you want to stop sharing your screen so that we can see?
Yeah, I'm just going to... have I stopped sharing? No. I just, yeah, I've stopped sharing now.
Now we can see it. So the first question is, what examples are there of buildings that have both that are the passive measures for heat and cold?
I wish there were. There aren't many buildings which do both heat and cold at the moment, and that's also part of the problem. There are some buildings which we have come across where shading is being implemented. Goldsmith Street, which won the Sterling Award in Norwich, is a good example where external shading has been put in. It's a social housing project of several hundred homes, and that's certainly worth having a look at. But there are very few examples at the moment, and the reason is that overheating is not perceived to be as big a problem by designers as it is, I think, and hopefully that will be changing through the Part O that has been introduced in building regulations.
I'm not meant to answer, but I would say that shutters are a very efficient way of addressing both. And if you go to Southern Central Europe, all the houses have shutters, and the shutters have insulated material. So glass wool inside them. So if you close the shutters, it prevents thermal loss during the winter, and during summer, it prevents the greenhouse gas effect that you get from the sunshine directly into the windows. And it's relatively cheap. It's just the question is, why don't we have shutters in our buildings, and why are we so reluctant, and why do we prioritize let's say beauty in our houses? And if you want to put shutters, then if it's a building, you can't put because it's not appealing visually, and then you need to apply for planning permission. You make it so difficult for people to adapt in relatively easy and cheap ways. So the other question was about heat-related sickness and deaths in the care homes. Was that monitored? You said that with this study that you are doing with UCL and LHSTM, that there is a health component.
Yes. So what we do, we don't get, just to be clear, the health bit is measuring health outcomes. So it's looking at, body temperatures and those kind of things, and health indicators. In terms of excess summer deaths, that we get as an aggregated figure, not at care home level, obviously. But that's quite helpful in terms of relating temperatures to excess summer deaths. And I think last year there were 3,600 summer deaths, out of which I think 60% were over 65-year-olds, I think. So it's not at care home level, individual care homes, but we have a good idea of that. And yes, that's an important one.
And the last question was about DIY measures like solar reflected film, retrofitted into windows. If we have another heat wave similar to the heat wave we had last year, what would your advice be for common mortals like us to do at home? And
yes, so,
again, in care homes as well.
Yeah, no, I think this is an important thing. There are lots of things that can be done without, having a lot of expense. So enhanced ventilation is a good thing where you can do cross ventilation, but that you have to be careful that if it's hotter outside, then you're going to get hot air. So maybe not doing that when it's hot outside, but maybe doing more nighttime ventilation where it's possible securely is a good thing. So shading is good. Remember, external shading is the best, and that's what Kat was saying about shutters and shading outside, but it might have planning implications, cost implications. So internal shading is still a good option if you can't do external shading. Definitely, I think those two. And then where possible, if you are in a building which has heavyweight materials like concrete or brick, worth kind of using those during your ventilation, because concrete buildings or brick buildings can absorb heat because of their thermal weight and then release heat after after some time. Films are a good thing to put on windows, where possible. I think that's certainly a strategy worth considering. But usually we find shading alongside ventilation can be very helpful. And where needed, I think fans can be put in, because fans circulate air and can expand our comfort zone by a few degrees. And I think that's the useful one to do. Air conditioning should be avoided because it has lots of other issues. because it might give some respite, but will probably suck the heat and throw it out and bring the heat in. So I think it's better to kind of look at neighborhood level as well, blue and green infrastructure, vegetation that can also kind of reduce some of the ambient kind of temperatures. But lots of things can be done, within homes. Also, we find that within a home, for example, there might be cool havens. So there might be places which are cooler than other parts. And if you can move around maybe the north side at some point, it's worth doing it when the south side is getting more solar gain. So you can also kind of begin to see spaces within the building in different ways and try and use those as per the heat.
Thank you very much, Rajat. We are already 4 minutes late for the next talk, but I don't think that's a problem. We have some leeway on the program. Thank you very much for your presentation and your contribution to this event from what is the building infrastructure element in our resilience and adaptation. Without further delay, I would like to move to our next speaker. And unfortunately, or fortunately, we don't know, but Owen Landek cannot be with us today. And we have instead Natalia Kurek, who is Deputy Director at the Greener NHS. And he's going to talk to us about adaptation in the healthcare system in the NHS. What is the role of the healthcare system and how the healthcare system needs to and can adapt to cope with the increasing demand for healthcare and maybe different demand for the healthcare that we'll see as a consequence of climate change. Thank you, Natalia.
Thank you, Kat. I will just share my slides. Do you just forgive me? Is that working?
Yes, we can see your slides. Thank you very much.
Okay, brilliant. So yes, thank you very much for having me here today, and apologies again from my colleague Owen Landek, who is unable to join today and is much more the expert on adaptation. So I hope I do this justice for all of you. But as Kat said, I just wanted to briefly touch on adaptation in NHS England and kind of more broadly within the health system. So I just firstly really wanted to start on something which will be kind of incredibly familiar to all of you, and really won't need an introduction. But why do we care? Why do we as the NHS care, and why do we care more broadly? And that's because we really understand that climate change is a health emergency as well as an environmental emergency. And I'm sure the talks today have really kind of gone through the diagram on the left and really kind of highlighting some of the really important kind of impacts of climate change on human health. And we're really seeing kind of increases in these, be that air pollution, be that kind of severe weather and heat, and kind of effects on mental health. And so all of this will impact not only patient and population health outcomes, but also our ability to actually deliver care as well, in the high quality way that we want to be able to ensure that we can deliver care to our patients. And I think it's really worth just touching on the fact that we kind of within NHS England talk a lot about kind of net zero and our kind of net zero targets, but we're acutely aware that mitigation and adaptation come together as a two, and they are equally important, and we must really talk about both of them when we talk about any interventions that we're wanting to take on the healthcare system. We're also very aware that there's a need to accelerate adaptation efforts within healthcare more broadly, mainly to reduce the harm from climate change that is already locked in, but also, as I mentioned earlier, just to strengthen health sector's capacity to actually continue to provide that high standard of care under a changing and warming climate. I think it's also just worth flagging that previously, I think adaptation and resilience within healthcare has very much sat with emergency preparedness and response colleagues, and people automatically think about business continuity. And what we really want to do is try and shift away from the thinking that it entirely sits there. I think there are the immediate needs of kind of immediate business continuity, but we really need to plan for the longer term. Adaptation and resilience really are much more focused on that longer term planning for the longer term delivery of our services as we kind of face the various threats of climate change. So again, a framework which is, I'm sure, all too familiar to all of you, but I think is incredibly kind of pertinent when we talk about health systems and we talk about adaptation and resilience. And I think for us, again, you know, a lot of the focus, a lot of conversations is always around kind of the financing, you know, the huge financing that is needed to actually support and building climate resilient healthcare systems. But I think there's lots of other kind of building blocks within this, and areas that I'll kind of touch on and focus on in a little bit more detail later will include the healthcare workforce. So, you know, 1.4 million people within the NHS itself, and many, many more outside of the kind of immediate NHS, how we can actually utilize that healthcare workforce, how we can work together in partnership on our health information systems, so that we are prepared and we understand what we might be facing, and how we can actually kind of monitor our progress as we start to adapt to climate change. And then also how we work with colleagues around kind of service delivery. So yes, that emergency preparedness and kind of management response element, but that longer term planning for service delivery, how we can actually really focus on some of that. So again, I'm sure many of you are familiar, but at NHS England back in 2020, we produced and published our net zero delivery plan, and this set two kind of very clear net zero targets: 2040 for the emissions that we control directly, and 2045 for those that we can influence. And I think what's really critical is whilst it might not have come out a huge amount within that report, it's very much understood and agreed that resilience and adaptation really is built into the heart of our net zero agenda. It really is built into each of the interventions, into each of the areas of focus that we are working on, and vice versa. One cannot be done without the other. And I think there's a real focus as well on the need to prepare for the wider health implications of climate change. And also think about how we can, how mitigation and adaptation measures are often mutually strengthening. And if we're not very careful, that they do run the risk of actually undermining one another. But actually, how can we avoid that, and how can we actually think about that mutually strengthening component? And I think also acknowledging that in the immediate term, some adaptation interventions will definitely increase our carbon emissions. But for the benefit of actually being able to kind of fulfill those business continuity measures and ensure that our staff are working in safe environments, that is entirely necessary. But we have to kind of build that into our understanding and our knowledge. So very briefly, before I kind of dive into too much more on the adaptation side, this is where we're focusing our net zero work streams, our net zero themes. But what I wanted to be very clear with all of this is to say that within each of these, we are building in the adaptation and resilience components. So for example, when we talk about our estates and our facilities, we're talking about how we can adapt and our existing estate, how we can make it resilient for the future. But also as we start to build new hospitals and new healthcare sites, not only are we building them to net zero standards, but we're also building them to be resilient for the future as well, from climate change as well. So it is being built into everything, including when we talk about supply chain and procurement. How can we make sure that our supply chain is resilient for climate change impacts, as well as also demanding kind of net zero commitments of our suppliers as well. So there are two sides to each of these work streams. I just wanted to reassure that we are very much tackling each and every one of these from an adaptation perspective, but also from a net zero perspective. So again, I'm sure this has been shown many times today, and everyone's very familiar. But just so everyone's aware in terms of, I guess, where we sit as NHS England, within the kind of the 5-year adaptation policy cycle. So what we did back in 2021 was feed into the adaptation reporting power, which you can see highlighted on your right-hand side, which feeds into the broader CCRA NAP planning cycle. And this was a report that was written on behalf of the health sector, kind of with Public Health England at the time, and focused on adaptation and resilience within the health sector. So a little bit more about our adaptation report. So the ambition of it was really to review progress on adaptation in health and care since the previous report back in 2015, and also to provide some concrete next steps that would be required to deliver on some of the areas, both at local, regional and national level. And this was really primarily focused around the identified risks that were highlighted in the CCRA, and to build resilience for the future. And there was kind of 3 main areas that we ended up focusing on, as I mentioned at the very beginning. Firstly was on health information systems. The second one was on health workforce development and resourcing. And the third one was on service delivery. So very briefly, just touching on those and kind of what was included and some of the high level insights from those sections. So theme 1 in terms of our health information systems, what we really looked at was the range of actions and systems that are present within England. And these include kind of the vulnerability assessments, research that needs to be done, integrated risk monitoring and early surveillance. And there was really some kind of clear defined next steps, including the development and implementation of the single adverse weather plan, and also better collection on our kind of greener NHS dashboard to really display risks on climate risk and local experience so that we can actually support local systems in developing some of their adaptation strategies. Another theme that really came through was on the service delivery side, and that was really broken down into national, regional and local. So at a national level, it was very clear that we think of ourselves a little bit in silo. So how we can actually really consider how severe weather may impact partner services and what we can do to mitigate some of this and how we can work together. Again, the huge reliance that health and social care has on other major infrastructure, be that roads, be that IT, be that utilities, and the importance of actually working together better on this at a national perspective. And really that focus on collaboration and how that is incredibly vital for all of these services to run. On the regional side, this was, this was ahead of the days of ICSs, but that positive movement towards regional and ICS care, and how we felt that, and how individuals within the system also felt that ICSs and regions were best placed to be developing these longer term adaptation plans. They understood the needs of their population, the risks that their specific population faced. So how can we support those systems and those local communities in developing better long-term plans? And then working at a more local level, in actually taking a look through kind of business continuity plans, responding to those, but also making longer plans for the future that are built on those plans. And also understanding the unique challenges faced by social care. And that came up a lot in the workshops that we did ahead of the publication of this report, and the complexity of this that's involved as well. And the third area, which comes up time and time again for all of kind of the big themes within healthcare, but the role that leadership and workforce have in all of this. And we're completely reliant on our workforce for this, but with 1.4 million people alone in the NHS, there's a huge opportunity here to bring people on board. But what we really fundamentally need to do is actually increase that knowledge, that baseline knowledge of both adaptation and mitigation actions, because that was really found in our kind of workshops to be lacking really by people in this system, unless it was those specifically involved in incident responses or serious incidents relating to climate change, or be that kind of business continuity plan. So how can we upskill the wider workforce and also system leaders then to actually drive these changes for the longer term? and clearly the importance of resourcing and support, because none of this can be done without that resourcing and support to drive this forward. Something else that came out of this and came out of the kind of the workshops that we were really focusing on back kind of two years ago now. So this was the workshops were attended by kind of national, regional, local and health and care sector organisations. We looked at the framework that I showed to you earlier, you know, based on the kind of the workforce elements and those kind of pillars of a climate resilient healthcare system. And it was really clear that people in the system wanted a climate change risk assessment. They wanted some kind of a tool that could support sites to improve awareness of and preparedness for local risks from climate change, which built on the work of kind of business continuity plans. And so over the last couple of months, the template has been developed and is currently being piloted. And what it really does aim to do is to help sites maintain the continuity of key services in the event of a disruption, preventing long-term impacts from disruption to access, coverage, continuity and quality of healthcare services, whilst also minimising costs that inevitably come during these disruptions. So the pilot tool is currently available and is being predominantly piloted in the Northeast Yorkshire and Northeastern Yorkshire and Northwest regions. And lessons are going to be captured to inform kind of development of a second version, potentially a wider pilot and potentially kind of a national rollout. But we're really using it as an engagement opportunity to really understand what systems want and need and what kind of guidance and support can be given at a national level. And beyond the CCRA pilot, you might ask how all of that work kind of fits in with the National Adaptation Programme. And it's worth just flagging that we're still within the previous cycle, so finishing in 2023. So the CCC does continue to monitor progress against the NHS commitments that were put into NAP2. But in response to the third CCRA, so that was last year, the NHS has been working has been working with government partners to develop NAP3 and specifically the commitments for healthcare within NAP3. And that's very much focused on the outputs of the ARP that we worked on as part of the adaptation cycle, and also in response to the CCRA from 2022. And to be very clear, the NAP3 will mainly contain commitments to address the risks identified from H12, which were risks to health and social care delivery. So it's really about how we continue to deliver services when faced with the adverse consequences of climate change. So just to, and again, you know, these were kind of have been kind of in development for a number of years now. But these are some of the actions that will be given to the healthcare system more broadly as part of NAP3. And they're really focused around things that the system really wanted and what we heard from our stakeholder engagement. So we have very clear kind of green plan guidance of what we expect for trusts and ICSs. And there was a clear desire for us to update that guidance with adaptation and resilience specific guidance as well, so that people could start to develop adaptation plans as part of their green plans. So every trust and ICS in England, does have a green plan. So it's how we can build adaptation planning into those future plans. There was also commitment to focus on that upskilling of the workforce that I mentioned previously. So how we develop e-learning modules on climate change, mitigation and adaptation, and support kind of colleagues across the system in understanding that those two come in parallel, and like, as I mentioned at the very beginning, can really be strengthening in the way that we just develop resilient healthcare for the future. A commitment on the single adverse weather and health plan led by UKHSA, and also updated standards as part of the kind of the EPRR core standards, focused specifically on longer term adaptation planning. And then there's also an element here around metrics. So I've kind of briefly touched on the one of the theme one, which was the focus on these systems. There is a huge still amount to be done on developing metrics so that we can actually monitor how we're doing across our estate and across our various sites. And so what we've done is commission some research to develop a set of metrics to monitor trends in adaptation over time. And what we really hope that these will do is inform local planning and action over the next couple of years. And also it's an opportunity to share ideas on helpful metrics or indicators, because some regions and some systems are really much further ahead than others, unfortunately because of the need of those areas. But there's a huge amount of learning here to be done and kind of collaboration as we move forward. So hopefully that gives you a little bit of an oversight, a kind of a whistle-stop tour of what we're focusing on. But I'll stop sharing now, and I'm very happy to take any questions or take any questions back to Owen and get him to respond back to you if I'm unable to answer them. Thank you, Kat.
Thank you very much, Natalia. It's a complex issue to consider on top of all the pressures that the NHS is going as already in, and the staff shortages, etc. It's just something else that compounds what would be already a challenging situation. So we have a question that is, given the recent spike in attendance to A&E due to pollen and heat, do you think that NHS trusts now need a summer plan as well as a winter plan? I think this chimes in with your proposal to have a joint plan, weather plan, which is similar to what this morning Agustin shared for the UKHSA, that now has an extreme weather and health plan rather than a heat plan and a cold plan.
Exactly that. So I think combining these plans going forward and really thinking about what this means the whole year round as opposed to the seasonal impacts that this has is incredibly important. And so I think it's certainly kind of in the conversations that we're having with local systems who are affected by the heat waves, they are definitely kind of building this into their plans alongside the winter plans that they are also planning. So yes, I certainly agree with that comment.
Do you know if any trusts that have already developed these plans? Because the ones I've been in touch with don't, and there is really nobody actually working in that area, and certainly nobody from a public health perspective. And I may have a very biased sample, I acknowledge that, but I don't know if you know of some that may be helpful for others.
It's a very good question, and I don't know the latest, if I'm honest, Kat, but I can check in with Owen. I'm pretty sure that colleagues in Yorkshire and Humber have some of the most kind of comprehensive plans which cover both winter and summer, and I think mainly related to the flooding incidences that they face. But I can definitely find that out and share that information with you.
Thank you very much. So I think that we have our next presenter here. We have Christine Bash, who is the chair of the Food Special Interest Group of the faculty, and there is a very keen interest on all matters food, and recently also sustainable food and sustainable diets, and the way, and is going to discuss with us or present to us a report that the SIG has been doing. And it's very well, we all have first-hand experience of this when we had the shortage of vegetables and some fruits due to unseasonal weather in Southern Europe and North Africa in the beginning of this year. So Kristin, thanks for coming.
Thank you, Kat. If my connection goes bad, Kat, would you please let me know and I'll turn my video off, because I've been having some connection problems today, so I apologize. Thank you very much for having me. As Kat said, my name is Kristin. I'm a public health consultant. I'm on a career break at the moment, working full-time on a PhD related to sustainable diets. And I also chair the food special interest group with the faculty and the sustainable diet working group. Asking you to come and talk about adaptation was an interesting one today, because in the UK there isn't, and we'll talk a bit more about this, but looking at ways that we'll adapt what we do to meet the needs of climate change, or the challenges, I think. So today I'll be talking about the interactions between agriculture and climate, the circular relationship, and then specifically pulling out sustainable diets as a way that we can potentially mitigate and adapt to that. So just as this context setting slide, going back to 2011, we've known, right? It was definitively concluded that the way we're producing food is compromising the world's ability to produce food, largely due to the contribution to climate change, to degradation to the environment, to biodiversity loss. And so this isn't new. We've known this for some time. When it comes to diet, though, it's been a very difficult journey, and we'll get to that and what we can do and what we about it later. But to start a bit, there we go. I'm going to take just a very brief review about the food system and the environment. I'm assuming this group knows a little bit about it, but I wanted to discuss this mostly because these are some of the co-benefits that we could see if we start making some of these dietary changes. So 1 to 2% of the world's water is suitable for human consumption. 70% of that is used for agriculture, and about a third of that is used for livestock. Soil, not a renewable resource. It degrades at 10 to 100%, or at 10 to 100 times rather, its own ability to regenerate. It's exacerbated by climate change and extreme weather events, increased salinity rates. And the 100% end of that spectrum is also from industrial food production techniques. Eutrophication and acidification, this is from the inputs that we put into our crops. Half of the nitrogen fertilizer that we put on seeps out into our water systems, and algae love nitrogen. And so we get algae blooms and terrible eutrophication. Acidification is largely from the phosphorus, same issue. And I'd be remiss if I didn't talk about air pollution just briefly. Air pollution, I know we think about tailpipes in industry, but 80% worldwide, 90% in the UK of ammonia is produced through agriculture, and ammonia is a key contributor to small particulate air matter pollution. Estimates in Europe are that 30% of the respiratory issues caused by air pollution are that agriculture is the main contributing factor. So we have some widespread environmental impacts, but we're here to talk about climate specifically, right? Climate change and the food system. And I'm going to go back to front a little bit and look at the impacts that climate change is having on agriculture and food. And I don't know if you can, I'm not hearing particularly well, so I'm going to look at some of my notes. So yes, when we look at climate change and agriculture and food, the food production system, we look at some of these, what we know as abiotic stresses. So these are water resources. So the rainfall events, the more unpredictable and extreme weather events that we talk about. Crop yields are very sensitive to temperature and water availability and crop water stress. We also have pests that move up and down on a latitudinal range, and they move into areas where they don't have natural predators. So pests become quite a problem and decrease crop yields. We also have agricultural labor. I know there was a talk earlier about physiology. Humans can only work in conditions within a specific heat and humidity range. And so in certain areas of the world, sub-Saharan Africa, India, Australia, the hottest month of the year, which is also one of the highest agriculture production months of the year, about 50% of the day will be unworkable by 2100 are the moderate estimates. And we also have conflict. So a lot of these issues that reduce crop yields increase pressures on social networks and societies and create links to conflict in areas. So there's a wide range of areas that climate change has an impact on agriculture and food. It's working. And the IPCC has determined that this is already taking place. So agricultural productivity is now over 20% lower due to higher temperatures. We have soil health affected, and it's expected that this will increase. So a 10 to 25% reduction in crop yields with every percent of degree of warming. We're going there. 1 second. There we go. Can you see me? Or can you? Kat, are you still there? I apologize.
Yes, we are.
Oh, thank you. Sorry, I thought I had lost you. Apologies. So yes, so the IPCC has found that this has already contributed and is expected to continue along that range. Something that's surprising to me when I found out, so I do like to mention, is that the climate change and the increased amounts of carbon in the atmosphere has an impact on the nutrient quality of food. So when you or I eat too much food, we don't create more brain cells and muscle tissue, and plants eat carbon dioxide, and they're not creating more of the nutrients that we get from them either. They're creating more sugar and a lower percentage of zinc, iron, and protein across staple crops that feed billions of people as their main source of food. And so this has tremendous impacts on food insecurity, nutrient and insecurity going forward in ways that we don't think. So those are a very quick whistle stop tour on how climate change is affecting agriculture and health. But then on the flip side, so to solve that, we would want to solve climate change, right? But agriculture itself is contributing to climate change. And I assume this group knows quite a few things here. So I'm going through this actually also very quickly. Food systems, the most recent estimates is that 1/3 of global man-made greenhouse gas emissions come from our food system. And we see on the right, if you've not seen this paper, or if you're interested in this, there's a paper by Poor Nemesic, 2018, that our World in Data does an excellent job at putting a graphic together for, which I happily use because it's quite good. And what this is looking at just protein-rich foods and sort of the continuum of animal ruminant meat at the top down to plant-based protein foods. And what the blobs are, they've looked at various different production methods and the range of greenhouse gas emissions that emit from them. And you'll see there is quite a range. The majority of beef is very much the highest, as in lamb. All the ruminant meats are specifically the most harmful. And you go down to the plant-based proteins, and even the most efficient beef production is still creating more greenhouse gas emissions than the majority of beans, peas, and tofu. So this is the continuum we'll see, and we will talk about this in a bit in terms of what we can do and what the mitigation, the adaptation to this is. The other pattern that we see very clearly is that, and hopefully you can see that, that it's the farm stage. It's the brown stage and the green stage on this graph. That's the land use, which is where they knock down trees and clear land of all of the trees to grow crops or for grazing. And also the farm stage, so the farming of animals. This is where the majority of the greenhouse gas emissions are created. Food miles are important, but they are not the main contributor. And again, we see the continuum, or rather the gradient of animal down to plant-based foods in this pattern. The other really important thing to keep in mind when we talk about this, and this is why we'll focus on diets in just a minute, is that it's important what we do in country in terms of production. It's more important what we're consuming. When you look at greenhouse gas emissions from the UK, it's about 10% of what we produce here comes from agriculture. But if we subtract emissions from exported food and add in what we're importing, it goes up by a good 50%. So it's considerably more. A lot of this is feed that's coming in from Brazil and other places. But it's important when we start talking about, particularly around what we're eating, that we're talking about what we're consuming and not just what we're producing in country. And then, of course, food waste is very important. Hopefully everyone knows 1/3 of all food produced globally is wasted. It's a terrible fact. 3rd largest country, if it were a country, after the USA and China in terms of greenhouse gas emissions. And a lot of food, this is probably, I need to update this slide, 60% of 10 million tons is preventable food waste every year in the UK. 700 pounds is surely an underestimation at this point with inflation, but it's considerable on a household level, and it's a definite contributor. Now, why do we care about livestock so much? So livestock is, you will see it crop up, pun intended, I suppose, in all of these discussions. And for the point of discussion here, if we can do a thought experiment and take your view, my view, we each have one of animals, and put it to the side just for a moment and just see them as food making machines. They're very, very inefficient. So when we talk about calories, for every 100 human use calories we feed to an animal, we're getting anywhere from 5 to 20% back. For protein, it's about 25% is the maximum we get from eggs. From every 100 grams of protein we feed to an animal, we're getting very little back. So that's quite a small, yes, they're not very efficient is the point that I'm making. And when you consider that livestock are responsible for 18% of the world's calories and only 40% of the world's protein, it's just a very inefficient way to use not only the animals, but the feed. So all of this feed are creating all of these environmental impacts and all of the greenhouse gas emissions that we're talking about. And so we need to be as efficient as possible if we're, to go and reach our climate goals. So what can we do? It all comes down to what we consume and what we waste. And that sounds quite simplistic and it sounds very easy, but it becomes very difficult because people get very emotional about it. And so it's really walking through that. This graph is a study, it's a study that came out in 2020. And what this is doing is looking at the comparison between various types of mitigation measures that can be taken to adapt the agriculture system, specifically around greenhouse gas emissions. So what this is assuming that everything outside the agriculture system is already being done, right? So to the 67 and to the 50% probability rate. You know how the IPCC has these various levels of probability in their assumptions. Now, assuming that those are all done, if we were to continue along business as usual, we would blow very well past our 1.5 degree limit and be very close to our 2 degree just on agriculture alone, right? Then we have a range of measures. The plant-rich diets is based on the Eat Well guide that came from the Eat Lancet report. Healthy calories is looking at if everyone ate 2,100, an average of 2,100 calories a day. And then you have the production side. So you have high yields. So that's if all of the crops, all of a sudden you've got twice as much per acre per planting. Half waste, again, is if you wasted half, it's what it sounds like. And high efficiency is if all of a sudden everything we produce, just if we found a very efficient way to cut down the greenhouse gas emissions. And these are the estimated reductions in projected greenhouse gas emissions going through to 2050. Now, none of them get us to where we want to be, really, unless we start adding them together. 50% of everything gets us to 1.5. That's pretty good. 100% of all would be brilliant. But the point is that production on its own does not get us where we need to go. We have to have diet intervention. We have to change. We have to shift our population diet if we're going to reach any of our climate goals as it goes forward, as they go forward. So, what is a sustainable diet? There's a definition here from the FAO that I will not read in detail. It's complex, and that's really the point of me putting up here, is that it contains a lot of everything, and it's quite elegant in the fact that it is taking into account culture and fairness and affordability and nutrition. However, it's not practical if you are really just handing it to a director of public health or someone that's creating a catering menu. What do I do with this? How does that work? And in truth, this is really a stumbling block. There's I call it a light touch study that we did in conjunction with the UK Health Alliance and Eating Better, looking at health professionals and how they feel about sustainable diets, how many have adopted a sustainable diet strategy. And what this did was, so all of the people we surveyed were already from health organizations, so they were concerned about health, and they were already part of the UK Health Alliance of climate change. So they already had they were very considerably concerned about the climate. However, even though 71% said they would be willing to take part, most of them did not currently have a diet strategy or policy. And the key barrier, I know I've listed them out here, but the very key barrier, including in the semi-structured interviews that we did, was that they weren't sure what a sustainable diet looked like, right? They weren't sure how to define it. They weren't confident in taking it forward. And that was a key reason, in addition to some lack of support from leadership. we did not investigate what that lack of support was based on. My guess is partly it was also based on a lack of understanding, perceived complexity or sensitivity of the issue, and capacity. But that lack of understanding of a definition was one of the key reasons. So boiling down, what is a sustainable diet? And as everyone here is related to public health, what do we take away? What do we know for sure? And there are some recommendations and some very strong cases made around sustainable diet. And most of them start with a basis of reducing meat and dairy. This is not a call for everyone to turn into a vegan or a vegetarian, but it's a call to reduce the amount of those higher impact greenhouse gas emission foods, largely ruminant meat, dairy and meats, and a reduction. So the Eat Well guide was probably, you are probably very well aware of that, had the most, some call them extreme, or the most considerable reductions in types of, sorry, not the Eat Well guide, the Lancet Commission Dietary Planning Report was one of the more extreme ones, and it recommended an average of 43 grams a day of meat, which is about half of what we eat currently. The Eat Well guide, to meet these guidelines, we would have to reduce beef, pork, and lamb by 11, 34, and 37% of what we're currently reducing. And the Committee on Climate Change is recommending, again, with the range that it provides, a 35 to 50% reduction in meat by 2050. So we have some very clear and well evidenced recommendations for reduction in what we're currently eating in terms of meat and dairy. And the good news is there are very clear co-benefits. So if we look at the combined impact on the environment, and this does take climate into consideration as well as other environmental impacts, but the same pattern holds for climate. And we talk about health, there's a clear overlap between what's beneficial and to both. So we get benefits. If we were to go to a climate-friendly diet, there would be positive health outcomes. I know I talked about meat. Vegetables and fruit don't get a pass, and this is another issue that we need to consider, and it's to a bit of what Kat was discussing in terms of our ability to feed ourselves as a country. So 46% of the food that we eat is imported, and this goes up to 65% for fruit and veg in this country. So when we talk about importing food, I'll go here, one of the main issues is that, particularly around fruit and veg, where we're importing them from are very water stressed and very climate stressed. So although the recent shortages on our shelves, I know was put down to some climate issues in Europe, it actually came a lot down to the energy costs for hot houses in the Netherlands and other places. But there are real risks going forward that when these areas that are climate and water stressed run into more climate and water stress, as we know they will in the coming years, that our food supply, 65% of our fruit and veg, will be affected. And if we go back to this, the other thing to look at here is the graph on the right, which is looking at the change in what we're eating here. So we're not eating as a country the amount of indigenous food types or foods that grow naturally or without a lot of input in our country, cabbage, peas, carrots, that kind of thing. And we're eating much more of the foods that need to be imported or grown under hothouse supply. So this is another risk and another way that we can mitigate our diet in order to keep it more sustainable, just in terms of being able to feed ourselves, as well as not contributing to greenhouse gas emissions and the climate crisis. This is a slide I put in here just to show that there are widespread co-benefits. In addition to health, we also have antimicrobial resistance. So reducing our amount of meat would reduce the amount of antibiotic use in livestock going through to 2030. The majority of antibiotics in the world are used in livestock and animals. And so this is a real risk. So I just wanted to demonstrate that there are widespread, and I could talk for a very long time about co-benefits to these dietary changes. And whereas it's not a focus of this talk, I did want to talk a little bit about food waste, or at least provide resources. So when these slides come around, these each have a link. The government report on waste was put out in 2018. How much action's been taken is, I will leave the decision of you here. But then there's the House of Lords report from the food waste in the UK, and also the LGA has a really good waste route map. So there's some clear policies that you can look at and try to adapt locally for food waste mitigation. But how do we do this? Influences on food choice are vast. They go from individual to global, and targeting any single level of this is ignoring all of the other levels. And so we need to look at widespread and engaging policies. Now, this is the report that Kat talked about. I didn't talk about it in detail because what it really did was make the case, which is what I've done, and talk about how the fact that we need policy support now to move forward with sustainable diets. We know the case is there. We know this is true. We just need to undertake the policies or the policy actions, really. Key barriers are complexity and understanding the definition, which is the thing we've been talking about. Competing priorities, health inequality should be driving this conversation, not impeding it. So when you talk about how can you think about sustainability because, people are having trouble affording food? It's a really valid point. However, making unsustainable, unhealthy food more affordable should not be the goal. The goal should be take that sustainable food and make that affordable. It's a straw man argument to say that it should be cheap at the cost of everything else, because in the end, as we know here, the climate crisis will in fact affect people who are already down the socioeconomic spectrum far greater than it will otherwise. So it's a contributor to health inequalities. There's a complexity in drivers of food choice, as we looked at, and also we need a coordination of multi-level leadership, which is not happening currently. There's a lot of sort of separate discussions. So where to start locally? This is something we talk about in I also chair the Yorkshire and Humber Food Systems Network. Ensure food is a key area of your sustainability and climate plan, and climate is an area of your food strategy. Food and climate go together. When you talk about one, you have to talk about the other. And be confident in setting a target for reduction in meat and dairy served in council-controlled settings. Less does not mean none. Don't get pulled into straw man arguments saying that you're trying to put all farmers out of business or to make everyone a vegan, which is something that councils hear quite regularly when they bring up, a meat-free day. Not all councils, but some. So less can be more support for local regenerative farming, for example. Waste policy is really important in identifying areas for improvement. Local farming and regenerative farming, find ways to support those by including supply chains into local council-controlled catering contracts. And here's for public health professionals, and if you're working on the ground, find your stories, right? Find the way that you can talk about meat and dairy that's comfortable for you, particularly if you work in an area and you're trying to mitigate or instigate change in an area with a lot of, with many farmers. Find a way to easily talk about meat and dairy that you're comfortable with, because what I see is climate policies cropping up in councils and food is left off the table. Again, there's so many, yes, as a pun. So find a way to make that a comfortable discussion for you, even though it's not comfortable in the wider sense, but be comfortable in your facts and your discussion about it. At a national level, we need a clear and practical definition of a sustainable diet. Weaving it into the Eat Well guide is a good place to start. It's not a solution. We know people aren't following the Eat Well guide, but we can't collectively move towards a goal if we don't commonly understand what it is. Embedding sustainable dietary goals into national dietary guidance, policy to support development and consumption of in-country horticulture. This goes back to the local regenerative farming, supporting local indigenous food types. Is a really important step in order to take the stress off of those climate and water stress countries we're importing from, and making sure that we have food supply when in fact that supply becomes stressed. And we need a national food bill that rationalizes all areas of food policy, builds sustainability into other areas of food policy and other areas of food policy into sustainability to harness system level solutions. And that is my today. Thank you. There we go.
Thank you very much, Chris.
Sorry, thank you.
No technical issues, so you can take a deep breath and relax now that hopefully there will be no IT issues until the end of your presentation. Thanks a lot for this tour across all the dimensions of mitigation as well as adaptation of our food systems and our diets. We don't have any questions at the moment, but I have a question for you, which is, how do we, considering all these challenges, there are basically two different types of approaches. We have structural approaches and individual approaches. Which ones do you advocate? And how do you envisage that we can get politicians to act on these, including central government policies and also local government, particularly the latter? How can people in their small regions, in their councils, actually drive these forward, this transition to sustainable ways of eating, which are both good for health, good for the environment, and also resilient to climate shocks that we are expecting in the future?
So that's a no small question, Kat. Thank you. The answer is it's if it was easy, it would have happened already. And that's the reality of the situation. Politically speaking, particularly when you're talking about reducing meat, very quickly turns into a nanny state type of discussion. And that's a very common thing that we hear back from the various councils throughout Yorkshire and Humber, where people are trying to implement sustainable diet policies. Some councils are easier than others. So our suggestion in the work that we're doing is we create sort of a make the case paper for local councils to use that are trying to take this forward so that they have an easy way to discuss it and to demonstrate, particularly embedding it into a climate plan and making sure that, again, food is always in a climate plan and climate is always in a food plan, because usually those two groups they know each other, but they sit in separate places. And where there is a food plan, or a climate plan in particular, trying to find the way to take I say it's a bold action, and to just clearly state the issue around meat and dairy. And this is particularly challenging in areas that have a large farming population. So the way to do it, I think, is to get your policies on the shelf and wait for the opportunities and keep talking about it and keeping comfortable with the discussion and just continue to push, because we've seen progress in places that initially didn't have it. And it's because we continue to keep it on the table in our food systems network. People continue to discuss it and bring it back to the table. So it's not easy, but it's definitely worth. When I first started talking about this back in 2017, just bringing up the idea that we needed to reduce meat was quite controversial, and it's now becoming much more much more accepted and understood. And that's where things start, is there, and then pushing forward. So, and not to get, I can't stress enough that, especially at local level, at any level, not to get drawn into the straw man arguments of you're trying to put all the farm, there are these very specific straw man arguments, and we have it across every possible area of public health, where we get drawn into arguments that are irrelevant, and we need to keep and use our public health skills and our expertise and our evidence to keep people on track and a very clear narrative thread of discussion, if that makes sense. Allison, I see the question, and I can get in touch with you. Leeds is doing a fairly good job, I would say, is my one example. There's some that have challenges, and I can talk to you if you want to write to me. I can definitely have that discussion. So yes, I would be able to do that.
I have another question for you, Christine, which is, and it's wider than you, it's for everyone here to consider, is to what extent, for instance, planning could have an influence in this area in terms of licensing. Licensing of food outlets is done by councils. How do you think that it would be acceptable within the councils and then for the population to have something that kind of a policy where you streamline the approval of food outlets that are vegetarian or vegan in comparison to meat heavy, particularly beef heavy food outlets, fast food outlets?
I mean, my view of that is it would be quite challenging, but it would also very much depend on where you are. And some, very forward-thinking councils may be more I think if you're talking about vegetarian or vegan, that's where people get quite emotional about things. There are no calls in any of the guidelines, even the Eat Lancet, which is the most, it's not severe, it's just the most robust in its reductions of meat and dairy. It doesn't call for a complete elimination of meat and or dairy at all. It's just talking about less. It's the same thing with local farmers. We're not talking about putting local farmers and, you know, regenerative farming out of business and just, you know, having no more beef, just reducing, and everybody reducing the amount. So I don't know the answer to your question, I think is my answer, but an interesting question though.
Yeah, and I agree with you, Byron. Just to clarify, I don't mean that people need to be all vegan and vegetarian. It's just, if you have food outlets, it means that when you go out, you are more exposed to that. It doesn't mean that you don't eat meat in other occasions. It just means that you have that, you privilege outlets that will encourage that type of diet so that you have at least exposure to it.
Yeah.
And I think we are close to our break. We'll now have a 15-minute break and we'll come back to some abstract presentations. Some of them will be touching on local driven projects related to adaptation and mitigation. So thanks everyone. Take the opportunity to rest your eyes from the screen. I'll be back at 3:15. Thank you. Hello everyone. And now we are moving on to our abstracts session, which is going to be amazingly shared by Anna. Anna is a public health registrar in East Midlands, sorry, in East Midlands, and also a member of the SIG and a member of the Climate and Health Committee, helping me and Paul and others at the faculty. So Anna, I'll pass on to you and to take us through the next session. Thank you.
Thanks so much, Kat. So as Kat said, the next session is a series of 5 abstract presentations, all relating to various aspects of adaptation. We've got fairly short timescales for each, so 10 minutes per presentation, ideally with a little bit of time for questions within that. So if speakers could try and limit presentations to about 7 minutes, so we've got some time for questions. And then if anyone does have questions, please put them in the Q&A. So our first speaker is Jack Haywood from the London School of Hygiene and Tropical Medicine, and he is going to be talking to us about health and sustainable development, barriers and drivers in implementing sustainable transport policy in Copenhagen, London, Mumbai and Shanghai. Thanks, Jack.
Good, Michael. Let me try and share my screen here. Can you?
Yeah.
That work there?
Yeah, perfect. In presenter mode.
Great. Oops, sorry. So I'm not used to Zoom, so just excuse me for 1 second. Right. Hello, everyone. My name's Jack Haywood. I am a public health registrar in London. As part of my master's in global health, I completed my dissertation on barriers and drivers in implementing sustainable transport policy in Copenhagen, London, Mumbai and Shanghai. So it's not a local initiative, but provides and recommends some principles for policy making. So just kind of looking at the background. So we all know, and I don't need to go through this in detail, that human-induced greenhouse gas emissions and particulate matter exposure have both health impacts, both globally and directly and indirectly. And we know that transport contributes to a large proportion of these. In just one country, for example, the United States in 2020, transport contributed 27% of all US global greenhouse emissions. So sustainable transport policy is one way we can reduce these emissions. And this was reflected in the World Health Organization COP26 Special Health Report, where one of the recommendations was to prioritize walking, cycling, and public transport. So many cities across the world have sustainable transport policies, encouraging a shift from motor vehicles to private and public and active transport. But both have to be implemented and designed in a way which is attractive to the end user in order to realize environmental and health benefits. There has been very little kind of context-specific analysis assessing if the drivers and barriers of their uptake by people who live in and work in these cities has been acknowledged in policy in order to ensure successful implementation. So what my work aimed to do was to assess if known context-dependent barriers and drivers of active and public transport uptake are acknowledged in sustainable transport policy to enable successful implementation and thus improve human health. And I selected 4 cities, but 2 in high-income countries and 2 in middle-income countries, and they were the 4 cities I outlined earlier: Copenhagen, London, Mumbai, and Shanghai. So to do this piece of work, the methodology kind of came into 2 separate parts. So first of all, I carried out a grey literature search to look for the sustainable transport policies from the 4 different cities and review these to identify any barriers and drivers of implementation and uptake that the policymakers had already kind of integrated into their policies and kind of had built in ways to kind of mitigate these. The second part was a literature review with systematic approach, which was then to identify active and public transport uptake in the 4 cities. And I did this by searching 4 databases which were closely related to sustainable transport, which were Global Health, Medline, Greenfile, and Web of Science. And a combination of search terms were used based on the research question to compile the search strategy. Had a few inclusion and exclusion criteria, which I won't go through in detail, but essentially had to be published in the last 10 years, but before the policy that I identified in the first step was published, was in English, and had a focus on active and public transport in the city. So just briefly, having searched for databases using the search strategy, there was 826 results, which were reduced to 734 once duplicates were removed. 43 after title and abstract screening, 43 met the inclusion criteria, and a full text review was carried out, where 13 were excluded because it kind of covered several cities, or that it was actually on a national basis rather than a city basis, and resulted in 30 studies included in the analysis. Now, it may not surprise you that there is an imbalance in where the studies were located of the 4 cities I investigated. So 12 were originated in London, were investigating barriers and drivers of sustainable transport uptake in London, 7 in Copenhagen, 6 in Shanghai, and 5 in Mumbai. And this table on the right here just demonstrates what kind of transport each study was looking at. This equals more than 30 because some covered both. But as you can see, from Mumbai, there was no studies looking at drivers and barriers of active transport in Mumbai. Slightly more equal in the other cities. So what did this tell us? Well, doing a thematic analysis of the studies that came from this search strategy, there was 5 kind of overarching themes about barriers and drivers of people living and working in these cities taking up public and active transport. First of all, the physical environment. So this theme relates to how and where the transport modality is located, its land use, the traffic and road characteristics, how accessible the transport modality is, how safe the surroundings are, and the neighbourhood quality. And these were all important aspects when an individual was deciding whether or not to take up a specific public transport option. Then there's transport conditions themselves. This is, the transport characteristics, such as how long it takes, how crowded it is on board, how convenient it is to use, such as the number of connections, or how well the transport modalities are connected, the condition of the station or the stops, and the overall quality. There's transport policy decisions, which relates to what decisions are made at a policy level. And this includes how much it costs to use these, the political environment, particularly in London, where there is a really fragmented transport policy infrastructure. Fiscal measures such as the use of congestion zones, and then the variety of modalities offered. Next, the modifiable social environment, so looking at where people live and work, and their characteristics such as deprivation, employment, and dwelling. And finally, individual factors such as what people wanted to do, what they wanted to use, and there was a large role of symbolism, particularly of car ownership in middle-income countries. So I've raced through the themes, but it obviously goes into quite a bit more detail. So cost and speed of active and public transport were important in all cities, but there were differences in focus. As I said, symbolism in middle-income countries, and crowding was particularly important in Mumbai. But it made clear, as is not surprising, that a one-size-fits-all will not work, and there was a large gap in middle-income-based literature. And then the comparison between the literature review and the policies found that many of the literature and evidence-based barriers and drivers were not acknowledged in transport policy. And actually, there were also lots of barriers and drivers in the policy which were not in the evidence. So clearly, there was not kind of evidence-informed policy creation, which may not be a surprise, but I think it was important that this was recognised in all 4 cities. So to ensure that policy making is successful, we need context-specific evidence with a health and health policies approach to ensure that health benefits are gained. So our recommendations are based on the back of that, ensuring that there's a detailed review of literature, that all transports forward and quick, that there must be engagement with organisations and departments from early stage, including with health actors, to ensure that health and health impact assessments done to ensure health aspects are considered, and that we need more evidence from middle income countries in order, especially in the phase of development that they're in, to ensure that they're using sustainable transport options. I think I'm just over time, so I'm going to stop, and I'm happy to take, I think, perhaps one question.
Thanks so much, Jack. That was great. And yeah, great timekeeping. I can't see any questions currently. I don't know if anyone has got anything burning at the moment. Otherwise, we might move on to the next speaker if that's okay. And if something comes up in the chat, then if you could answer, that would be really helpful.
Yeah, thanks.
Thanks so much. So the next speaker is Jess Dickin, who's from the European Centre for Environment and Human Health at the University of Exeter Medical School, and she's talking to us about a local climate adaptation tool that supports health and well-being. Over to you, Jess.
Great, thanks very much for having me. So my name's Jess Dickin, I'm a research fellow at the European Centre for Environment and Human Health, which is part of the University of Exeter. We're based in Cornwall on the campus here. I'm going to be talking to you about the local climate adaptation tool and specifically how it supports health and well-being. This is a partnership project between ourselves at the university, but also with Cornwall Council, a not-for-profit called Then Try This, the Alan Turing Institute, and funded by Blue Adapt, which is co-funded by the European Union and UKHSA. This partnership project kicked off in 2020, just before the COVID outbreak. We started by doing some scoping work with decision makers in Cornwall. We were interested in working out how we as a centre, using our expertise, might support local decision makers in Cornwall around climate adaptation. And so we went into a period of scoping with them, what they're doing on adaptation and how might we help. So some of the initial findings were that limited action was taking place at that time. And in fact, a lot of those decision makers were in organisations who were only then either thinking about or about to launch climate emergencies. And with that, a focus on mitigation. Some of the barriers that they talked to us about around taking action on adaptation, including lack of financial or time resources, a culture of short-term decision making, a lack of expertise, and as a result of that, a lack of confidence, but a real desire to do this work and for that work to be done as a cross-service and partnership agreement to try and cut down some of that siloed working that many of them were used to in their places of work. In terms of the concerns they had around a changing climate, they really focused on inequality as well as concerns around mental health and isolation. One of the key barriers as well was around generating local climate models, because for local decision makers, they first needed to start with understanding what the future climate would look like, and they felt that that was not available to them. And in fact, where data was available, many reported that they needed, for example, what they felt was a whole degree in climate data to be able to fully understand and break down some of that data that they thought they'd found. One of the other things was that they felt that once they had that climate data, they really needed some guidance or a tool to support them to work in that area. And so really our work then began at that point to co-design with them a specification for a tool which would meet some of those needs. So the aim of the project became to co-design a digital tool, and that tool would support local decision makers in finding evidence-based adaptation solutions to the effects of climate change. And we would do that by using health as a common language, which is in part because that is our area of expertise. We're interested in the intersection of the environment and health, but also because stakeholders were, and by the way, continue to report to us the importance of using health as a lens to talk about adaptation, because it's relatable, it personalizes the subject area. And also for us taking a public health approach, it allows us to show every sector that they have a role in supporting the health and well-being of our communities into a changing climate. And so the idea really with the specification is to design a tool where you would select your geographical area, you'd view the local climate model, you'd explore the health impacts and the complexity of that by using complex health mapping, the impacts of that change. More recently, we've added to our prototype some information about who is vulnerable locally. And then crucially, and the most important part for our stakeholders is telling them what they should be doing about it according to the evidence. And so at the end of 2021, we had our first prototype that we took to COP in Glasgow. And at that point, we were able to shift slightly away from Cornwall, and funding allowed us to move to a UK-wide tool and UK-wide co-design with decision makers across the whole of the UK rather than just our Cornwall focus. And so to date, we have a really active stakeholder group representing over 50 different local authority areas across the UK and across all of the different UK countries. And those decision makers largely sit in climate change roles, but we've been mindful to make sure that we have representation across different sectors because of the way that this specification was put together and the design of this tool being for all sectors. And so the prototype link you'll receive afterwards. I would say that, so we're in our second prototype phase. We're currently working behind the scenes on our third, and that will be published later in the year. So in terms of one of the most important themes coming through from our stakeholders, both at the start of our scoping work and then in our research with them to date, with our wider UK base of decision makers, is this idea of inequalities being a real concern for them, and included in that a need and want to take a just and equitable approach to adaptation. So we have used the IPCC's definition of climate justice, and we're able to attend to some of that definition in the way that we have designed the LCAT tool. So you can see here the term climate justice, while used in different ways in different contexts by different communities, generally includes three principles, which is around distributive justice, which refers to the allocation of burdens and benefits among individuals, nations and generations; procedural justice, which refers to who decides and participates in decision making; and recognition, which entails basic respect and robust engagement with and fair consideration of diverse cultures and perspectives. So in terms of that first one, which I've highlighted in black, the allocations of burdens and benefits, we've been working with the team at University of Manchester, who created a number of years ago something called the Climate Just tool, which I'm sure many of you know about already. And so what we're able to do is draw down data sets from that tool into ours and build in some vulnerability data to help those local decision makers to understand that allocation of burdens and benefits among individuals and identify those who are vulnerable. And I suppose in terms of our future steps and our ambitions, it's trying to think of those other two parts of that definition, particularly around who decides and participates in decision making. We've certainly heard today a few members of the panels talking about that importance of working with communities in an equitable way, without hierarchies, And that's something that certainly in time we're going to work on, trying to give a bit more advice and guidance to the users of our tool on how you take an equitable approach to adaptation and how you include and involve your communities. In terms of the tool supporting what we might term as good adaptation, again, I'm just referring you there to the IPCC report. So they talk about the fact that maladaptation can be avoided by flexible, multi-sectoral, inclusive and long-term planning and implementation of actions with co-benefits to many sectors and systems. And so LCAT supports that approach by providing a multi-agency approach to tackling climate adaptation. So I've got a screen grab here of the complex mapping that we have developed, which allows users to go on a journey and understand not only where their place is for the sector that they work for, but to understand the complexity of the relationships between the climate that we are going to have now and in the future, but also the kinds of impacts and then health outcomes we're likely to see. And then in that separate section later on, it tells them what the evidence base says they can do in terms of taking action. I suppose the other thing that I would say supports good adaptation and refers to that equitable approach is that we've done all of this in co-design with our partners from the beginning. It was really them with us generating the initial ideas and spec, and we continue to take that approach. And the focus of the adaptation actions are short, medium and long-term adaptation actions. So that attends to that need to look for long-term planning. In terms of our current focus and challenges, I mentioned that we've currently got the second prototype available to view, and later in the year we'll publish a more complete version. So in that we will have national climate models, and you'll see an idea of that in the prototype. We'll be developing more impact pathways. So for example, in the prototype now you'll see one around heat, but we're now going to be doing one on temperature. So that will include cold, coastal security, extreme storms, flooding and drought, and food and personal security. And into the future, we hope to develop even more impact pathways and maps for people to understand. We're going to be improving the functionality, which includes improving the functionality of the vulnerability data, providing, for example, what our stakeholders have asked for, which is a bit more detail about who's vulnerable, why, and links out to more information. Stakeholders have asked us to rise to the challenge of showing them the so what of the climate data that we provide for them in the current prototype. So one of the ideas we're working on is how we might draw down different data sets around localized risk data. So what's the local risk around flood, heat wave, coastal erosion, wildfires? And then the other thing we're developing, again, attending to feedback from stakeholders, is a knowledge and skills resource that will sit alongside the LCAT tool. And so this resource we're creating in partnership with both our national stakeholder group, who I mentioned come from across the whole of the UK, but also with a bit more of a deep dive with colleagues at Oxfordshire County Council and across that patch into NHS organisations there, the charity sector also, and co-developing a resource which will help plug some of those gaps around basic knowledge and understanding of climate change so that they have that before they start using that tool, which means they can maximise the way they use that tool and their understanding when they see the data sets we provide. And I suppose the other key thing really is just trying to keep a tab on national policy and practice. And we have good links into national policy makers and their different departments and organisations so that we can make sure that the tool we're creating sits within those frameworks as well as local policy and practice frameworks, but also so that we can work together to make sure that we're cross-pollinating and sharing particularly data. We know that's been a key theme for our stakeholders all the way through, really, is this idea that they would really like one place for all data rather than feeling they have to go to different places and then try and understand different models and ways that those data have been generated. So in terms of finding out more, there's a link there to the project page, and you can also email me. If you'd like to be involved or you're interested in working with us, you can email me directly. We're always open to conversations and really, really up for collaboration. So if anyone's got any questions now, I'll stop sharing my screen.
Thanks, Jess. That was really interesting. It sounds like a really useful tool. I, again, can't see any questions at the moment, but if anything occurs to anyone, then please put it in the chat, and if you mind keeping an eye on it, Jess. And I think we'll just move on to the next speaker, if that's okay. So next speaker is Tracy Evans, who is a Senior Sustainable Development Officer at Public Health Wales, and she will be speaking about research on the impact of the COVID-19 pandemic and shift to more agile working on the Public Health Wales carbon footprint. Thanks, Tracy.
Thank you. Yes, good afternoon. I'm Tracy Evans. I'm a Senior Sustainable Development Officer within the Health and Sustainability Hub at Public Health Wales. And I'm just going to present to you the research project looking at the impact of the COVID-19 pandemic and the shift to more agile working on Public Health Wales's carbon footprint. Looking at the background, the COVID pandemic led to new ways of working with a large proportion of our staff working from home for at least part of the working week. It also impacted on our services with an increase in lab activity and an increase in staff numbers. So the focus of this study was to calculate our 2019-20 pre-pandemic and our 2021 mid-pandemic carbon footprints to compare the difference and identify the impact of the shift to more agile working on our carbon emissions. We used internal data to calculate our business and site emissions and our business travel emissions, and we used an online staff survey to capture home working and commuting emissions. And as part of that calculation, we also used best practice guidance from Welsh Government's Welsh Public Sector Reporting Guide and also the Eco Act white paper on home working emissions. The study focused on 4 key areas of emissions: procurement, travel, which is split into commuting and business travel, business and site operations, and home working. And when comparing our 2019-20 against our 2021 emissions, overall, our emissions increased significantly by 161%, but this was due to the increased procurement spend during 2021 linked to our response to the pandemic. Excluding procurement, our overall emissions reduced by 48%. And the results in the report have been provided including and excluding procurement to highlight the emissions that Public Health Wales have the most direct control over. So I'll just run through the results, the insights and recommendations for each emission area. So looking at our business site emissions, so these include emissions from energy and fuel consumption across our sites. And overall, our business and site emissions reduced by 29% between the 2 years. The most significant reductions were our gas oil consumption, which reduced by 62%, and the operation of our vehicle fleet, which reduced by 67%. Our grid electricity only marginally decreased by 1.4%, and our natural gas consumption actually increased by just under 10% between the 2 years, although this is most likely due to the increased heating requirements of the buildings which remained operational during the pandemic. Looking at some insights and recommendations, ideally it's key to increase the proportion of energy sourced from green and renewable tariffs, and also to revise our existing building management systems to reduce any unnecessary energy usage. Looking at our travel emissions, these include staff commuting, which is the use of personal vehicles and public transport, and business travel, which covers staff using their own vehicles and hire cars for Public Health Wales business. And overall, our commuting emissions reduced by 60% between the 2 years, and our business travel reduced by 78% between the 2 years. And these reductions are linked to the restrictions imposed on non-essential travel during lockdown. And the majority of our business travel emissions, 77%, for both years was associated with staff using their own vehicles. So looking at the insights and recommendations, personal cars are by far the most preferred method for commuting and business travel. We should encourage and support staff to use public transport and active travel where feasible for commuting and business travel. And we need to conduct further research and collect data around commuting behaviours to have a better understanding of this within the organisation. Looking at our home working emissions, these cover emissions from heating, waste and power. We didn't have any home working data for 2019-20, so we're unable to calculate the impact of the pandemic on our emission levels. But as part of the project, we were able to calculate home working emissions for 2020-21. And our home working accounted for 16% of our total emissions in 2020-21. And looking at the breakdown, heating accounted for 62%, waste for 24%, and power 14%. And home working emissions were found to have a lower emission footprint when compared to the combination of commuting and business site emissions. And looking at the insights and recommendations, Ideally, we need to explore opportunities to share space within our estate, within the wider public sector, but also look through our Work How It Works Best initiative to determine the proportion of workforce that could potentially work from home on a more regular basis. Our procurement emissions account for the majority of our total overall emissions, and there was an increase of 244% between the 2 years. And to put it in monetary terms, procurement costs increased from 31 million to 94 million. And this is due to our response to the pandemic, including additional healthcare supplies, PPE, equipment, and lab demands. And looking at the insights and recommendations, ideally it's key to engage with our supply chains to capture information regarding supplier and product emission footprints so we can identify where sustainability options have been chosen. So just to summarise, looking at the left-hand side of the screen, it shows how significant our procurement emissions are. And then when we exclude these, looking at the right-hand side, it shows how significant travel is compared to other site emissions. And overall, excluding procurement, the impact of the pandemic and the shift to more agile working has had a positive impact on our carbon footprint. It's reduced our emissions in specific areas, and it's highlighted where we can continue to capture and increase the benefits to sustainability and to reduce our impact on climate change. Just looking at the next steps, the key is to evaluate the recommendations and highlight the quick wins, along with the short, medium and long-term actions, and to also identify the emission reductions associated with each action and the resources required, including budget, support and engagement within Public Health Wales. Thank you for listening. I'd welcome any questions, and I'll stop sharing.
Thanks very much, Tracy. That was really interesting as well. I suppose I can't see any questions. I just have a quick one myself, which is this now being used to consider the kind of policies going forward for Public Health Wales? Is it actively being used in that sort of agile working?
It will be. We've just finalised the report and presented to our Climate Change Programme Board. So hopefully it will support our decarbonisation action plan as well going forwards.
Thank you so much. That was great. And yeah, if you could keep an eye on the chat in case there are any additional questions. Thank you. Our next speaker is Miho Yoshizaki, who is from the public health team at the London Borough of Haringey, and she's going to speak to us about improving heatwave preparedness in Haringey.
Thank you so much. Sorry, it took a while to unmute myself. Hi, everybody. My name is Miho Yoshizaki. I'm a public health registrar at Haringey Public Health, and I'm going to talk about some of the project work that we're doing at the moment to improve heatwave preparedness in Haringey.
Miho, just before you continue, your slides are on the mode where we can see your next slide as well, so it might be hard for people to see.
Okay. How do I... Let me reshare the screen again.
Thank you.
Is that better?
No, Miho, you need to stop presenter view. That works in Teams, but doesn't work in Zoom. So you really need to share without your next slide.
Okay. Sorry, I'm not used to Zoom either. So how do I stop the presenter view and the...
If you go to the normal view, and if you try to share as you would normally share. Anna, do you have the slides? Do you want to share the slides?
Yeah, shall I share them? Would that be useful?
Yeah, let me try this again. And Yeah, if you can share the screen, thank you. Sorry about this.
Don't worry, that's why we've got the slides too.
Thank you.
I'm hoping that this will share shortly. Can you see?
Yeah, I can.
You can see your
presented mode. It's not presented. It's not in lives. Yeah,
Thank
it is
you.
now, Annie.
Yeah, so if you can move on the
you.
next one.
Yeah.
Yes, apologies, everybody. So really, to just give you a very brief background, during the quite severe heat wave last year, Haringey also experienced a lot of pressure, and impact was really felt in Haringey too. Negative impact was seen in population health. For example, excess deaths was 20% higher than 5-year average in Haringey. But also system felt a real pressure. One of the providers has declared critical instance over bed pressures, and across the board there were lots of pressure on the system as well. Next slide, please. Next slide, please. Sorry. Oh, the next one, sorry. Yes, so the aim of the project was firstly to understand immediate and longer term challenges and opportunities in preparing for and responding to heat waves, and also to orient action planning to improve heatwave preparedness, response and resilience in Haringey, and really particular focus on the people who are most vulnerable to adverse health impacts from heat waves. Next slide, please. In terms of the methodology, we did a couple of different things to really inform our work. So firstly, we did epidemiological analysis looking at vulnerable population and vulnerable settings. I also did a quick rapid evidence review to look at different strategies to really to protect vulnerable population groups. And stakeholder engagements was done both at individual level and also workshop level, and workshop included wider stakeholders, so providers from local social care sectors and voluntary community sectors as well. Next slide, please. So just going to highlight some of the analysis, the kind of results that we've done. So vulnerable population in Haringey. So this map is showing the older population group, those who are living alone, as a proportion of all households. And as you can see, there's a high concentration in the west of our borough. And the next slide, please. And when you look at 0 to 4-year-olds, younger population, these are concentrated in the east of the borough. And we also know that these east of the borough are also areas of high deprivation in Haringey. Next slide, please. And another important sort of risk group are those who are working in physical profession. And again, there's a concentration in the east of the borough, which overlaps with the deprivation. Next slide, please. Just to showcase one of the results. So we overlaid the vulnerable settings on the climate risk map developed by GLA. So the red areas are considered to be higher risk from the heat. And this is showing a care nursing home locations. These are really helpful for us thinking about how we might prioritize resources if we need to support them. But also it was really received well from the providers and, for example, schools as well, to really raise awareness of the risks that they're experiencing. Next slide, please. In terms of the strategies to protect vulnerable populations, so this is based on the rapid evidence review, really kind of detect, warn and inform has come out as really kind of strongly evidence-based methods to help support the vulnerable population group. In terms of cool spaces, while there is not a clear sort of evidence of effectiveness in terms of reducing mortality and mobility, there are lots of evidence around what factors affected in terms of access and perception and the use of the cool spaces. So these all informed our kind of plan and thinking around how we might want to improve our preparedness. Next slide, please. So very high-level summary from the stakeholder engagement. There were general consensus that we responded very well last year, but they would have benefited from greater and more tailored support. So this was what we were originally sort of anticipated. And in terms of what went well, communications and information sharing were perceived as something that went well last year, and practical actions implemented locally, but very rapidly as well. In terms of the challenges, not much time to prepare once an alert is issued, lack of practical advice and guidance, lack of clarity around priorities, and infrastructure and cooling resources issues. And based on that, and also there are further kind of additional support needs identified around practical advice and guidance, proactive and targeted communication, expanding of coverage of cool spaces and feedback loop. And kind of two areas of questions and concerns that were raised quite repeatedly was around how we can ensure that we are reaching out to the most vulnerable population, and also kind of consideration around what the council should or could do to support vulnerable individuals. This is in particular those who are reside in home and receiving care in home, or potentially receiving care from their loved ones as well. Next slide, please. So in conclusion, based on this, there are a series of works that are currently happening in Haringey. Advanced Weather and Health Preparedness Group was set up in Haringey, and this is really aiming to improve the preparedness element and also collaboration element within Haringey. So that include council and NHS and voluntary sector as well. And we're also rapidly developing local practical resources. We're also setting up community-based cool spaces program and strengthening the communication strategy, including a bit more targeted approach. So we are exploring things like GP text messages to targeted population group. And in terms of the longer term resilience piece, my colleague is leading on JSNA on heat and health and looking at longer term adaptation recommendations, and really hoping to take that through at strategic level, and also working to influence high level strategies, things like local plan in Haringey. And a couple of reflections. So this has been mentioned multiple times in the morning sessions as well, but we do also believe that longer term adaptation measures must be considered along with the short term actions identified to improve preparedness. And I think to highlight, currently there's a gap in funding to support local preparedness and response to heat waves, when there is a kind of specific funding for cold weather, and in order for local area to really support vulnerable population group and respond to the extreme heat, this area needs to be considered kind of in future as well. Next slide, please. I think that's my last slide. Thank you very much, and apologies for the mishap on the slide as well. Thank you.
Thanks very much, Miho. That was very interesting. At the moment, I don't see any questions, but similarly, if you could just keep an eye on the chat and answer anything that comes up, and we will move on to our final speaker, who is Maria Picciocchi.
Hi.
Hello. Sorry, I'm switching between screens. Yeah, who's from the University of Birmingham and is going to speak to us about elective surgical services and their need to start planning for summer pressures. Thanks, Maria.
Thank you for the introduction, Hannah. I'm just going to share my slides. I think you can see them now, right?
Yes, the last slide at the moment.
Oh, yeah, sorry. Yeah, so my name is Maria. I'm a PhD fellow at Global Surgery Unit here based at University of Birmingham, and I'm also a general surgical trainee. I'm here on behalf of the Green Surge Collaborative. We did this work last year during the heat waves, and to give an overview and a bit of the background, heat waves are expected to occur more frequently with time. And last summer, there were 3 documented in the UK. And as we all know, all the elective services independently of being surgical services or any other elective services in the hospitals, are very prone to external pressures, as we saw with the pandemic and as we see every winter when there's a bed pressure from other patients. So our aim with this study was to determine the impact of heat waves on elective surgery in the UK. And to achieve this, we created a survey that we disseminated to frontline teams, and we defined frontline teams as surgeons, anaesthetists that were working during the week of 17 to 19 of July. There was one of the heat waves last year. And our aim with this survey was to try to measure the impact of the heat wave in elective surgery, as well as try to understand what was the level of preparedness of elective surgery across different hospitals in the UK. So going to the results, we got 271 responses that were representative from 140 hospitals in the UK, and 20 specialties were represented in this survey. And what we found was that the heat waves resulted in the cancellation of elective surgery in one of each 5 respondents, and that 41% of all the operating theatres were unable to control ambient temperature, and this was mainly justified by a lack of air conditioning to be able to have the standard temperature that is needed in the operating theatre. Also, we tried to ask what were the reasons behind the heatwave related cancellations of elective surgery, and staff shortages was the main reason, followed by unsafe theatre environment, bed shortage, mainly justified by an increase in emergency admissions, and lastly, increased emergency workload. So there was a deviation from the professionals to cover emergency services. So now to what I think it's relevant to discuss from this is what can we do from next heat waves, or for next summer at least. So planning before a summer is definitely needed, as there is one for winter, for instance. Definitely air conditioning coverage needs to be improved overall. And we came up with a checklist for operating theatres that could be implemented during heat waves, or at least in the preparing for the heat waves. And I think there is some learning to get from other countries that are more used to higher temperatures overall over the year. So the checklist that we are proposing is this one. So what we are suggesting is that each hospital should have someone responsible to apply these heat waves checklist and to deliver a plan for the operating theatre before summer. And then that person should check if the operating theatre is able to function during heat waves, especially considering the ventilation systems and every equipment that could be at risk of overheating. We also suggest that, considering that staff shortages were the main reason for cancellations, maybe a backup staff would be useful during heat waves in case there is someone that might not be able to get to the hospital. And then if it is expected a surge in emergency admissions, what are the strategies to maintain surgical activity throughout? And this can be either by ring fencing elective surgery beds, or even switching the procedures that can be done as day case instead of admitting the patients because of the bed's pressure from the other patients. Thank you very much. I'm happy to discuss this further and to take any questions if there are any.
Thanks, Maria. That was great. Some really interesting statistics about the kind of level of air conditioning and ability for theatres to maintain temperatures. I can see there is a question from Sarah Langford, who says, "Thanks, lovely presentation. I found your results interesting. I'd assumed that bed shortages would be the main issue. Was it possible to find out the specific cause of staff shortages during the heatwave?
So we didn't ask more detail about what was causing the staff shortages. However, I think that considering that there were some schools closing during that period, probably I would say that doctors or nurses who had children that they weren't able to find someone to take care of them probably won't be able to work during that time, for instance. But we didn't, unfortunately, we didn't collect any data in terms of to understand why there was this staff shortage.
Thanks, that's really useful insight. Thank you. I don't think there are any other questions. Oh, thank you from Sarah.
Thank you.
But no other questions at the moment, so I think I will hand back to Kat a few minutes early.
So thanks, Hannah. I think Kat is having to be called away, so I will just carry on with the next bit. But thanks, Hannah. Thanks for a really, 5 very interesting abstract presentations, and really good to hear the local work. And thank you for all of you for putting the time aside and sharing that. Kevin, wonderful, you're here. We're a little bit earlier. Great to see you. And thanks for coming in a bit earlier as well. I think we're probably going to be finishing earlier than planned, which is, I'm sure, good news for everyone who's been here all day like me, but it's been a fascinating day. So Kevin, over to you for some final thoughts and reflections.
Great. Thank you, Paul. Great to see you, Hannah, and Kat. Great to see you. So colleagues, I'm Kevin Fenton. I'm the president of the Faculty of Public Health, and I'm so pleased to be here with you. Albeit at the end of the session today, I've been able to drop in and out of some of the really excellent presentations this afternoon. And it's just so wonderful that we've had a day to continue the conversations on climate, health, mitigation, adaptation, and justice. And it's wonderful to be able to do that together and to learn from each other. So let me begin by saying thank you to all of you who are here, still on the call. I know the numbers are slightly less than at the beginning of the day, but just the level of discussions that we've had, the presentations, I continue to be impressed and inspired by them. So as you all know, we have identified climate and health as a core priority for us in the faculty. As the president or climate subcommittee and our special interest groups, we're all working together to ensure we continue our advocacy, visible leadership, invest and support training and capacity building on these important issues for all of us as public health practitioners. And I'm really excited about the dynamism of our colleagues working in this space and the accomplishments that you've had throughout the year. So let me acknowledge that this is a key priority for us in the faculty, and we will continue to support this exchange of ideas, of thought, of leadership on this issue. Now, climate change is increasingly apparent in the United Kingdom, and mitigation, whether it's energy transition across all sectors of the society and economy, has been slower than we have desired. So we know that even if net zero pledges are achieved, which is unlikely at current pace, the level of GHG already in the atmosphere means that we will need to adapt to living in a much more warm world, an increasingly warmed world. Today, we had experts from different sectors that are seeing the impact of climate change, and were able to present to us the amazing work that's being done and amazing work that's underway. But also our presenters throughout the course of the day have identified the areas where we need to do more, and where we need to do more to avoid the disastrous consequences of climate change on our health. It is important that as part of this work that we're not forgetting that the effects that we're seeing on climate change is also going to have an impact on exacerbating health inequalities as well. And we know that this is going to be a particular problem for us as public health practitioners, and why our advocacy on climate justice is equally important, whether for overall impacts of climate change, but also climate justice and inequalities and equity in the mitigation and adaptation space as well. The most vulnerable among us are not only likely to have greater exposure to climate change effects, but are also less likely to adapt as well. And as we are emerging from the acute phase of the COVID-19 pandemic, which really laid bare a number of inequalities within our society, it is important that we take this opportunity as we recover from the pandemic to ensure that our conversations on equity, on disparities, on justice are brought into all aspects of our practice, including our work on climate and health and climate adaptation. So today, throughout the course of the conference, given the presentations that you all heard, we're able to reflect on how adaptation needs to take place across multiple sectors, such as the food, built environment, healthcare. And the good thing is public health has had really great relationships with these sectors. So the idea for the discussions today were to look at the developments in these areas and to question what more we can do as public health practitioners. And this is important because as professionals, we bring our skills in our ability to develop effective partnerships, or skills in bringing public health principles and approaches to understanding these long-standing and emerging issues in different ways, and our skills in working across organizational boundaries so that creative solutions can be brought to bear on some of these issues as they're emerging. Also, as we went through the course of the day and you heard the various presentations, I think it really underscores the importance of continuing to invest in training and capacity building of our workforce. The reality is that finding the space to keep abreast of the developments in this space will become increasingly difficult, as many of us are dealing with busy day jobs where we're pulled in many different directions to focus on many different priorities.